So our next topic is anti-cancer drugs, antifungal agents, antibiotics, antitubercular drugs, urinary tract anti-infectives, and antiviral drugs. So let's see. Question number one: Penicillin acts by inhibiting cell wall synthesis. Penicillin is a cell wall synthesis inhibitor. Drug of choice for tuberculosis is isoniazid. Anti-cancer drug causing bone marrow suppression is a methotrexate. Methotrexate causing bone marrow suppression. Antifungal drug that inhibit ergosterol synthesis is ketoconazole. Ketoconazole inhibits ergosterol synthesis. A broad spectrum antibiotic is tetracycline. Tetracycline is a broad spectrum antibiotic. Next, rifampicin acts by inhibiting RNA polymerase. Antiviral drug used in HIV is zidovudine. Drug of choice for candidiasis is fluconazole. Fluconazole is a drug of choice for candidiasis. Antibiotic inhibits 38 ribosomal subunit is aminoglycosides. Aminoglycosides, all aminoglycosides inhibit 38 ribosomal subunit. Anti-TB drug causing red discoloration of urine is rifampicin. Anti-cancer drug acting as a folic antagonist is a methotrexate. Methotrexate act as a folic acid antagonist. Antifungal drug binding to ergosterol is amphotericin B. Amphotericin B binding to ergosterol. Antibiotic of choice for enteric fever is ciprofloxacin. Ciprofloxacin is a drug of choice for enteric fever. Anti-TB drug causing optic neuritis is ethambutol. Ethambutol causes eye-related problems like optic neuritis. Urinary tract antiseptic is nitrofurantoin. Nitrofurantoin is used as a urinary tract antiseptic. Antiviral used in herpes simplex infection is acyclovir. Okay. Acyclovir used in herpes treatment. Bactericidal antibiotic is penicillin because it inhibits cell wall synthesis inhibitors. Anti-TB drug causing peripheral neuropathy is isoniazid. So, for preventing peripheral neuropathy, we use isoniazid pyridoxine with isoniazid. Anti-cancer alkylating agent is cyclophosphamide. Cyclophosphamide alkylating agent. Antifungal used in dermatophytosis is a griseofulvin. Griseofulvin is used in dermatophytosis. Antibiotic inhibiting 50ase ribosomal subunit is erythromycin. Erythromycin inhibiting 50ase ribosomal subunit. Pyrazinamide causes hepatotoxicity. Pyrazinamide causes hepatotoxicity. Antiviral drug for influenza is oseltamivir. Oseltamivir, zanamivir. Okay. Next, antibiotic used for MRSA. MRSA with methicillin resistant Staphylococcus aureus is a vancomycin. Anti-cancer drug causing cardiotoxicity is doxorubicin. Antifungal inhibiting microtubules is griseofulvin. Okay, griseofulvin inhibiting microtubules. First line anti-TB drugs include isoniazid, rifampicin, ethambutol, pyrazinamide, or streptomycin. All of these are the first line anti-TB drugs. Antibiotic causing gray baby syndrome is a chloramphenicol. Antiviral acting as a reverse transcriptase inhibitor is zidovudine. Zidovudine is a reverse transcriptase inhibitor. Next, UTI drug contraindicated in renal failure is a nitrofurantoin. Is a contraindicated in renal failure. Bacteriostatic antibiotic is a tetracycline. And one more point about tetracycline is it is a broad spectrum antibiotic. Anti-TB drug that shortens therapy duration is a rifampicin. Anti-cancer vinculoclide is a vincristine. Antifungal drug for systemic mycosis is a amphotericin B. Amphotericin B used in the treatment of a systemic mycosis. Antibiotic inhibiting DNA gyrase is ciprofloxacin. Means all fluoroquinolones like all floxacins inhibiting DNA gyrase. Next, anti-TB drug causing hyperuricemia is a pyrazinamide. Pyrazinamide causing hyperuricemia. Antiviral drug for hepatitis B is lamivudine. Hepatitis B, lamivudine. Antibiotic causing nephrotoxicity and ototoxicity is gentamicin. Gentamicin causing nephrotoxicity and ototoxicity. Anti-cancer drug causing pulmonary fibrosis is a bleomycin. Okay, bleomycin, pulmonary fibrosis. Antifungal used for oral thrush is a nystatin. Antifungal used for oral thrush is nystatin. Drug of choice for uncomplicated urinary tract infection is a nitrofurantoin. Next, antibiotic causing photosensitivity is tetracycline. Tetracycline causing photosensitivity. Antiviral for herpes simplex virus and varicella zoster virus is acyclovir. Acyclovir used in the treatment of PHSV and VZV. Anti-TB drug causing hepatitis is all like isoniazid, rifampicin and pyrazinamide. Anti-cancer drug forming DNA cross-links is cisplatin. Cisplatin drug forming DNA cross-links. Antifungal inhibiting squalene epoxidase is a terbinafine. Terbinafine inhibiting squalene epoxidase. Antibiotic safe in a penicillin allergy is erythromycin. Okay, erythromycin safe in penicillin allergy. A anti-TB drug causing orange discoloration of a tears is a rifampicin. Rifampicin discoloration of tears. Antiviral drug for COVID-19 like all your syllabus is a remdesivir. Antiviral drug for COVID-19 is a remdesivir. Urinary antiseptic acting in acidic urine is methenamine. Methenamine is a antiseptic acting in acidic urine. Antibiotic resistance due to beta lactamase is overcome by all of the above like clavulanic acids, salvactam, tazobactam. These three drugs are a beta lactamase inhibitor. Anti-cancer drug causing alopecia is like all anti-cancer drug causing alopecia like vincristine, cyclophosphamide or methotrexate. Antifungal drug for vaginal candidiasis is a fluconazole. Antifungal drug for vaginal candidiasis is a fluconazole. Next, antibiotic inhibiting folic acid synthesis is cotrimoxazole. Antibiotic inhibiting folic acid synthesis is cotrimoxazole. Anti-TB drug used in a MDR-TB. Okay, all like fluoroquinolones used in the treatment of MDR-TB. Anti-TB drug used in a MDR-TB is a fluoroquinolones. Next question. Antiviral drug causing anemia is a ribavirin. Ribavirin is a antiviral drug and causing alopecia, anemia, means blood loss. Ribavirin. Antibiotic for anaerobic infections is metronidazole. Metronidazole for anaerobic infections. Anti-cancer drug inhibiting topoisomerase 2 is a doxorubicin. Antifungal drug causing hepatotoxicity is a ketoconazole. Ketoconazole causing hepatotoxicity. Antibiotic commonly used in acne is a doxycycline. Doxycycline commonly used in acne. Isoniazid drug that inhibits mycolic acid synthesis. Anti-TB drug that inhibits mycolic acid synthesis is a isoniazid. Antiviral drug acting as a neuraminidase inhibitor is a oseltamivir. Oseltamivir, zanamivir. Okay, used in the treatment of influenza. Inhibit neuraminidase inhibitor. Antibiotic causing tendon rupture is a ciprofloxacin. Antibiotic causing tendon rupture is a ciprofloxacin. Anti-cancer drug causing neuropathy is a vincristine. Anti-cancer drug causing neuropathy is a vincristine. Antifungal used for aspergillosis is amphotericin B. Amphotericin B used for aspergillosis treatment. Next, antibiotic causing QT prolongation is azithromycin. Azithromycin causing QT prolongation. Anti-TB drug used for latent TB is isoniazid. Okay, isoniazid drug used for a latent TB. Antiviral used in a hepatitis C is a interferon. Interferon used in a hepatitis C. Antibiotic causing disulfiram-like reaction is a metronidazole. A metronidazole causing disulfiram-like reactions. Anti-cancer drug acting in a young phase is vincristine. A vincristine acting on a young phase. Antifungal not absorbed orally is a nystatin. Okay, nystatin is not absorbed orally. Antibiotic causing super infection is a broad spectrum antibiotics. Antibiotic causing super infection are a broad spectrum. Anti-TB drug contraindicated in pregnancy is streptomycin. Anti-TB drug contraindicated in pregnancy is streptomycin. Antiviral drug for RSV is a ribavirin. Anti-cancer drug causing hemorrhagic cystitis is a cyclophosphamide. So that's why with cyclophosphamide Meissner drug is given for preventing hemorrhagic cystitis. Antifungal drug inhibiting beta-glucan synthesis is a caspofungin. Caspofungin inhibit beta-glucan synthesis. Antibiotic used in a pseudomembranous colitis is a metronidazole. Metronidazole used in the treatment of pseudomembranous colitis. Anti-TB drug causing seizures in an overdose is a isoniazid. Isoniazid causing seizures in an overdose. Antiviral causing nephrotoxicity is a acyclovir. Acyclovir causing nephrotoxicity. Antibiotic safe in a pregnancy is penicillin. Penicillin is safe in a pregnancy. Anti-cancer drug causing myelosuppression is a methotrexate. Anti-cancer drug causing myelosuppression is a methotrexate. Antifungal for cryptococcal meningitis is a amphotericin B. Antifungal for cryptococcal meningitis is a amphotericin B. Antibiotic causing tooth discoloration is a tetracycline. Anti-TB drug causing lupus-like syndrome is a isoniazid. Isoniazid causing lupus-like syndrome. Antiviral for influenza A is a amantadine. Antiviral drug antiviral for influenza A is a amantadine. Antibiotic for H. pylori is a metronidazole. Antibiotic for H. pylori is a metronidazole. Anti-cancer drug causing testicular atrophy is a cyclophosphamide. Cyclophosphamide causing testicular atrophy. Antifungal drug for onychomycosis is a terbinafine. Means terbinafine treat the onychomycosis. Antibiotic inhibiting RNA synthesis is a rifampicin. Anti-TB drug causing GI upset is pyrazinamide, rifampicin, or isoniazid. These all drugs causing GI upset. Antiviral used in a cytomegalovirus is a ganciclovir. Antiviral used in a cytomegalovirus is a ganciclovir. Antibiotic causing Stevens-Johnson syndrome is cotrimoxazole. Cotrimoxazole causing Stevens-Johnson syndrome. Anti-cancer drug causing nausea and vomiting is a cisplatin. Anti-cancer drug causing nausea and vomiting is a cisplatin. Antifungal drug inhibiting fungal cell membrane is A and B means nystatin and amphotericin B inhibiting fungal cell membrane. Antibiotic used in a cholera is a tetracycline. Tetracycline is used in the treatment of a cholera. Next question, guys. Anti-TB drug dosage adjustment needed in a renal failure is mainly ethambutol. If any patient is having renal failure problem, then ethambutol dose is adjusted. Miss antiviral causing neurotoxicity, amantadine. Amantadine is an antiviral drug and causing neurotoxicity, amantadine. Antibiotic causing hearing loss is gentamicin. Gentamicin causing hearing loss. Anti-cancer drug acting in S phase is a methotrexate and vincristine on a young phase. Guys, remember methotrexate S phase, vincristine young phase, VMS. Overall aim of chemotherapy is to overall aim of a chemotherapy is to selectively destroy pathogens or cancer cells. So guys, we will meet in the next video. Thank you. Remember, anti-cancer yes phase, methotrexate, and yum phase vincristine. So guys, our next topic is antidiabetics, contraceptives, endocrine and hormones, and uterine drugs. So let's start. Question number one. Drug used to induce labor is oxytocin. Oxytocin used to induce labor. Metformin reduces blood glucose mainly by increasing insulin sensitivity. Metformin reduces blood glucose mainly by increasing insulin sensitivity. Hormone responsible for milk ejection is oxytocin. Oxytocin is responsible for milk ejection. Emergency contraceptive should be taken within 72 hours. Insulin is secreted by beta cells of pancreas. A drug causing uterine relaxation is salbutamol. Drug causing uterine relaxation, salbutamol. Antidiabetic drug causing lactic acidosis is a metformin. Metformin causing lactic acidosis. Copper T prevents pregnancy mainly by preventing fertilization and implantation. Copper T prevents pregnancy mainly by preventing fertilization and implantation. Hormone regulating basal metabolic rate is a thyroxine. Thyroxine hormone regulating basal metabolic rate. Drug of choice for type 1 diabetes is insulin. Hormone maintaining pregnancy is a progesterone. Hormone maintaining pregnancy is progesterone. Alpha glucosidase inhibitors act in intestine. What is the location of alpha glucosidase on intestine? IUCD releases copper ions. IUCD releases copper ions. Drug used to suppress lactation is a bromocriptine. Bromocriptine used to suppress lactation. Sulfonylureas acts by blocking potassium channels. Sulfonylureas acts by blocking potassium channels. Oxytocin receptor is GPCR. Antidiabetic drug safe in renal failure is insulin. Hormone responsible for ovulation is a luteinizing hormone, LH. Ergometrin is used to control postpartum hemorrhage. Ergometrin is used to control postpartum hemorrhage. Oral contraceptives mainly acts by suppressing ovulation. Oral contraceptives mainly act by suppressing ovulation. Antidiabetic drug causing weight gain is insulin. Antidiabetic drug causing weight gain is insulin. Hormone increasing blood calcium is parathyroid hormone. Hormone increasing blood calcium is parathyroid hormone. Tocolytic drugs are used to relax uterus. Tocolytic drugs are used to relax uterus. Next, injectable contraceptive is medroxyprogesterone acetate. Drug of choice for obese diabetic is a metformin. Prolactin secretion is inhibited by dopamine because prolactin and dopamine are inversely proportional. Drug used for medical abortion is a mifepristone. Thiazolidinediones activate PPAR gamma. Hormone responsible for secondary sexual characters in females is estrogen. Estrogen responsible for secondary sexual characters in females. Antidiabetic drug causing flatulence is acarbose. Acarbose drug causing flatulence. Drug used in postpartum hemorrhage is oxytocin. Combined oral contraceptive contain estrogen plus progesterone. Hormone secreted for posterior pituitary is oxytocin and antidiuretic hormone. Antidiabetic drug improving insulin sensitivity is pioglitazone. Uterine stimulant acting via prostaglandins is a misoprostol. Uterine stimulant acting via prostaglandin is misoprostol. Hypoglycemia is most common with insulin. Hormone used in hypothyroidism is a levothyroxine. Levothyroxine used in a hypothyroidism. IUCD is contraindicated in pelvic inflammatory disease. Drug used to induce ovulation is clomiphene citrate. Induce ovulation. Antidiabetic drug acting independent of insulin is metformin. Hormone regulating sodium retention is aldosterone. Aldosterone regulating sodium retention. Progesterone causes uterine relaxation. Progesterone causes uterine relaxation. A drug used in gestational diabetes is insulin. Estrogen causes endometrial proliferation. Estrogen causes endometrial proliferation. Emergency contraceptives should not be used as a regular method. Oxytocin causes uterine contraction by increasing calcium. Oxytocin causes uterine contraction by increasing calcium. Antidiabetic incretin mimetic exenatide. Antidiabetic incretin mimetic exenatide. Hormone used in adrenal insufficiency is hydrocortisone. Hormone used in adrenal insufficiency is hydrocortisone. Uterine relaxant used in preterm labor is salbutamol. Uterine relaxant used in preterm labor is salbutamol. Antidiabetic drug contraindicated in heart failure is pioglitazone. Pioglitazone drug contraindicated in heart failure. Hormone responsible for milk production is prolactin. Antidiabetic drug that delays carbohydrate absorption is acarbose. Drug used to control postpartum hemorrhage is oxytocin. Contraceptive failure rate is highest with condoms. Hormone responsible for male secondary sexual characters is testosterone, and in female it is a progesterone. Antidiabetic drug increasing incretin levels, sitagliptin. Gliptins. Drug used for induction of abortion is a mifepristone. Hormone regulating calcium metabolism is parathyroid hormone. Antidiabetic drug with lowest risk of hypoglycemia is metformin. Uterine drug causing sustained contraction is ergometrin. Uterine drug causing sustained contraction is ergometrin. Hormone secreted by anterior pituitary is a growth hormone, and antidiuretic hormone, oxytocin, and aldosterone, these are the posterior hormones. Emergency contraceptive mainly prevents fertilization, implantation, and ovulation. Antidiabetic drug contraindicated in renal failure is metformin. Metformin drug contraindicated in a renal failure. A drug used in preterm labor to relax uterus is salbutamol. Hormone regulating basal metabolic rate is thyroxine. Injectable long acting insulin is glargine. IUCD acts mainly by preventing fertilization and implantation. Antidiabetic drug causing weight gain and edema is a pioglitazone. Hormone used to treat hypothyroidism is levothyroxine. Drug used to suppress lactation is a bromocriptine. Antidiabetic drug acting independent of insulin secretion is metformin. Hormone responsible for uterine growth is estrogen. Estrogen is responsible for uterine growth. Oxytocin is contraindicated in fetal distress. Oxytocin is contraindicated in fetal distress. Drug used to induce ovulation is clomiphene citrate. Clomiphene citrate is used to induce ovulation. Next, antidiabetic drug causing GI side effects like flatulence, diarrhea is acarbose. Hormone regulating sodium and water balance is aldosterone. Drug used in medical termination of pregnancy is mifepristone. Antidiabetic drug improving insulin sensitivity via PPR gamma is a pioglitazone. Hormone responsible for milk ejection reflex is oxytocin. IUCD is contraindicated in pelvic inflammatory diseases. Antidiabetic drug safest in pregnancy is insulin. Estrogen adverse effect includes thromboembolism. Estrogen adverse effect includes thromboembolism. A drug used to control uterine atony is oxytocin. Oxytocin. Drug used to control uterine atony is oxytocin. Next, hormone deficiency causing diabetic insipidus is mainly ADH, like antidiuretic hormone. Okay, causing diabetes insipidus. Antidiabetic drug inhibiting DPP4 is a gliptins like sitagliptin, moxagliptin. Okay, DPP4 inhibitors.
Prostaglandin analog used in abortion is a misoprostol. Hormone increasing blood glucose is cortisol. Insulin, thyroxine, estrogen, not cortisol, increasing blood glucose. Long-term oral contraceptive use reduces risk of ovarian cancer. Long-term oral contraceptive use reduces risk of ovarian cancer. Antidiabetic drug contraindicated in liver disease is a pioglitazone. Antidiabetic drug contraindicated in liver disease is a pioglitazone. Drug causing uterine relaxation by beta 2 stimulation is salbutamol. Salbutamol causing uterine relaxation by beta 2 stimulation. Hormone release from posterior pituitary is a oxytocin. Antidiabetic drug useful in postprandial hyperglycemia is a acarbose. Antidiabetic drug useful in postprandial hyperglycemia is acarbose. Emergency contraception should not be used as a regular method. Hormone used in adrenal insufficiency is hydrocortisone. Hormone used in adrenal insufficiency is hydrocortisone. Antidiabetic drug causing edema and heart failure is a pioglitazone. Pioglitazone drug causing edema and heart failure. Uterine drug causing vasoconstriction is a ergometrin. Ergometrin causing vasoconstriction. Hormone regulating ovulation is a luteinizing hormone. Antidiabetic drug reducing hepatic glucose production is metformin. Antidiabetic drug reducing hepatic glucose production is metformin. Hormone maintaining endometrium in pregnancy is a progesterone. Progesterone hormone maintaining endometrium in pregnancy. Overall goal of antidiabetic therapy is used to maintain normal glycemia. So these are the 100 questions on hormones. So our next topic is antiasthmatic drugs, COPD drugs, expectorants and mucolytics, antitussives and bronchodilators. Let's start. A drug of choice for acute bronchial asthma attack is a salbutamol. Salbutamol is the drug of choice for acute bronchial asthma attack. Salbutamol. Bronchodilation by beta 2 agonist occurs due to increased CAMP cyclic AMP. Inhaled corticosteroids act mainly by reducing airway inflammation. A drug of choice for long-term asthma control, beclomethasone. For long-term asthma, we use a drug of choice for beclomethasone. Anticholinergics bronchodilator used in a COPD is ipratropium bromide. Ipratropium, tiotropium. Okay, these are the anticholinergics bronchodilators used in a COPD. Leukotriene receptor antagonist is a montelukast. Drug that prevents mast cell degranulation is a cromolyn sodium. Cromolyn sodium prevent mast cell degranulation. Theophylline produces bronchodilation by inhibiting phosphodiesterase. Theophylline produces bronchodilation by inhibiting phosphodiesterase. Expectorant that increases bronchial secretion is a guaifenesin. Guaifenesin increases bronchial secretion. Drug causing tachycardia and tremors is a salbutamol. COPD is characterized by irreversibly airway obstruction. COPD is characterized by irreversibly airway obstruction. A long-acting beta-2 agonist like LABA is a salmeterol and formoterol. A drug reducing mucus viscosity is a bromhexine. Bromhexine reducing mucus viscosity. First line drug in mild intermittent asthma is a short-acting beta-2 agonist. Corticosteroid used by inhalation is a beclomethasone. Beclomethasone corticosteroid used by inhalation. Antitussive acting on cough center is a codeine. Codeine acting on cough center. Drug useful in exercise-induced asthma is a cromolyn sodium. Cromolyn sodium is useful in exercise-induced asthma. Next, COPD patient benefits most from bronchodilators. Mainly for treating COPD, we use bronchodilators. Mucolytics drug breaking disulfide bonds by acetylcysteine, which as a mucolytic drug breaking disulfide bonds like acetylcysteine carbocysteines. Drug contraindicated in productive cough is a codeine. Codeine is contraindicated in productive cough. Antihistaminic drug safest in pregnancy is a salbutamol. Salbutamol is the antihistaminic drug safest in pregnancy. Ipratropium blocks muscarinic receptors. Ipratropium blocks muscarinic receptors. Drug reducing airway hyperresponsiveness is a inhaled steroids. Inhaled steroids reducing airway hyperresponsiveness. Asthma is primarily a disease of inflammation. Asthma is a primarily a disease of inflammation. LABA should always be used with corticosteroids. LABA should always be used with corticosteroids. Drug useful in nocturnal asthma is a theophylline. Expectorant acting by reflex gastric irritation is a guaifenesin. Expectorant acting by reflex gastric irritation is a guaifenesin. Drug causing oral candidiasis as a side effect beclomethasone. Beclomethasone causing oral candidiasis. Montelukast blocks leukotriene D4 receptor. A drug preferred in COPD with cardiac disease is ipratropium. Ipratropium preferred in a COPD with cardiac diseases. Bronchodilator with narrow therapeutic index is a theophylline. Theophylline is a bronchodilator with a narrow therapeutic index. Cough suppressants are avoided in a productive cough. Cough suppressants are avoided in a productive cough. A drug causing diuresis and CNS stimulation is a theophylline. Drug causing diuresis and CNS stimulation is a theophylline. First line drug in a COPD maintenance therapy is a anticholinergics. Asthma drug useful in aspirin induced asthma is a montelukast. Asthma drug useful in aspirin induced asthma is a montelukast. Expectorants act by increasing bronchial secretion. Expectorants act by increasing bronchial secretion. Drug of choice for status asthmatics is a inhaled salbutamol. Inhaled salbutamol is a drug of choice for status asthmatics. Inhalation route is preferred because direct action on lungs. Drug used in chronic bronchitis is a bronchodilators. Chronic bronchitis, bronchodilators. Side effect of beta 2 agonist is a tremors. Drug useful in allergic asthma is cromolyn sodium. Cromolyn sodium drug useful in allergic asthma. Methyl xanthines include theophylline. Drug that suppress late phase asthmatic reaction is a corticosteroids. Corticosteroids suppresses late phase asthmatic reaction. Expectorant also having mucolytic action is a bromohexine. Bromohexine work as expectorant and work as a mucolytic action also. Drug reducing airway edema is a corticosteroids. Corticosteroids reducing airway edema. COPD differs from asthma because it is progressive. COPD differ from asthma because it is progressive. Antihistaminic drug acting on IgE is a omalizumab. A drug used in cough with thick sputum is acetylcysteine because acetylcysteine breaks disulfide bonds. Long-term steroid use may cause adrenal suppression. Antihistaminic drug causing dry mouth is a ipratropium. Ipratropium drug causing dry mouth. Bronchodilators relieve dyspnea by relaxing bronchial smooth muscle. Drug used in emphysema is a bronchodilators. Antihistaminic drug not useful in acute attack is a cromolyn sodium. Expectorant increasing surfactant production is ambroxol. Ambroxol increasing surfactant production. Drug used in smoking related COPD is a bronchodilators. Asthma trigger not related to allergy is a exercise. Pollen, dust, food are responsible for allergy. Drug reducing inflammatory mediators in asthma is a montelukast. Montelukast reducing inflammatory mediators in asthma. LABA should not be used alone due to risk of asthma related death. Long acting bronchodilators like should not be used alone due to risk of asthma related death. Mucolytics are contraindicated in a dry cough. Drug useful in allergic rhinitis with asthma is a cromolyn. Cromolyn is the drug of choice for, sorry, cromolyn useful in allergic rhinitis with asthma. Anti-asthmatic drug reducing eosinophils is a corticosteroids. Anti-asthmatic drug reducing eosinophils is a corticosteroids. Theophylline toxicity causes seizures. Expectorant commonly combined with cough syrup because guaifenesin. Guaifenesin commonly combined with a cough syrup. A drug of choice for wheeze in children is a inhaled salbutamol. Inhaled salbutamol is a drug of choice for wheeze in children. COPD exacerbation is commonly treated with antibiotics and bronchodilators. Next, asthma medication delivered via spacer improves lung deposition. Asthma medication delivered via spacer improves lung deposition. Drug that does not cause tolerance is corticosteroids. Corticosteroids that does not cause tolerance. Expectorants should be taken with a water. Expectorants should be taken with water. A drug useful in nighttime cough is a codeine. Drug useful in a nighttime cough is a codeine. Anticholinergic cause bronchodilation by blocking M3 receptors. A drug useful in allergic bronchospasm is a allergic bronchospasm antihistaminics, antihistamines, salbutamol, and montelukast. Asthma is a obstructive diseases. Expectorant with antioxidant action is a acetylcysteine. Acetylcysteine work as an expectorant with antioxidant action. Drug not used in a COPD is a cromolyn. Salbutamol, ipratropium, and tiotropium used in COPD. Cromolyn not used. LABA onset of action is a delayed, long acting. So that's why onset of action is a delayed. Corticosteroids reduce asthma symptoms by suppressing inflammation. Drug of choice for chronic asthma prevention is a inhaled corticosteroids. Inhaled corticosteroids is a drug of choice for chronic asthma prevention. Expectorants are contraindicated in bronchitis, asthma, and infants or dry cough. So, answer is dry cough. Expectorants are contraindicated in a dry cough patients. Antiasthmatic drug given subcutaneously in emergency is a epinephrine. Epinephrine is antiasthmatic drug given subcutaneously. COPD drug causing minimal systemic effects is a inhaled anticholinergics. COPD drug causing minimal systemic effects is a inhaled anticholinergics. Expectorant improving ciliary action is a ambroxol. Expectorant improving ciliary action is a ambroxol. Ambroxol improving ciliary action. Asthma attack is triggered by bronchoconstriction. Drug of choice for dry irritating cough is a codeine. Codeine is a drug of choice for dry irritating cough. Theophylline interacts with rifampicin, erythromycin, and cimetidine. COPD patients benefits least from antitussives. Uh, Asthma is associated with increased eosinophils. Expectorant action begins after reflex gastric irritation. Expectorant action begins after reflex gastric irritation. LABA example is a salmeterol and formoterol. Drug used in bronchospasm with cardiac disease is ipratropium. Drug used in bronchospasm. Ipratropium is used in bronchospasm with cardiac diseases. Expectorants should be avoided in a dry cough. Expectorants should be avoided in a dry cough. Antiasthmatic biologics drug includes omalizumab. Drug reducing airway remodeling is a corticosteroids. Drug reducing airway remodeling is a corticosteroids. Drug useful in nocturnal COPD symptoms is theophylline. Theophylline is useful in a nocturnal COPD symptoms. Expectorants act best when combined with a adequate hydration. So that's why expectorants taken with a hydration water. Asthma severity is assessed by peak expiratory flow rate. Asthma severity is assessed by peak expiratory flow rate. Drug reducing bronchial secretion is a anticholinergics. Anticholinergics reducing bronchial secretions. Expectorant not acting on a mucus is a codeine. Guaifenesin, bromhexine, acetylcysteine acting on a mucus. Antihistaminic drug preventing exercise-induced asthma is a cromolyn sodium. Cromolyn sodium is an antihistaminic drug preventing exercise-induced asthma. Cromolyn sodium. COPD is mainly caused by smoking. COPD means chronic obstructive pulmonary disorder, mainly caused by smoking. Overall goal of a respiratory pharmacotherapy is to relieve symptoms and improve airflow.
So guys, our next topic is GIT drugs, in which we see anti-ulcer, constipation, diarrhea, emetics and antiemetics, and or digestants. So let's start. Question number one. Drug of choice for peptic ulcer disease is omeprazole. So omeprazole is the drug of choice for peptic ulcer disease. Next, proton pump inhibitors act by inhibiting sodium, hydrogen, potassium ATPase. Okay, proton pump inhibitors. Proton means hydrogen, so it inhibits hydrogen potassium ATPase. Antacid producing systemic alkalosis is a sodium bicarbonate. Sodium bicarbonate producing systemic alkalosis. Drug used for stress ulcer prophylaxis is a omeprazole. Omeprazole used for stress ulcer prophylaxis. Aluminium hydroxide causes constipation. Aluminium hydroxide causes constipation. Magnesium salts commonly cause diarrhea. Magnesium salt commonly cause diarrhea. H2 blocker that inhibits cytochrome P450 is cimetidine. Cimetidine inhibits cytochrome P450. Drug forming protective barrier over ulcer is a sucralfate. Okay, sucralfate forming product protective barrier over ulcer. Prostaglandin analog used in NSAID induced ulcer is a misoprostol. Misoprostol used in NSAID induced ulcer. Common adverse effect of proton pump inhibitor is hypomagnesemia. Laxative acting by increasing fecal bulk is a psyllium. Psyllium acting by increasing fecal bulk. Osmotic laxative is a lactulose. Lactulose is a osmotic laxative. Stimulant laxative is senna, and lactulose is a osmotic laxative, and senna is a stimulant laxative. A stool softener is a docosate. Docosate is a stool softener. Laxative contraindicated in intestinal obstruction is a bulk laxatives, osmotic laxative, stimulant laxative. These three laxative contraindicated in intestinal obstruction. Liquid paraffin causes deficiency of a fat soluble vitamins. Liquid paraffin causes a deficiency of fat soluble vitamins. Drug of choice for acute diarrhea is loperamide. Antidiarrheal acting by reducing gut motility is loperamide. Loperamide is a antidiarrheal acting by reducing gut motility. Opioid antidiarrheal is opioid antidiarrheal is a diphenhexylate. ORS works by increasing absorption of a sodium and a glucose. Adsorbent used in a diarrhea is kaolin. Kaolin used in a diarrhea as a adsorbent. Antidiarrheal contraindicated in a dysentery is loperamide. Loperamide is contraindicated in a dysentery. Drug reducing intestinal secretion is racecadotril. Racecadotril. Racecadotril reducing intestinal secretion. Zinc supplementation is useful in a pediatric diarrhea. Zinc supplementation is useful in a pediatric diarrhea. Emetic used in a poisoning is ipecac. Ipecac used in a poisoning as a emetic. Ipecac. Emetics act by stimulating both A and B, means emetics act by stimulating omitting center as well as chemoreceptor trigger zone CTZ. Antiemetics acting on D2 receptor is metoclopramide.
Metoclopramide acting on D2 receptor. 5-HT3 antagonist antiemetic is satrons like ondansetron. Antiemetic useful in a motion sickness is promethazine. Promethazine useful in a motion sickness. Anticholinergic antiemetic is a scopolamine. Anticholinergic antiemetic is a scopolamine. Metoclopramide also act as a prokinetic. Metoclopramide also act as prokinetic. Domperidone does not cross Domperidone does not cross blood-brain barrier. Domperidone does not cross blood-brain barrier. Antiemetic preferred in a chemotherapy-induced vomiting is ondansetron. Ondansetron preferred in chemotherapy-induced vomiting. Adverse effect of metoclopramide includes extrapyramidal symptoms. Adverse effect of metoclopramide includes extrapyramidal symptoms. Digestant containing fungal enzyme is a papain. Papain contain fungal enzymes. Pancreatin is used in pancreatic insufficiency. Pancreatin is used in pancreatic insufficiency. Acidifier used in achlorhydria is dilute HCl. Dilute HCl is used in achlorhydria. Antacid that produces CO2 is sodium bicarbonate. Sodium bicarbonate produces carbon dioxide. A drug commonly used in a GERD. Drug commonly used in a GERD is a omeprazole. Sucralfate work based in a acidic pH. Sucralfate works based in a acidic pH. Drug that decreases gastric acid secretion is a proton pump inhibitors like ortidine, ranitidine, omeprazole, lansoprazole, all prazoles means proton pump inhibitors that decreases gastric acid secretion. Antacid preferred in a renal failure is aluminum hydroxide. Aluminum hydroxide preferred in a renal failure. Bulk forming laxative require adequate water. Bulk forming laxatives require adequate water. Laxative safest for long term use is a psyllium. Psyllium safest for long term use. Drug commonly used for travel's diarrhea is loperamide. Loperamide commonly used for traveler's diarrhea. Loperamide. Antiemetic acting on a H1 receptor is promethazine. Promethazine acting on a H1 receptor. Vomiting center is located in the medulla. Vomiting center is located in the medulla. A drug useful in a gastroparesis is a metoclopramide. Metoclopramide useful in a gastroparesis. Metoclopramide. Digestant containing pancreatic enzyme is a pancreatin. Digestant containing pancreatic enzyme is a pancreatin. Antidiarrheal safest in children is ORS like oral rehydration salts. Antidiarrheal safest in children. Drug causing rebound acidity is antacids. Antacids causing rebound acidity. Antacid causing milk alkali syndrome is calcium carbonate. Calcium carbonate causing milk alkali syndrome. Drug increasing gastric mucus secretion is misoprostol. Misoprostol increasing gastric mucus secretion. Laxative acting by increasing intestinal motility is senna. Senna acting by increasing intestinal motility. Antidiarrheal that does not cross the blood-brain barrier is a loperamide. Loperamide that does not cross the blood-brain barrier. Antiemetic contraindicated in Parkinson's disease is a metoclopramide. Metoclopramide is contraindicated in Parkinson's disease. Drug reducing nausea by blocking serotonin is ondansetron. Ondansetron reducing nausea by blocking serotonin. Ondansetron blocking serotonin. Digestant useful in a protein digestion is pepsin. Pepsin useful in a protein digestion. Antacid with laxative effect is a magnesium hydroxide. Antacids with laxative effect is a magnesium hydroxide. Antidiarrheal causing constipation as a side effect is loperamide. Loperamide causing constipation. A drug used to treat functional dyspepsia is a metoclopramide. Metoclopramide, a drug used to treat functional dyspepsia is a metoclopramide. Laxative avoided in pregnancy is a stimulant laxative. Stimulant laxative avoided in a pregnancy. Antiemetic acting on the vestibular system is a promethazine. Promethazine acting on the vestibular system. Drug preventing NSAID induced ulcer is a misoprostol. Misoprostol preventing NSAID induced ulcer. Antacid decreasing phosphate level is aluminum hydroxide. Aluminum hydrox aluminum hydroxide decreasing phosphate levels. Antacid decreasing phosphate level is a aluminum hydroxide. Drug causing extrapyramidal side effect is a metoclopramide. Also, aluminum hydroxide decreasing phosphate level. Best treatment for dehydration due to diarrhea is ORS. For dehydration, digestant useful in a lactose intolerance is lactase. Antidiarrheal acting by adsorbing toxin is kaolin. Drug increasing lower esophageal sphincter tone is metoclopramide. Metoclopramide increasing lower esophageal sphincter tone. Drug causing gynecomastia is cimetidine. Cimetidine causing gynecomastia. Antiemetic preferred in a pregnancy is promethazine. Promethazine is an antiemetic drug and preferred in a pregnancy. Laxative acting by lubricating feces is a liquid paraffin. Okay, liquid paraffin acting by lubricating feces. Drug used in a Zollinger-Ellison syndrome is proton pump inhibitors, like all prazoles, are useful in a Zollinger-Ellison syndrome. Antidiarrheal contraindicated in children is diphenogxylate. ORS, zinc, kaolin given in children, but diphenogxylate don't given with children. Digestant used in a fat digestion is lipase. Lipase used in a fat digestion, lipase. Antiemetic acting at chemoreceptor trigger zone is metoclopramide. Antiemetic acting at CTZ is a metoclopramide. A drug reducing gastric emptying time is metoclopramide. Drug reducing gastric emptying time is metoclopramide. Laxative causing electrolyte imbalance is a Senna. Senna causing electrolyte imbalance. Antacid prepared in a pregnancy is calcium carbonate. Calcium carbonate prepared in a pregnancy. A drug used for IBS with diarrhea is loperamide. Loperamide used for IBS with diarrhea. Digestant containing plant enzyme is a papain. Antiemetic causing sedation is a promethazine. Promethazine causing sedation. A drug neutralizing gastric acid is a antacids. Antacids neutralizing gastric acids. Laxative acting by osmotic effect in a colon is a lactulose. Lactulose acting by osmotic effect in a colon. Antidiarrheal reducing intestinal secretion is racecadotril. Racecadotril reducing intestinal secretion. Drug useful in a chronic constipation is psyllium. Drug useful in a chronic constipation is a psyllium. Antiemetic without extrapyramidal effect is domperidone. Domperidone work as an antiemetic without extrapyramidal effect. Digestant used in a pancreatic cancer is pancreatine. Antacid causing constipation and hypophosphatemia is aluminum hydroxide. Aluminum hydroxide causing constipation and hypophosphatemia. A drug preventing motion sickness is a scopolamine. Drug preventing motion sickness is scopolamine. That means scopolamine preventing motion sickness. Laxatives safest in an elderly is a bulk laxatives. Bulk laxatives are safest in elderly patients. Antidiarrheal not affecting CNS is a loperamide because loperamide does not cross blood-brain barrier. So that is not affecting CNS. Digestant improving carbohydrate digestion is amylase. Amylase digestant improving carbohydrate digestion. Drug reducing nocturnal acid secretion is H2 blockers like ranitidine, famotidine, or tidines that reducing nocturnal acid secretion. Antiemetic blocking dopamine and serotonin is metoclopramide. Metoclopramide blocking dopamine and serotonin. Meto. Laxative causing dependence on long-term use is Senna. Senna causing dependence on long-term use. A drug safe for acid peptic disease in a pregnancy is ranitidine. Ranitidine safe for acid peptic disease in pregnancy. Antidiarrheal improving water absorption is ORS. ORS improving water absorption. Main aim of GIT pharmacotherapy is restore normal digestion and motility. Main aim of GIT pharmacotherapy. Restore normal digestion and motility is the main aim of a GIT pharmacotherapy.
So guys, our next topic is autocoids, immunostimulants and immunosuppressants. Let's start a question and their answer only because of shortage of time. Histamine is synthesized from histidine amino acids. Histamine is synthesized from histidine. Histamine H1 receptor stimulation causes bronchoconstriction. Histamine H1 receptor stimulation causes bronchoconstriction. Drug of choice for acute anaphylaxis is epinephrine. Epinephrine is a drug of choice for acute anaphylaxis. H2 receptor antagonist reduce gastric acid secretion. H2 receptor antagonist reduce gastric acid secretion. First generation antihistamines causes sedation. First generation antihistamine causes sedation. Second generation antihistamine is loratadine. Okay, loratadine, disloratadine. Autocoid involved in inflammation and pain is prostaglandins. Prostaglandins involved in inflammation and pain. NSAID inhibit synthesis of prostaglandins. NSAIDs inhibit synthesis of prostaglandins. Bradykinin causes vasodilation and pain. Bradykinin causes vasodilation and pain. Serotonin is mainly stored in platelets. Serotonin is mainly stored in platelets. Drug blocking leukotriene receptor is montelukast. Montelukast blocking leukotriene receptor. Autocoid release during allergic reaction is a histamine. Histamine release during allergic reaction. Ketotifen is a mast cell stabilizer. Ketotifen is a mast cell stabilizer. Prostaglandins are derived from prostaglandins are derived from arachidonic acid. Prostaglandins are derived from arachidonic acid. Antihistamines are useful in allergic rhinitis. Antihistamines are useful in allergic rhinitis. Histamine causes gastric acid secretion by acting on a H2 receptor. Histamine causes gastric acid secretion by acting on H2 receptor. Immunostimulants are used in recurrent infections. Immunostimulants are used in recurrent infections. BCG vaccine act as a immunostimulant. BCG vaccine act as immunostimulant. Levamisole is used as immunostimulant. Levamisole is used as a immunostimulant. Cytokine used as a cytokine used as immunostimulant is interferon. Interferon used as a immunostimulant. Interleukins are produced by interleukins are produced by leukocytes. IL. Interleukins are produced by leukocytes. Immunosuppressants are used to prevent organ rejection. Immunosuppressants are used to prevent organ rejection. Cyclosporin suppresses immunity by inhibiting calcineurin. Cyclosporin inhibit calcineurin. Drug used to prevent graft rejection is cyclosporin. Okay, Cyclosp- cyclosporin prevent graft rejection. Corticosteroids suppress immunity by reducing the lymphocyte count. Corticosteroids suppress immunity by reducing lymphocyte count. Azathioprine inhibits DNA synthesis. Azathioprine inhibits DNA synthesis. Methotrexate acts by inhibiting dihydrofolate reductase DHFR. Methotrexate acts by inhibiting dihydrofolate reductase. Tacrolimus is similar to cyclosporine. Tacrolimus is similar to cyclosporine. Immunosuppressant used in a rheumatoid arthritis is azathioprine. Azathioprine is used in a rheumatoid arthritis. Major adverse effect of immunosuppressant is infection. Major adverse effect of immunosuppressant is infection. Prostaglandin cause uterine contraction. Prostaglandins cause uterine contraction. Histamine H1 blockers are useful in a motion sickness. Histamine H1 blockers are useful in a motion sickness. Antihistamine causing maximum sedation is diphenhydramine. Antihistamine causing maximum sedation is diphenhydramine. Diphen, Diphenhydramine causing maximum sedation. Autocoid responsible for pain sensation is prostaglandin E2. Prostaglandin E2 is responsible for pain sensation. Drug stabilizing mast cell is Cromolyn sodium. Cromolyn sodium stabilizing mast cells. Immunostimulant used in a cancer therapy is interferon. Means interferon. Cyclosporine adverse effect includes nephrotoxicity. Nephrotoxicity is a adverse effect of a cyclosporine. Nephrotoxicity, cyclosporine. Drug reducing T cell activation is tacrolimus. Tacrolimus reducing T cell activation. Immunostimulants increase activity of immune cells. Immunostimulants increase activity of immune cells. Prostaglandin synthesis is inhibited by NSAIDs. Prostaglandin synthesis is inhibited by NSAIDs. Histamine causes hypotension due to vasodilation. Histamine causes hypotension due to vasodilation. Drug blocking histamine release is a cromolyn sodium. Cromolyn sodium blocking histamine. Interferons have antiviral action. So that's why used in cancer treatment. Interferons have antiviral action. Immunosuppressant contraindicated in pregnancy is methotrexate. So methotrexate don't use in the treatment of a pregnancy. Histamine causes increased capillary permeability by acting on a H1 receptor. Histamine causes increased capillary permeability by acting on a H1 receptor. Drug useful in allergic conjunctivitis is cromolyn sodium. Drug useful in allergic conjunctivitis is cromolyn sodium. Immunostimulants are contraindicated in autoimmune disease. Okay, immunostimulants are contraindicated in autoimmune diseases. Bradykinin is activated by ACE. Bradykinin is inactivated by ACE. ACE inhibitors increase bradykinin, leading to dry cough. ACE inhibitors increase bradykinin, leading to dry cough. Bradykinin is inactivated by ACE. So, dry cough cause. Prostaglandins are autocoids because they act locally. Immunosuppressants reduce immune response. Drug used to prevent transplant rejection long term is cyclosporine. Cyclosporine prevent transplant rejection. Histamine antagonist used in a peptic ulcer is cimetidine. Histamine antagonist used in a peptic ulcer is cimetidine. Autocoid causing smooth muscle contraction is prostaglandins. Autocoid causing smooth muscle contraction. Prostaglandins. Prostaglandin causing smooth muscle contraction. Interferon increasing macrophage activity. Okay. Immunostimulant increasing macrophage activity is interferon. NSAID reduce inflammation by inhibiting COX. NSAID reduce inflammation by inactivating COX. H1 blockers are contraindicated in glaucoma. H1 blockers are contraindicated in glaucoma. Immunosuppressant used in organ transplantation is cyclosporine.
Prostaglandin E2 causes pain and fever. Histamine release is inhibited by chromoline sodium. Histamine release is inhibited by chromoline. Immunostimulants help by enhancing immune response. Immunostimulants help by enhancing immune response. Drug reducing cytokine production is cyclosporine. Cyclosporine reducing cytokine production. Autocoid involved in platelet aggregation is thromboxane A2. Autocoid involved in platelet aggregation is thromboxane A2. Aspirin inhibits thromboxane by inhibiting COX. Aspirin inhibits thromboxane inhibiting. Aspirin inhibits COX. Okay. Immunosuppressants increase risk of infection. Histamine H3 receptors are present in brain. Histamine H3 receptors are present in brain. Drug used in autoimmune disease is a methotrexate. Methotrexate used in autoimmune disease. Prostaglandins cause fever by acting on hypothalamus. Prostaglandins cause fever by acting on hypothalamus. Immunostimulant contraindicated in transplant patient is a interferon. Immunostimulant contraindicated. Okay, contraindicated interferon. Cyclosporine as a thiopurine tacrolimus are useful. Drug used in a chronic urticaria is a cetirizine. Urticaria. Drug used in chronic urticaria is a cetirizine. Histamine causes itching due to nerve stimulation. Histamine causes itching due to nerve stimulation. Immunosuppressant inhibiting purine synthesis is azathioprine. Azathioprine inhibits purine synthesis. Prostaglandins are not involved in sedation. Prostaglandins involved in inflammation, pain, and fever. Drug preventing allergic asthma attack is a chromoline sodium. Drug preventing allergic asthma attack is a chromoline sodium. Immunostimulant derived from bacteria is a BCG. Okay, Bacillus calmette-guerin. Immunostimulant derived from bacteria is a BCG. Histamine increases gastric acid secretion by increasing CAMP, cyclic AMP, adenosine monophosphate. Histamine increases gastric acid secretion by increasing cyclic adenosine monophosphate. Immunosuppressant used in a lupus is methotrexate. Immunosuppressant used in a lupus is a methotrexate. Drug blocking both COX-1 and COX-2 is a aspirin. Aspirin blocking both COX-1 and COX-2. Histamine antagonist causes least sedation is a loratadine. Loratadine causes least sedation. Diphenhydramine, promethazine, chlorpheniramine causes high sedation. Immunostimulants increase production of antibodies. Immunostimulants increase production of antibodies. Prostaglandins are synthesized at a site of action. Prostaglandin are synthesized at a particular location. Drug useful in a serum sickness is corticosteroids. Corticosteroids useful in a serum sickness. Immunosuppressant inhibiting interleukin 2 synthesis is cyclosporine. Cyclosporine inhibiting interleukin 2 synthesis. Histamine causes bronchoconstriction mainly via H1 receptors. Histamine causes bronchoconstriction mainly via H1 receptors. Drug used to prevent organ rejection is a cyclosporine. Prostaglandins are inactivated rapidly because they act locally. Prostaglandins are inactivated rapidly because they act locally. Immunostimulant useful in a viral infection is interferon. Immunostimulant useful in viral infection is interferon. Drug used in allergic rhinitis is a cetirizine. Cetirizine is used in allergic rhinitis. Immunosuppressants reduce rejection by inhibiting T cell function. Immunosuppressants reduce rejection by inhibiting T cell function. Histamine is inactivated mainly by methylation. Histamine is inactivated mainly by methylation. Drug stabilizing mast cells and preventing allergy is chromoline. Chromoline stabilizing mast cells and preventing allergy. Immunostimulant enhancing NK cell activity is interferon. Immunostimulant enhancing NK cells activity is interferon. Prostaglandin causing vasodilation is prostacyclin. Prostacyclin causing vasodilation. Drug causing immunosuppression and osteoporosis is corticosteroids. Drug causing immunosuppression. Corticosteroids causing immunosuppression and osteoporosis. Histamine causes edema by increased capillary permeability. Immunosuppressant used in psoriasis is a methotrexate. Methotrexate used in psoriasis. Corticoid involved in a shock is a histamine. Drug reducing allergic symptom without sedation is loratadine. Loratadine reducing allergic symptoms without sedation. Immunostimulant useful in immunodeficiency is interferon. Immunostimulant useful in immunodeficiency is interferon. Overall role of a corticoid is to act locally as a mediators. So, overall role of corticoid is to act locally as a mediators. So, move to the next topics.
So guys, our next topic is introduction to drug design and combinatorial chemistry. So let's start. Drug design is the process of discovering and developing new drugs. The primary aim of drug design is to reduce toxicity and increase efficacy. Lead compound is defined as a compound with desired biological activity. Lead optimization involves improving potency and selectivity. A rational drug design is based on knowledge of a biological target. Structure based drug design requires knowledge of target structure. Ligand based drug design is used when target structure is known. Pharmacophore is essential structures features for activity. QSR stands for quantitative structure activity relationship, not qualitative, it's quantitative structure activity relationship. QSR correlates biological activity with chemical structure. Hands-on analysis is used in QSR studies. Lipophilicity of a drug is expressed as log P. Increased lipophilicity generally increases membrane permeability. ADMET stands for absorption, distribution, metabolism, excretion, and toxicity. T for toxicity. Computer aided drug design is abbreviated as CAD. CADD. Computer aided drug design CAD. Molecular docking predicts a drug target interaction. Binding affinity refers to strength of a drug target interaction. Virtual screening involves screening compounds using computer models. Heat compound is compound showing desired activity in screening. Combinatorial chemistry is used to prepare large number of compounds. Combinatorial chemistry increases chemical diversity. Solid phase synthesis is a technique used in a combinatorial chemistry. Resin is used in combinatorial chemistry as a solid support. Split and mix method is used to generate large libraries. Split and mix method is used to generate large libraries. Chemically library is a collection of chemical compounds. High throughput screening allows testing thousands of compounds rapidly. Scaffold in a drug design refers to core structure of a molecule. Bioisotopes are used to modify drug properties. Bioisotopes are used to modify drug properties. Drug likeness is evaluated using Lipinski's rule. Drug likeness is evaluated using Lipinski rule. Lipinski rule of 5 includes molecular weight is less than 500 Dalton, log P means log lipophilicity like less than 5, H bond donor is less than 5, all of the above. So Lipinski rule of 5 includes all. Pharmacokinetic optimization focuses on ADME properties. Kinetic means ADME. Toxicophore is structural feature causing toxicity. Toxicophore is structural feature causing toxicity. Drug metabolism mainly occurs in liver. Drug metabolism mainly occurs in liver. Prodrug is designed to improve bioavailability. Prodrug is designed to improve bioavailability. Target validation ensures that target is involved in a disease. Target validation ensures that target is involved in a disease. Molecular modeling includes docking and simulation. Molecular modeling includes docking and simulation. SAR studies involve changes in chemical structure. SAR studies involve changes in a chemical structure. Fragment based drug design uses small chemical fragments. Fragment based drug design uses small chemical fragments. Lead compound usually has some limitations. Lead compound usually has some limitations. Chemical diversity improves chances of drug discovery. Chemical diversity improves chances of a drug discovery. Drug targets can be protein, enzyme, receptor, all of the above means drug target can be all. Enzyme inhibition studies help in drug design. Enzyme inhibition studies help in a drug design. Selectivity of a drug reduces side effects. Docking score indicates binding strength. Chemical synthesis in combinatorial chemistry is a parallel. Deconvolution is used to identify active compound. Deconvolution is used to identify active compound. Library size depends on number of building blocks and number of reactions. Drug repurposing involves using existing drugs for new indications. Drug repurposing involves using existing drugs for new indications. In silico studies are performed using computers. In silico studies are performed using computers. Binding site is located on target molecule. Binding site is located on a target molecule. Hydrogen bonding improves binding interaction. Molecular flexibility affects binding and activity. Molecular flexibility affects binding and activity. Drug design reduces failure in preclinical stage and clinical trials also. A drug design reduces failure in preclinical stage and clinical trials. Next, combinatorial chemistry is useful in early stage of a drug discovery. Combinatorial chemistry is used in early stage of a drug discovery. Peptide libraries are synthesized using solid phase synthesis. Peptide libraries are synthesized using solid phase synthesis. Chemical space refers to all possible chemical compounds. Chemical space refers to all possible chemical compounds. Optimization aims to improve ADMET profile, means absorption, distribution, metabolism, excretion, and T for toxicity. Okay. Target based screening requires non biological target. Phenotypic screening focuses on biological response. Phenotypic screening focuses on biological response. Drug design integrates chemistry and biology. Drug design integrates chemistry and biology. Molecular weight affects absorption, distribution, and permeability. Ex- Excessive lipophilicity leads to poor solubility. Excessive lipophilicity refers to poor solubility. Hydrophilic drug shows poor membrane permeability. Structure based design uses techniques like X-ray crystallography, NMR, and cryo-EM. Okay. Pharmacophore modeling identifies essential binding features. Pharmacophore modeling identifies essential binding features. Molecular descriptors are used in a QSR.
Drug discovery pipeline starts with target identification.
Drug discovery pipeline starts with target identification. Combinatorial chemistry reduces time for discovery. Drug design improves efficacy and safety. Fragment hits usually have low affinity. Op- Optimization may involve adding functional groups, removing toxic groups. Lead compound selection is based on activity and safety. Chemical synthesis strategy aims to produce diverse compounds. Chemical synthesis strategy aims to reduce diverse compounds. Rational drug design minimizes guesswork. Rational drug design minimizes guesswork. Drug design is an iterative process because continuous optimization is required. Drug design is an iterative process because continuous optimization is required. Screening cascade helps in eliminating weak compounds. Combinatorial chemistry is not used for clinical trials, but it is used for library generation, drug discovery, and lead identification. Heat to lead conversion improves. Heat to lead conversion improves potency, selectivity, drug like properties. Drug design considers safety early to reduce late stage failure. Drug design considers safety early to reduce late stage failure. Molecular interaction type includes hydrogen bonds, ionic interactions, hydrophobic interactions. Chemical optimization avoids toxic metabolites. Chemical optimization avoids toxic metabolites. Computer simulations save time and cost. Drug discovery success rate improves with rational design. Drug discovery success rate improves with a rational design. Molecular size affects absorption and distribution. Parallel synthesis allows multiple compounds simultaneously. Drug design helps in personalized medicine by targeting specific pathways. Optimization of solubility improves bioavailability. Optimization of solubility improves bioavailability. Pharmacophore features include hydrogen bond donor, hydrogen bond acceptor, hydrophobic region. Chemical library screening identifies active compounds. Drug design reduces animal usage by in silico screening means on computer. Lead optimization continues until acceptable balance of efficacy and safety. Drug discovery is a multidisciplinary process. Drug discovery is a multidisciplinary process. QSR models help in predicting activity of a new compounds. QSAR models help in predicting activity of a new compounds. Combinatorial chemistry mainly accelerates drug discovery. Target identification precedes screening. Target identification precedes screening. Drug design requires integration of chemistry, biology, and informatics. Virtual screening reduces number of compounds tested experimentally. Virtual screening reduces the number of compounds tested experimentally. Fragment-based design often leads to efficient optimization. Fragment-based design often leads to efficient optimization. Drug design ultimately aims to discover safe and effective medicines. Drug design ultimately aims to discover safe and effective medicines. Combinatorial chemistry complements drug design by generating diverse compounds rapidly. So guys, these are the 100 questions on drug design. So our next topic is poison means toxicology. In toxicology, there is 10 topics cover. So first one is poisons, chelators, heavy metals, insecticides, antidotes, CNS drug poisoning, genotoxicity, carcinogenicity, teratogenicity, and mutagenicity. So let's see. There is 200 MCQs on these 10 topics. First one is a only question and answers. Toxicology is the study of harmful effects of chemicals. Poison is defined as a substance which cause harm or death. Poison affecting CNS primarily is morphine. Classification of poisons based on action includes corrosive poisons, irritant poisons, or systemic poisons, all of the above. Corrosive poisons causes damage to tissues. Corrosive poison causes damage to tissue. A strong acid poisoning produces brown burns. Strong acid poisoning produces brown burns. Alkali poisoning produces liquefactive necrosis. Alkali poisoning produces liquefactive necrosis. Universal antidote contains charcoal, magnesium oxide, or tannic oxide, all of the above. Universal antidote contains charcoal, magnesium oxide, and tannic acid. Activated charcoal acts by adsorption. Chelating agents are used in a heavy metal poisoning. Chelating agents are used in heavy metal poisoning. EDTA is used in poisoning of lead. Remember, EDTA lead. Next, dimercaprol means BAL, British anti-Levset, is used in arsenic poisoning. Remember, EDTA lead and dimercaprol for arsenic. Penicillamine is useful in a copper poisoning. Penicillamine is used in a copper poisoning. Deferoxamine is an antidote for iron. Ferro, iron. Heavy metals accumulate mainly in bone and liver. Lead poisoning causes blue line on gums. Lead poisoning causes blue line on gums. Mercury poisoning affects central nervous system. Arsenic poisoning produces garlic odor. Arsenic poisoning produces garlic odor. Cyanide causes death by cellular hypoxia. Cyanide causes death by cellular hypoxia. Antidote for cyanide poisoning is amyl nitrate. Antidote for cyanide poisoning is amyl nitrate. Insecticide. Insecticides commonly cause poisoning by inhibiting acetylcholinesterase. Insecticides commonly cause poisoning by inhibiting acetylcholinesterase. Organophosphate poisoning causes cholinergic effects. Sludge syndrome is seen in organophosphate poisoning. Sludge syndrome is seen in organophosphate poisoning. Antidote for organophosphate poisoning is atropine. Organophosphate atropine. Antidote for organophosphate poisoning is atropine. Pralidoxime is useful in organophosphate poisoning. So, atropine and pralidoxime, both drugs are used in the treatment of organophosphate poisoning. Carbamate poisoning differs from OP poisoning because it is reversible. Carbamate poisoning differ from OP poisoning because it is reversible. DDT belongs to organochlorines. DDT belongs to organochlorines. Pyrethroid poisoning mainly causes neurotoxicity. Pyrethroid poisoning mainly causes neurotoxicity. Antidote for opioid poisoning is naloxone. Barbiturate poisoning causes CNS depression. Benzodiazepine antidote is a flumazenil. Benzodiazepine antidote is flumazenil. CNS stimulant poisoning includes amphetamine. Paracetamol toxicity affects liver. Antidote for paracetamol poisoning is N-acetylcysteine. Alcohol poisoning causes CNS depression. Methanol poisoning affects optic nerve. Antidote for methanol poisoning is ethanol. Antidote for methanol poisoning is ethanol. CNS depressant poisoning shows constricted pupils. Opioid overdose pupil is pinpoint. Opioid overdose pupil is a pinpoint. Management of poisoning includes removal of poison, supportive therapy, antidote administration, or all of the above. Gastric lavage is contraindicated in all of the above means alkali poisoning, acid poisoning, hydrocarbon poisoning. In these three conditions, gastric lavage is contraindicated. Forced alkaline diuresis is useful in salicylate poisoning. Forced alkaline diuresis is useful in salicylate poisoning. Salicylate poisoning causes respiratory alkalosis. Salicylate poisoning causes respiratory alkalosis. Antidote for salicylate poisoning is sodium bicarbonate. Acute iron poisoning causes GI bleeding. Acute iron poisoning causes GI bleeding. Iron poisoning antidote is deferoxamine. Genotoxicity refers to damage to genetic material. Mutagenicity causes DNA mutation. Mutagenicity causes DNA mutation. Carcinogenicity leads to cancer. Carcinogens causing cancer. Teratogenicity affects fetus. Teratogenicity affects fetus. Thalidomide is known for causing teratogenicity. Mutagens include UV radiation, chemicals, or viruses. These three factors causing mutagenicity are called mutagens. Ames test is used to detect mutagenicity. Genotoxic agents cause damage to DNA. Genotoxic agents cause damage to DNA. Carcinogens may act by both A and B means carcinogens may act by DNA mutation or epigenetic changes. Teratogens cause maximum damage during first trimester. Teratogens cause maximum damage during first trimester. Heavy metal causing Minamata disease is a mercury. Yum yum, just remember mercury Minamata disease. Cadmium poisoning affects bone, kidney, and lung. Cadmium poisoning affects both bone, kidney, and lung. Antidote for benzodiazepine poisoning is a flumazenil. Chronic lead poisoning causes anemia, hypertension, or neuropathy. Lead poisoning causes anemia, hypertension, or neuropathy. Acute mercury poisoning primarily causes damage to CNS. Mercury poisoning causes CNS means Minamata disease like. Antidote useful in mercury poisoning is penicillamine. Antidote used in mercury poisoning is penicillamine. Arsenic causes toxicity by inhibiting ATP synthesis. Arsenic causes toxicity by inhibiting ATP synthesis. Chronic arsenic poisoning causes hyperpigmentation, Mees lines, or peripheral neuropathy. Lead interferes with synthesis of hemoglobin. Lead interferes with synthesis of hemoglobin. Chelator preferred in acute lead encephalopathy is BAL. British anti-Levisite is preferred in acute lead encephalopathy. Iron poisoning initially causes severe vomiting and diarrhea. Iron poisoning initially causes severe vomiting and diarrhea. Chronic iron overload disease is called hemochromatosis. Chronic iron hemochromatosis. Itai disease is caused by cadmium. Itai disease is caused by cadmium. Organophosphate poisoning causes meiosis due to parasympathetic stimulation. Organophosphate poisoning causes meiosis due to parasympathetic stimulation. Atropine reverse organophosphate poisoning by blocking muscarinic receptors. Atropine reverses organophosphate poisoning by blocking muscarinic receptors. Pralidoxime is effective only if given before aging occurs. Pralidoxim is effective only if given before aging occurs. Organophosphate insecticide include malathion. Organophosphate insecticides include malathion. Carbamate poisoning differs from OP poisoning because it causes reversible inhibition. DDT poisoning mainly causes CNS excitation. DDT poisoning mainly causes CNS excitation. Pyrethroid insecticides are generally safe with low mammalian toxicity. CNS depressant poisoning commonly present with coma. CNS depressant poisoning commonly present with coma. Opioid poisoning tried includes Mcqs, respiratory depression, and coma. Opioid poisoning, Mcqs, respiratory depression, and coma. Naloxone acts by blocking opioid receptors. Naloxone acts by blocking opioid receptors. Morphine overdose causes respiratory depression due to action on medulla. Morphine overdose causes respiratory depression due to action on medulla. Barbiturate poisoning is treated primarily by supportive care. Barbiturate poisoning is treated primarily by supportive care. Benzodiazepine poisoning is usually mild. Benzodiazepine poisoning is usually mild. Flumazenil should be used cautiously because it may cause. Flumazenil should be cause seizures. Flumazenil should be used cautiously because it may cause seizures. Paracetamol toxicity produces liver damage due to formation of a NAPQI. N-acetylcysteine acts by replenishing glutathione. N-acetylcysteine acts by replenishing glutathione. Alcohol withdrawal is characterized by delirium tremens. Alcohol withdrawal is characterized by delirium tremens. Methanol toxicity causes metabolic acidosis due to formation of a formic acid. Methanol toxicity causes metabolic acidosis due to formation of formic acid. Ethylene glycol poisoning leads to formation of a oxalic acid. Ethylene glycol poisoning leads to formation of oxalic acid. Antidote for ethylene glycol poisoning is ethanol. Antidote for ethylene glycol poisoning is ethanol. CNS stimulant poisoning commonly causes seizures. CNS stimulant poisoning commonly causes seizures. Cocaine toxicity, cocaine toxicity causes sympathetic stimulation. Management of seizures in poisoning includes use of a diazepam. Universal antidote is not useful in alkali poisoning, but universal antidote is useful in a acid poisoning, drug overdose, or unknown poisoning. But in alkali poisoning, universal antidote is not useful. Forced alkaline diuresis enhances elimination of weak acids. Forced alkaline diuresis enhances elimination of weak acids. Hemodialysis is useful in a poisoning with methanol. Hemodialysis, methanol. Genotoxicity testing detects DNA damage. Genotoxicity testing detects DNA damage. Mutations occurring in germ cell affects offspring. Mutations occurring in germ cell affects offspring. Somatic mutations may lead to cancer. Carcinogens initiate cancer by DNA damage. Carcinogens initiate cancer by DNA damage. Tumor promoters differ from initiators because they promote cell proliferation. Tumor promoters differ from initiators because they promote cell proliferation. Teratogenic effect depends on dose, time of exposure, genetic susceptibility. Placenta acts as partial barrier. Placenta acts as a partial barrier. Thalidomide exposure causes phocomelia. Thalidomide exposure causes phocomelia. Valproic acid is associated with neural tube defects. Valproic acid is associated with neural tube defects. Genotoxic carcinogens acts by direct DNA damage. Genotoxic carcinogens act by direct DNA damage. Non-genotoxic carcinogens act by promoting cell proliferation. Non-genotoxic carcinogens act by promoting cell proliferation. Ames test use which organism? Salmonella typhimurium. Ames test uses which organism? Is a Salmonella typhi. Micronucleus test detects chromosomal damage. Micronucleus test detects chromosomal damage. Teratogenic risk is highest during birth. Okay. During organogenesis. Teratogenic risk is highest during organogenesis. Fetal alcohol syndrome includes growth retardation, facial abnormalities, and CNS defects. Chemical mutagens include alkylating agents, heavy metals, and aflatoxins. These three are the chemical mutagens. Physical mutagens include UV rays, X rays, or gamma rays. Biological mutagens include viruses only, not bacteria or fungi. Viruses are a biological mutagens. Carcinogenicity testing is usually done in animals. Carcinogenicity testing is usually done on animals. Risk assessment in toxicology includes hazard identification, dose response assessment, exposure assessment. LD50 represents dose lethal to 50% animals. Lethal dose 50 means dose lethal to 50% animals. Acute toxicity studies in all single dose exposure. Acute toxicity studies in all single dose exposure. Chronic toxicity studies detect long term effects. Chronic toxicity studies detect long term effects. A safety margin is calculated using LD50 to the ED50, means lethal dose to effective dose are called a safety margin, are also called as a therapeutic index. A main goal of toxicology is to prevent and manage toxic effects. Acute cyanide poisoning causes death due to cellular hypoxia. A bitter almond smell is characteristic of a cyanide. Bitter almond smell is characteristic of a cyanide. A cyanide antidote kit includes amyl nitrate and sodium thiosulfate. Sodium nitrate acts in cyanide poisoning by forming methemoglobin. Okay, methemoglobin. Sodium thiosulfate acts by conversion of cyanide to thiocyanate. Carbon monoxide poisoning causes tissue hypoxia. Antidote for carbon monoxide poisoning is 100% oxygen. Antidote for carbon monoxide poisoning is 100% oxygen. Cherry red discoloration is seen in carbon monoxide poisoning. Cherry red discoloration is seen in a carbon monoxide poisoning. Organophosphate poisoning causes muscle weakness due to nicotinic receptor stimulation. Organophosphate poisoning causes muscle weakness due to nicotinic receptor stimulation. Intermediate syndrome is seen in organophosphate poisoning. Intermediate syndrome is seen in organophosphate poisoning. Delayed neuropathy is associated with organophosphates. Delayed neuropathy is associated with the organophosphates. Organochlorine insecticide acts by blocking sodium channels. Organochlorine insecticides act by blocking sodium channels. Linden belongs to organochlorines. Linden belongs to organochlorines. Antidote for organochlorine poisoning is no specific antidote. There is no specific antidote for organochlorine poisoning. Paraquat poisoning primarily affects lung. Paraquat poisoning primarily affects lung. Management of paraquat poisoning includes activated charcoal. and where it acts paraquat poisoning on lungs. Rodenticide zinc phosphate releases phosphine gas. Rodenticide zinc phosphide releases phosphine gas. Phosphine causes toxicity by inhibiting oxidative phosphorylation. Anticoagulant rodenticides act by inhibiting vitamin K cycle. Anticoagulant rodenticides act by inhibiting vitamin K cycle. Antidote for warfarin poisoning is a vitamin K. CNS stimulant poisoning causes hyperthermia due to increased muscle activity. Amphetamine poisoning presents with agitation and hallucinations. Amphetamine poisoning presents with agitation and hallucinations. Management of stimulant poisoning includes benzodiazepines. Stimulant poisoning, benzodiazepines. Tricyclic antidepressant poisoning causes arrhythmia. TCA poisoning causes arrhythmia. Antidote for TCA poisoning is sodium bicarbonate. Antidote for tricyclic antidepressant poisoning is a sodium bicarbonate. CNS depressant poisoning initially causes sedation. Phenothiazine poisoning causes hypotension, extrapyramidal symptoms, and anticholinergic effects. Antipsychotic poisoning management includes supportive care. Antipsychotic poisoning management includes supportive care. Isoniazid poisoning causes seizures due to deficiency of a vitamin B6. Causes seizures due to deficiency of a vitamin B6. Antidote for isoniazid poisoning is pyridoxine. Neuroleptic malignant syndrome is associated with antipsychotics. Neuroleptic malignant syndrome is associated with antipsychotics. Serotonin syndrome is caused by overdose of selective serotonin reuptake inhibitors. Serotonin syndrome is caused by overdose of SSRIs. Cyanosis without explaining hypoxia suggests methemoglobinemia. Cyanosis without explaining hypoxia suggests methemoglobinemia. Drug causing methemoglobinemia includes nitrates. Nitrates causing methemoglobinemia. Antidote for methemoglobinemia is methylene blue. Methylene blue is an antidote for methemoglobinemia. Chronic alcohol use causes deficiency of a thiamine. Chronic alcohol use causes deficiency of a thiamine. Wernicke encephalopathy is due to deficiency of a thiamine. Wernicke's Wer- Wernicke encephalopathy is due to deficiency of a thiamine. Thiamine should be given before glucose to prevent Wernicke's encephalopathy. Chronic arsenic exposure increases risk of skin cancer, lung cancer, and liver cancer. Chronic arsenic exposure increases risk of skin cancer, lung cancer, or liver cancer. Carcinogens causing DNA mutations are called initiators. Carcinogens causing DNA mutations are called initiators. Tumor promoters are tumor promoters are non-genotoxic. Threshold dose is relevant for non-genotoxic carcinogens. Teratogenic effects are least likely in third trimester. ACE inhibitors are teratogenic in third trimester. Mutagens causing base pair substitution include alkylating agents. Frame shift mutations are caused by intercalating agents. Frame shift mutations are caused by intercalating agents. UV radiation causes thymine dimers. UV radiation causes thymine dimers. Ionizing radiation causes DNA strand breaks. Ionizing radiation causes DNA strand breaks. Test used for chromosomal
aberration is micronucleus test. Micronucleus test is used for chromosomal aberrations. Comet assay detects DNA strand breaks. Comet assay detects DNA strand breaks. Teratogenic drug cross placenta by passive diffusion. Teratogenic drugs cross placenta by passive diffusion. Placental transfer increases with high lipophilicity. Placental transfer increases with high lipophilicity. Thalidomide disaster occurred due to lack of a preclinical teratogenic testing. Thalidomide disaster occurred due to lack of a preclinical teratogenic testing. FDA pregnancy category X drugs are contraindicated. FDA pregnancy category X drugs are contraindicated. Genetic toxicity testing is mandatory for new drugs. Genetic toxicity testing is mandatory for new drugs. Long-term carcinogenicity studies are done for 2 years. Long-term carcinogenicity studies are done for 6 means 2 years. Bioaccumulation is common with organochlorines. Bioaccumulation is common with the organochlorines. Dioxins are known for chronic toxicity and cancer. Dioxins are known for chronic toxicity and cancer. NOAEL stands for No Observed Adverse Effect Level. NOAEL stands for No Observed Adverse Effect Level. And LOEL means lowest dose with adverse effect. Okay, lowest dose with adverse effect. Safety factor is used in a risk assessment. Safety factor is used in risk assessment. Acceptable daily intake is calculated using NOEL. Okay, means no observed adverse event level. Acute toxicity testing is determines LD50. Chronic toxicity studies detect long-term adverse effects. Chronic toxicity studies detect long-term adverse effects. Chronic toxicity studies detect long-term adverse effects. Reproductive toxicity studies assess fertility, embryo toxicity, or teratogenicity. Means all of the above. Reproductive toxicity studies assess fertility, embryo toxicity, or teratogenicity. Mutagenicity testing is essential to predict carcinogenic potential. Mutagenicity testing is essential to predict carcinogenic potential. Post-marketing surveillance detects a rare adverse effect. Environmental toxicology studies pollutant effects. Environmental toxicology means pollutant effects. Occupational toxicology deals with workplace exposures. Occupational toxicology deals with workplace exposures. Clinical toxicology focuses on diagnosis and treatment of a poisoning. Clinical toxicology focuses on diagnosis and treatment of poisoning. Forensic toxicology is used in a legal investigations. Analytical toxicology involves detection and measurement of toxins. Analytical toxicology involves detection and measurement of toxins. Biomarkers in toxicology indicate exposure or effect. Biomarkers in toxicology indicate exposure or effect. Toxicokinetic studies ADME of toxic substances. Half-life of a poison affects duration of a toxicity. Elimination of poison can be enhanced by forced dialysis or chelation. Supportive management in poisoning includes airway maintenance, breathing support, or circulation support. Antidotes are most effective when given early. Poison Information Center provides immediate management guidance. Poison Information Center provides immediate management guidance. Ultimate goal of toxicology is to protect human health. Okay.
So guys, our next topic is sterilization principle and procedures, aseptic techniques, disinfection and disinfectants, pyrogen and pyrogen testing, and assay of antibiotics and vitamins. Let's start. Only question and their answer. Sterilization is defined as complete destruction of all forms of a life, means microorganism. Autoclave works on the principle of moist heat under pressure. Autoclave, moist heat. Standard autoclaving condition is 121 degrees Celsius for 15 minutes at 15 psi pressure. Okay, this is the standard autoclaving conditions. Dry heat sterilization is done by hot air oven. Standard condition for hot air oven is 160 degrees Celsius for 2 hours. Moist heat causes microbial death by protein coagulation. Dry heat kills microorganisms by oxidative damage. Dry heat, oxidative damage, and moist heat, protein coagulation. Filtration sterilization is mainly used for heat sensitive liquids. Filtration sterilization is mainly used for heat sensitive liquids. Membrane filters commonly have pore size of 0.22 micrometer. HEPA filters remove particles of size zero point 0.3 micrometer. Radiation sterilization includes gamma rays. Radiation sterilization includes gamma rays. UV radiation has poor penetration and is used for room air sterilization. Aseptic technique means prevention of a contamination. Okay. Aseptic technique means prevention of a contamination. Laminar airflow works on the principle of unidirectional airflow, means single side, one directional. Laminar airflow works on the principle of a unidirectional airflow. Class 100 area means 100 particles per cubic foot. Okay. Class 100 area means 100 particles per cubic feet foot. Disinfection differs from sterilization. Disinfection differs from sterilization because it eliminates pathogenic organism. Chemical disinfectant effective against spore is a glutaldehyde. Which chemical? Glutaldehyde. Phenol coefficient measures disinfectant efficiency. Phenol coefficient measures disinfectant efficiency. Phenol coefficient compares disinfectant with phenol. Alcohols are ineffective against spores. Alcohol are ineffective against spores. Chlorine acts by oxidation. Chlorine acts by oxidation. Iodine acts by oxidation and protein denaturation. Iodine acts by oxidation and protein denaturation. Disinfectant suitable for skin is chlorhexidine. Pyrogens are lipopolysaccharides. Pyrogens mainly originate from gram-negative bacteria. Pyrogens cause fever. Pyrogens are resistant to autoclaving because moist heat, okay, are resistant. Autoclaving. Pyrogen remove is done by dry heat at high temperature. A rapid pyrogen test is based on a rise in a body temperature. Limulus amoebocyte lysate test detects pyrogens. LAL test. LAL test uses blood cells of a mouse, a horseshoe crab. Okay. LAL test uses blood cells of a horseshoe crab. Endotoxins are present in gram-negative bacteria. Sterility testing media includes thioglycolate medium. Sterility testing media includes thioglycolate medium. Incubation temperature for sterility testing is 20 to 25 degrees Celsius and 30 to 35 degrees Celsius. These are the incubation temperature for sterility testing. Assay of antibiotics is done to determine potency of an antibiotic. Antibiotic assay is usually expressed in a IU. Antibiotic assay is usually expressed in IU. Microbiological assay is based on a inhibition of a microbial growth. Agar diffusion method includes cup plate method. Agar diffusion method includes cup plate method. Cylinder plate method is also known as a cup plate method. Cylinder plate method is also known as a cup plate method.
Turbidimetric method measures growth turbidity. Turbidimetric method measures growth turbidity. Test organism for penicillin assay is Staphylococcus aureus. Test organism for penicillin assay is Staphylococcus aureus. Vitamin B12 assay organism is Lactobacillus leishmani. Vitamin B12 assay organism is Lactobacillus leishmani. Vitamin assay is usually done by microbiological method. Vitamin assay is usually done by microbiological method. Microbiological vitamin assay is based on growth promotion. Microbiological vitamin assay is based on a growth promotion. Test organism for vitamin B6 is Lactobacillus casei. B6 casei. Test organism for vitamin B6 is Lactobacillus casei. Standard use in an antibiotic assay is reference standard, not working impurity internal. Standard used in an antibiotic assay is a reference standard. Parallel line assay compares standard and a test means two. Standard and test simultaneously work both simultaneously. Parallel line assay compares standard and test. Validity of assay depends on parallelism, linearity, or accuracy. Validity of assay depends on parallelism, linearity, and accuracy. Means all of the above. Disinfectants are tested by phenol coefficient test. Phenol coefficient greater than 1 indicates disinfectant is more effective than phenol. Phenol coefficient greater than 1 indicates disinfectant is more effective than phenol. Pasteurization kills pathogenic bacteria. Pasteurization kills pathogenic bacteria. Holder method of pasteurization is 63 degrees Celsius for 30 minutes. And option B, 72 degrees Celsius for 15 is a flash method, and 63 degrees Celsius for 30 minutes is a holder method. High temperature short time pasteurization is high temperature means 72 degrees Celsius, also called as a flash method, for 15 second. Okay, HTST means pasteurization is 72 degrees Celsius for 15 second. Disinfectant effective against mycobacteria is alcohol. Disinfectant effective against mycobacteria is alcohol. Spores are best destroyed by autoclaving. Spores are best destroyed by autoclaving. Antiseptic differ from disinfectants as they are used on a living tissue. Antiseptic living tissue and disinfectants are inanimate objects like non-living. Ethylene oxide sterilization is used for heat sensitive equipment. Ethylene oxide sterilization is used for heat sensitive equipment. Gas sterilization kills by alkylation. Gas sterilization kills by alkylation. Biological indicator for autoclave is Bacillus styrothermophilus. Biological indicator for autoclave is Bacillus styrothermophilus. Biological indicator for dry heat is Bacillus subtilis. And for moist heat means autoclave, Bacillus styrothermophilus. And for dry heat is a subtilis. Chemical indicator for sterilization includes Brown's tube. Chemical indicator Brown's tube. A disinfection level required for operation theater is high. Disinfection level required for operation theater is high. Glutaraldehyde is classified as a high level disinfectant. Glutaraldehyde is classified as a high level disinfectant. Pyrogen testing is mandatory for injectables. A LAL test is preferred because it is rapid and sensitive. Rapid pyrogen test limitation is ethical issues. Antibiotic assay organism should be highly sensitive strain. Antibiotic assay organism should be highly sensitive strain. Agar diffusion assay depends on drug solubility and diffusion. agar diffusion assay depends on drug solubility and diffusion. Zone of inhibition is measured in micrometer, millimeter. Okay. Zone of inhibition is measured in Turbidimetric assay is based on optical density. Turbidimetric assay is based on optical density. Vitamin C assay is usually done by chemical titration. Vitamin C assay is usually done by chemical titration. Microbiological assay is preferred when biological activity is important. When then microbiological assay is preferred. Sterility test must be performed under laminar airflow. Sterility test must be performed under laminar airflow. Aseptic area pressure should be positive. Aseptic area pressure should be positive. Disinfectant effectiveness is reduced by organic matter. Disinfectant effectiveness is reduced by organic matter. Iodophores are complexes of iodine with polymers. Iodophores, iodine with polymers. Chlorhexidine is ineffective against spores. Chlorhexidine is ineffective against spores. Sterilization validation ensures consistent sterility. Sterilization validation ensures consistent sterility. D value represents time to reduce population by 90%. Z value represents temperature change to reduce D value. F0 value indicates equivalent minutes at 121 degrees Celsius. F0 means for 121 degrees Celsius for time. Antibiotic assay must be performed using sterile conditions. Antibiotic assay must be performed using sterile conditions. Microbial limit test checks bioburden, not potency, sterility, biopyrogens. Microbial limit test checks bioburden. Disinfectant act better at high temperature. Disinfectant acts better at a high temperature. Antibiotic assay is invalid if non-parallel line occurs. Vitamin assay organism should require only taste vitamin for growth. Vitamin assay organism should require only taste vitamin for growth. Lal test detects endotoxin by gel formation. Lal test detects endotoxin by gel formation. Disinfectant concentration should be high, optimal. Disinfectant concentration should be optimal. Alcohol concentration most effective is 70%. 70% alcohol mainly used. Phenolics are ineffective against spores. Phenolics हो गया, chlorhexidine, all of them are ineffective against spores. Last 10 question. Antibiotic assay is an example of a biological standardization. Antibiotic assay is an example of biological standardization. Vitamin B1 assay organism is Lactobacillus fermenti. Lactobacillus fermenti, vitamin B1. Sterilization by incineration is used for waste materials. Means like for direct convert to into ash. Okay. Sterilization by incineration is used for waste materials. Formaldehyde sterilization is done by gas. Formaldehyde is a gas, formaldehyde, glutaraldehyde. Formaldehyde sterilization is done by gas. Aseptic failure leads to reduced potency, contamination, pyrogen formation, or all of the above. Aseptic failure leads to all of the above. Disinfectant testing organism includes Staphylococcus aureus, Salmonella type, Pseudomonas aeruginosa, all of the above. Disinfectant testing includes all organisms like Staphylococcus aureus, S. typhi, or Pseudomonas aeruginosa. Antibiotic assay results is expressed as IU per mg. Okay, these are the antibiotic assay result is expressed as IU per mg. Microbiological assay are less accurate than chemical assay because living organisms are used. In microbiological assay, living organisms are used. That's why they are less accurate. Microbiological assays are less accurate than chemical assays because living organisms are used. Sterilization monitoring ensures safety and quality. Main aim of sterilization in a pharmaceutical is to prevent microbial contamination. Let's move to the next topic. So our next topic is biochemical, serological and virological techniques. And next BOD means biochemical oxygen demand and different media. So let's start. BOD means biochemical oxygen demand. First question, biochemical tests are used for identification of microorganisms. Catalyst test detects presence of enzyme. Catalyst enzyme. Catalyst test differentiates streptococci and staphylococci. Oxidase test detects enzyme cytochrome oxidase. Oxidase positive organism is Pseudomonas. Indole test detects degradation of tryptophan. Test tryptophan. Indole positive organism is protease enzyme means organism. Methyl red test indicates mixed acid fermentation. Methyl red test indicates mixed acid fermentation. August Procascore test detects acetone production. August Procascore test detects acetone production. Citrate utilization test checks ability to use citrate. Citrate positive organism is Klebsiella. Citrate positive organism is Klebsiella. Urease test detects hydrolysis of urea. Urease test detects hydrolysis of urea. Strong urease positive organism is protease. 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 Strong urease positive organism is a protease. Next, TSI agar test for gas and hydrogen sulfide production. TSI agar test for gas and hydrogen sulfide production. Black precipitate in TSI indicates hydrogen sulfide. Serology deals with study of serum and antibodies. Serology deals with study of serum and antibodies. Antigen is defined as substance that produce antibodies. Antigen is defined as a substance that produce antibodies. It's a foreign microorganism. Okay, like pathogens. Antibody is produced by B lymphocytes. Antibody is produced by B lymphocytes. Antigen antibody reaction is highly specific. Agglutination reaction involves particulate antigen. Agglutination reaction involves particulate antigen. Next, Vidal test is used to diagnose typhoid. Vidal test typhoid. Precipitation reaction occurs between soluble antigen and antibody. ELISA stands for enzyme link immunosorbent assay. ELISA is commonly used for detection of hormones and antibodies. ELISA is commonly used for detection of hormones and antibodies. A Western blot is used to confirm diagnosis of a HIV. Western blot is used to confirm diagnosis of HIV. Virology is a study of a viruses. Viruses require host cell for replication. Viral cultivation is done using tissue culture. Viral cultivation is done using tissue culture. Cytopathic effect refers to cell death due to virus. Cytopathic effect refers to cell death due to virus. Inclusion bodies are seen in viral infections. Inclusion bodies are seen in viral infections. Heme agglutination test is used for viruses like influenza. PCR stands for polymerase chain reaction. PCR is used to detect DNA or RNA. RT-PCR is used for detection of a RNA virus. Reverse transcriptase RT means for RNA viruses.
like HIV. ELISA is an example of a serological test. ELISA is an example of a serological test. BOD stands for biochemical oxygen demand. BOD, not a biological oxygen demand, it's a biochemical oxygen demand. BOD measures oxygen required by microbes. Biochemical oxygen demand measures oxygen required by microbes. High BOD indicates polluted water. Means there is so many microorganisms required more oxygen. So that's why there is a high BOD. High BOD indicates polluted water. BOD test is performed for water quality. BOD test is performed for water quality. Incubation period for BOD test is 5 days. Incubation period for BOD test is a 5 days. Culture media is used for growth of a microorganisms. Simple media example is nutrient agar. Nutrient agar is a simple media. Enriched media contains added blood or serum. Enriched media contains added blood or serum. Blood agar is an example of a enriched media. Blood agar is an example of enriched media. Chocolate agar is used for Nigeria. Okay. Chocolate agar is used for Nigeria. Selective media inhibits growth of a non-targeted organisms. McConkey agar is selective for gram-negative bacteria. McConkey agar is selective for gram-negative bacteria. McConkey agar differentiates lactose fermenters by pink colonies. McConkey agar differentiates lactose fermenters by pink colonies. Transport media is used to preserve specimen. Transport media is used to preserve specimen. Carry Blair medium is used for stool samples. Carry Blair medium is used for stool samples. Anaerobic media example is Robertson Cook meat media. Anaerobic Robertson Cook meat medium. Enrichment media favors growth of a desired pathogen. Enrichment media favors growth of a desired pathogen. Alkaline peptone water is enrichment media for Vibrio cholera. Alkaline peptone water is enrichment media for Vibrio cholera. Differential media allows differentiation based on biochemical reaction. Differential media allows differentiation based on a biochemical reaction. Lowenstein-Janssen medium is used for Mycobacterium tuberculosis. Lowenstein-Janssen medium is used for Mycobacterium tuberculosis. Sugar media is used to test fermentation reactions. Sugar media is used to test fermentation reactions. Indicator used in sugar media is phenol red. Indicator used in a sugar media is phenol red. Acid production in sugar media causes color change to yellow. Acid production in sugar media causes color change to yellow. Gas production in sugar media is detected by Durham tube. Gas production in sugar media is detected by Durham tube. Media must be sterilized before use to prevent contamination. Blood agar shows hemolysis patterns such as alpha, beta, or gamma. Blood agar shows hemolysis patterns such as alpha, beta, and gamma. Beta hemolysis indicates complete hemolysis. Beta hemolysis indicates complete hemolysis. Media pH affects growth rate, colony size, and enzyme activity. Viral transport media preserves viruses. Viral transport media prevents viruses, preserve viruses. Serological tests are useful for acute infections and past infections. Serological tests are useful for acute infections and past infections. Rising antibody titer indicates active infection. Rising antibody titer indicates active infection. Neutralization test measures ability of antibody to neutralize virus toxin. Complement fixation test requires complement, antigen and antibody, all of the above. Complement fixation test requires complement, antigen and antibody. False positive serological test may occur due to cross reaction, contamination and improper storage. Rapid diagnostic tests are based on serology. Rapid diagnostic tests are based on serology. Virological diagnosis can be done by culture, antigen detection, nucleic acid detection. Plaque assay is used to measure viral infectivity. Plaque assay is used to measure viral infectivity. One plaque corresponds to one virus particle. One plaque corresponds to one virus particle. TCID50 is used in viral quantification. TCID50 is used in a viral quantification. Media containing dyes and indicators are called indicator media. BOD is inversely proportional to water quality. BOD test uses incubation temperature of 20 degrees Celsius. BOD test uses incubation temperature of 20 degrees Celsius. Media used for fungal culture is Sabarod dextrose agar for fungal culture. Sabarod agar has acidic pH to inhibit bacteria. Enzyme link test increase sensitivity because of enzyme amplification. A latex agglutination test is used for rapid antigen detection. Latex agglutination test is used for rapid antigen detection. A latex agglutination test is used for rapid antigen detection. Viability of viruses is maintained by cold storage. Media sterility is checked by incubation without inoculation. Biochemical test require pure culture. Biochemical test require pure culture. Serological cross reaction reduces specificity. Viral envelope is composed of lipid and a protein. Viral envelope is composed of a lipid and a protein. Non-envelope viruses are more resistant to detergents. Non-envelope viruses are more resistant to detergents. Media for anaerobic bacteria must be oxygen free. Anaerobic means no absence of oxygen, so oxygen free. Quality of media affects identification, growth, and test results. Quality of media affects identification, growth, and test results. Biochemical reactions are detected by color change, gas formation, precipitate. These three factors are identified by biochemical reactions detected. Serological tests are mainly qualitative but can be quantitative. Okay. Serological tests are mainly qualitative but can be quantitative. Viral load estimation uses PCR. Viral load estimation uses PCR. Media shelf life depends on composition, storage conditions, and sterility. Media shelf life depends on composition, storage, and sterility. BOD estimation indirectly measures biological pollution, means water quality. BOD estimation indirectly measures biological pollution. Serological window period refers to no antibody detectable. Serological window period refers to no antibody detectable. Virological safety requires biosafety cabinet, PPE, proper waste disposal, all of the above. Virological safety requires all of the above, means biosafety cabinet, PPE, or proper waste disposal. Media contamination most commonly occurs due to poor aseptic technique. Media contamination most commonly occurs due to poor aseptic technique. Diagnostic microbiology relies on a combination of Diagnostic microbiology relies on a combination of culture and microscopy, biochemical test, serology and molecular test. All tests. Accuracy of a biochemical test depends on media quality, incubation conditions, and proper interpretation. These three factors are required for accuracy of a biochemical test. Last question. Overall purpose of a microbiological technique is to identify and control microbes. Overall purpose of a microbiological technique is to identify and control microbes. So guys, our next topic is carbohydrates, proteins, lipids, DNA, RNA, nucleic acids and enzymes. These topics comes under subject biochemistry. Let's start. Basics questions and here directly answer. The primary source of energy in the body is a carbohydrates. The primary source of energy in the body is a carbohydrates. The end product of glycolysis is pyruvate. The end product of a glycolysis is a pyruvate. Glycolysis occurs in the cytoplasm. Glycolysis occurs in the cytoplasm. ATP is produced in glycolysis by substrate level phosphorylation. ATP is produced in glycolysis by substrate level phosphorylation. The rate limiting enzyme of a glycolysis is phosphofructokinase first. Anaerobic glycolysis converts pyruvate to lactate. Anaerobic glycolysis converts pyruvate to lactate. TCA cycle occurs in the mitochondria. Glycolysis cycle occurs in cytoplasm and TCA cycle occurs in mitochondria. Entry of carbohydrates into TCA cycle is as acetyl-CoA. Entry of carbohydrates into TCA cycle is as acetyl-CoA. The major regulatory enzyme of a TCA cycle is isocitrate dehydrogenase. The major regulatory enzyme of a TCA cycle is isocitrate dehydrogenase. Complete oxidation of a one glucose molecule yield about 30 to 32 ATP. Glycogen is stored mainly in liver, muscle and liver. Glycogen is stored mainly in muscle and liver. Glycogen breakdown is called glycogenolysis. Glycogen lysis. Glycogen breakdown is called glycogenolysis. Glycogen synthesis is called glycogenesis. Glycogen synthesis is called glycogenesis. Hormone stimulating glycogenolysis is a glucagon. Which hormone stimulating glycogenolysis means breakdown of a glycogen? It's a glucagon. Gluconeogenesis occurs mainly in a liver. Okay. Gluconeogenesis mainly occurs in a liver. Pentose phosphate pathway produces two products, PPA pathway, NADPH and ribose 5-phosphate. These are the two products of a pentose phosphate pathway. NADPH is required for fatty acid synthesis. NADPH is required for fatty acid synthesis. Major energy reserve of the body is fat. Major energy reserve of the body is a fat. Beta oxidation of fatty acid occurs in mitochondria. Beta oxidation of fatty acids occur in mitochondria. Each cycle of a beta oxidation produces one acetyl-CoA. Each cycle of beta oxidation produces one acetyl-CoA. Carnitine is required for transport of fatty acids. Carnitine is required for transport of fatty acids. Ketone bodies are formed in the liver. Ketone bodies are formed in the liver. Ketone bodies include all except means these are the all are the ketone bodies but one not. Acetoacetate is a ketone bodies. A beta hydroxybutyrate is a ketone body. Acetone is a ketone body, but lactate is a not a ketone body. Proteins are polymers of amino acids. Proteins are polymers of amino acids. Peptide bond is formed between one amino group and one carboxyl groups. Essential amino acids are those which must be supplied in a diet, means those are not synthesized in our body. So we need to taking from outside from diet. Transamination reaction requires coenzyme pyridoxal phosphate. Transamination reaction requires coenzyme pyridoxal phosphate. Deamination mainly occurs in the liver. Deamination mainly occurs in the liver. Ammonia is detoxified in liver by which cycle? Urea cycle. Ammonia is detoxified in liver by urea cycle. Urea cycle occurs in cytosol and mitochondria. Urea cycle occurs in cytosol and mitochondria. Means both places urea cycle happens. Cytosol and mitochondria. Nucleic acids are polymers of a nucleotides. Nucleic acids are polymers of a nucleotides. Components of a nucleotide include base, sugar plus phosphate. And for nucleoside, removing phosphate, only base or sugar are called a nucleoside. DNA sugar is deoxyribose nucleic acid. So sugar is a deoxyribose. RNA sugar is a ribose. Ribonucleic acid means ribose. Purine bases include ATGC. Okay, AG means adenine and guanine. These are the purine bases. Pyrimidine bases includes CUT like cytosine, uracil, and thymine. These three are the pyrimidine bases. DNA structure is a double helix. DNA structure is a double helix. Complementary base pairing in DNA is like purine equal to pyrimidine. So AT and GC. Okay, for DNA and AT GU for RNA. RNA differs from DNA by presence of uracil group. Okay, RNA differs from DNA by presence of uracil. mRNA carries information for protein synthesis. mRNA carries information for protein synthesis. tRNA function is to carry amino acids. tRNA function is to carry amino acids. rRNA is a component of a ribosome, means ribosomal RNA. So R for a ribosome. DNA replication occurs in nucleus. DNA replication occurs in a nucleus. Enzymes are mainly proteins. Enzymes are mainly proteins. Enzymes act by decreasing activation energy. Lock and key model explains enzyme specificity. Active site of enzyme binds substrate. Okay. Active site of enzyme binds substrate. Coenzymes are usually organic molecules like copper. Okay. Coenzymes are usually organic molecules. Apoenzyme plus cofactor forms holoenzyme. Apoenzyme plus cofactor are called a holoenzyme. Competitive inhibition increases Km. Competitive inhibition increases Km value and Vmax constant. Non-competitive inhibition affects Vmax only and Km is a constant. Okay. How to remember? In competitive, Vmax constant and Km value increases. Okay. Km increases for competitive and Vmax constant. In non-competitive, uh, Km constant and Vmax decrease. Change. Enzyme optimum pH for pepsin is acidic. Enzyme optimum pH for pepsin is acidic. Enzyme optimum temperature in humans is 37 degrees Celsius. It's a human body temperature. Isoenzyme differs in function, structure, and tissue distribution. Isoenzymes differ in function, structure, tissue distribution. LDH isoenzymes
are used in a diagnosis of myocardial infarction. LDH isoenzymes are used in a diagnosis of a myocardial infarction. Enzymes involved in digestion are called extracellular enzymes. Enzymes involved in digestion are called extracellular enzymes. Zymogens are inactive enzyme precursors. Zymogens are inactive enzyme precursors. Example of zymogen is pepsinogen. Example of a zymogen is a pepsinogen. ATP is classified as nucleotide. ATP is classified as a nucleotide. High energy bond in ATP is phosphoanhydride bond. High energy bond in ATP is phosphoanhydride bond. Enzyme kinetic studies rate of a reaction. Okay. Enzyme kinetics studies rate of a reaction. Mitchell's constant indicates substrate affinity. Lower Km indicates higher affinity. Lower Km indicates higher affinity. DNA transcription produces RNA. DNA transcription produces RNA. Translation occurs at ribosome level. Translation occurs at ribosome. Codon is present on microsomal RNA like mRNA. There is codon present. Codon is present on mRNA. Anticodon is present on tRNA. M means messenger for codon and anticodon for transfer RNA is a tRNA. Start codon for protein synthesis is AUG like August. AUG, remember August month. Start codon for protein synthesis is AUG. Stop codon includes except AUG all of the above like UAA, UAG and UGA. Not AAA, not triple G. These are the not a codon. UAA, UAG, UGA. These are the stop codon. Enzyme denaturation leads to loss of tertiary structure. Enzyme denaturation leads to loss of a tertiary structure. Heat mainly denatures enzyme by affecting hydrogen bonds. Heat mainly denatures enzyme by affecting hydrogen bonds. Allosteric enzyme shows sigmoidal curve. Allosteric enzyme shows sigmoidal curve. Allosteric site is different from active site. Means another site. Allosteric site is a different from an active site. Enzyme induction increases enzyme synthesis. Enzyme induction increases enzyme synthesis. Enzyme repression decreases enzyme synthesis. And enzyme induction increases enzyme synthesis and enzyme repression decreases enzyme synthesis. Lipoproteins transport lipids. Lipoprotein transport lipids. LDL transport cholesterol from liver to tissue. Low density lipoprotein transports cholesterol from liver to tissue. High density lipoprotein is called a good cholesterol. H for remember H for healthy. HDL means good cholesterol. Enzyme inhibitors are useful as a drugs. Enzyme inhibitors useful as a drugs. Aspirin acts by inhibiting enzyme cyclooxygenase. Like COX, aspirin acts by inhibiting enzyme cyclooxygenase. Rate of enzyme reaction increases with substrate until Vmax. Rate of enzyme reaction increases with substrate until Vmax. Metabolism refers to all chemical reactions in body are called metabolism. Catabolism involves energy release and anabolism energy gain. Okay. Energy consumption means anabolism and catabolism means energy release. Anabolism requires ATP like energy. Okay, because need a energy. Anabolism energy consumption. Enzymes are reusable because they are unchanged after reaction. Enzymes are reusable because they are unchanged after reaction.
Ribose sugar has carbon atoms equal to 5 because ribose is a pentose sugar, so 5 carbons. DNA stores genetic information in base sequences. DNA stores genetic information in base sequence. Mutation refers to change in DNA sequence. A mutation refers to change in a DNA sequence. Enzyme specificity is due to active site structure. Enzyme specificity is due to active site structure. Enzyme inhibitors decrease reaction rate. Enzyme inhibitors decrease reaction rate. Fatty acids are broken down to form acetyl CoA. Fatty acids are broken down to form acetyl CoA. Amino acids enter TCA cycle after conversion to keto acids. Okay. Amino acids enter TCA cycle after conversion to acetyl like keto acids. DNA polymerase requires primer because it cannot start chain synthesis. DNA polymerase requires primer because it cannot start chain synthesis. Okazaki fragments are formed during replication of a lagging strand. Okazaki fragments are formed during replication of a lagging strand. Enzymes are affected by heavy metals due to binding to sulfhydryl groups. Enzymes are affected by heavy metal due to binding to sulfhydryl groups. Vitamins acting as a coenzymes include B complex vitamins or water soluble vitamins. Okay. Vitamins acting as a coenzymes include all B complex vitamins. Metabolic disorders are caused due to defect in enzymes because metabolisms require enzymes. So metabolic disorders are caused due to defect in enzymes. Enzyme assay measures enzyme concentration. Enzyme assay measures enzyme concentration. DNA is more stable than RNA because double-stranded, lacks hydroxy group, or has thymine. Okay, in RNA there is uracil, but in DNA there is a thymine. So DNA is more stable than RNA because double strand like hydroxyl group or has thymine. Next, overall role of biochemistry is to understand life process at a molecular level. Overall role of a biochemistry is to understand life processes at a molecular level. So our next topic is recombinant DNA technology and immunological products like vaccine and serum. Let's start. Recombinant DNA technology involves combining DNA from different sources. Recombinant enzyme used to cut DNA at a specific site is restriction endonuclease. Restriction enzyme recognize palindromic sequences. Enzyme used to join DNA fragment is DNA ligase, ligase for join. Vector used in recombinant technology is plasmid. Plasmids are found naturally in bacteria. Plasmids are found naturally in a bacteria. Essential feature of a cloning vector is origin of a replication. Selectable marker genes are used to identify transform cells. Selectable marker genes are used to identify transform cells. Common selectable marker is antibiotic resistance gene. Selectable marker antibiotic resistance gene. Host commonly used in recombinant DNA technology is yeast, E. coli, animal cells. All of the above commonly used as a host for in recombinant DNA technology. Transformation refers to uptake of foreign DNA by a host cell. Expression vector is used for protein production. Expression vector is used for protein production. Recombinant insulin is produced using yeast or a bacteria. First recombinant protein approved for human use was insulin. cDNA means complementary DNA. It's synthesized using enzyme reverse transcriptase RT. Reverse transcriptase is isolated from retroviruses.
PCR is used to amplify DNA, means multiplication of a DNA. Taq polymerase is obtained from, Taq means Thermus aquaticus, is obtained from Thermus aquaticus. Recombinant vaccines are prepared by genetic engineering. Recombinant vaccines are prepared by genetic engineering. Advantage of recombinant vaccine is high purity and safety. Advantage of recombinant vaccine is a high purity and safety. Hepatitis B vaccine is a recombinant vaccine. EHB vaccine, recombinant vaccine. DNA vaccines work by injecting gene encoding antigen. DNA vaccine works by injecting gene encoding antigen. Subunit vaccine contains part of a pathogen, means subunit. It's a not a whole, some part of a pathogen. Recombinant growth hormone is used to dwarfism, means short height. Recombinant growth hormone is used to dwarfism. Recombinant erythropoietin is used to treat anemia. Erythropoietin makes blood, so anemia means loss of a blood. So for preventing anemia, we use a recombinant erythropoietin. Recombinant interferons are used in a viral infections and cancer. Monoclonal antibodies are produced using hybridoma technology. A hybridoma is formed by fusion of a B cell and myeloma cell. Monoclonal antibodies are highly specific. Immunological product includes vaccines and sera. Vaccine is defined as antigenic preparation to induce immunity. Vaccine is defined as antigenic preparation to induce immunity. Live attenuated vaccine produce immunity by stimulating immune response. Live attenuated vaccines produce immunity by stimulating immune responses. Example of a live attenuated vaccine is BCG, and tetanus, hepatitis B, rabies are killed. BCG killed vaccines are safer because they do not replicate. Killed vaccines are safer because they do not replicate. Toxoid vaccines are prepared from bacterial toxins, diphtheria or tetanus. Example of toxoid vaccine is tetanus, means tetanus toxoid, or one another is a diphtheria. Adjuvants are added to vaccine to enhance immune response. Adjuvants are added to vaccines to enhance immune response. Common adjuvant used in vaccine is aluminum hydroxide. Common adjuvant used in a vaccine is aluminum hydroxide. Passive immunity is provided by sera. Passive immunity is provided by sera. Antisera contain antibodies. Antisera contain antibodies. Sera are prepared by immunizing animals. Sera are prepared by immunizing animals. Antivenom is an example of a serum. Antivenom is an example of a serum. Passive immunity is short lasting. Passive immunity is a short lasting. Advantage of passive immunity is immediate protection. Disadvantage of sera is risk of a hypersensitivity. What is the disadvantage of sera? Is a risk of a hypersensitivity. Serum sickness is a type of hypersensitivity reaction. Serum sickness is a type of a hypersensitivity reaction. Vaccine generally include active immunity. I mean, it takes some time for preparing antibodies in body. Cold chain is required for vaccines. Cold chain is required for vaccines. A break in cold chain leads to loss of vaccine efficacy. Break in a cold chain leads to loss of vaccine efficacy. Recombinant technology reduces risk of infection transmission. Our technology reduces risk of infection transmission. Expression of a recombinant protein requires promoter, terminator, ribosome binding site, all of the above. So, expression of a recombinant protein requires all of the above. Gene cloning results in production of identical DNA copies. Gene cloning results in production of an identical DNA copies. Cloning means identical DNA copies. Downstream processing includes purification of a product. Downstream processing includes purification of a product. Recombinant vaccines are free from live pathogen. Recombinant hepatitis B vaccine antigen is produced in yeast. Recombinant hepatitis B vaccine antigen is produced in a yeast. Edible vaccines are produced using plants. Edible like plant. Edible vaccines are produced using plants. Biosafety concerns in recombinant technology include environmental release, gene transfer, and ethical issues. All of the above. Biosafety concerns in recombinant technology include all of the above factors. Recombinant products require strict quality control. Recombinant products require strict quality control. Vaccines stimulate immunity mainly by activating lymphocytes. Vaccines stimulate immunity mainly by activating lymphocytes. Booster dose of vaccine is required to enhance immune memory. Booster dose of a vaccine is required to enhance immune memory. Recombinant DNA technology is also called genetic engineering. rDNA technology is also called genetic engineering. Cloning site in vector is called MCS. Cloning site in vector is called a MCS. Blue-white screening is based on a LAC-Z gene. Blue-white screening is based on a LAC-Z gene. Recombinant vaccines mainly include induce active immunity. Recombinant vaccines mainly induce active immunity. Viral vectors used in a gene delivery include adenovirus, retrovirus, and lentivirus. All virus vectors used in a gene delivery. Serum antibodies are mainly IgG. Okay. Serum antibodies are mainly IgG, immunoglobulin G. Immunoglobulin G can cross the placenta. Immunoglobulin G can cross the placenta. Immunoglobulins are produced by B cells. Immunoglobulins are produced by B cells. Vaccine failure may occur due to improper storage, poor immune response, wrong schedule. So, all of the above. Vaccine failure may occur due to all factors. Recombinant clotting factor 8 is used in hemophilia A because due to deficiency of hemophilia factor 8, hemophilia is occurs. So, recombinant clotting factor 8 is used in a hemophilia A treatment. DNA vaccines mainly stimulate cell mediated immunity. DNA vaccines mainly stimulate cell mediated immunity. Immunological memory is formed by memory cells. Immunological memory is formed by memory cells. Sera should be tested for sterility and safety. Sera should be tested for sterility and safety. Recombinant products reduce risk of viral contamination. Recombinant products reduce risk of viral contamination. Storage temperature for most vaccine is 2 to 8 degrees Celsius. It's a cold temperature. Storage temperature for most vaccine is a 2 to 8 degrees Celsius. Lyophilization of vaccine improves stability. Lyophilization of a vaccine improves stability. Antisera provide protection by providing ready-made antibodies. Antisera provide protection by providing ready-made antibodies. Recombinant DNA technology is widely used in the production of antibiotics, hormones, and vaccines. So all products are formed due to with the help of rDNA technology. Quality control of vaccine includes sterility test, potency test, and safety test. Herd immunity refers to protection of non-immunized individuals. Herd immunity refers to protection of non-immunized individuals. Recombinant vaccines reduce need for animal sources. Recombinant vaccines reduce need for animal sources, but recombinant vaccines need cold chain, adjuvants, and storage condition. Sera are contraindicated in patients with history of allergy. Sera are contraindicated in a patients with history of allergy.
Recombinant products are produced under GMP conditions, means good manufacturing practices conditions. Vaccine schedule is important to ensure proper immune response. Recombinant technology allows production of proteins that are identical to human proteins. Immunological sera are an example of a passive immunization. Immunological sera are examples of a passive immunization. Recombinant vaccines are preferred because they are safer. Genetic engineering reduces ethical issues related to use of animals and humans. Antibody-based therapies are example of immunotherapy. Antibody-based therapies are examples of immunotherapy. Recombinant monoclonal antibodies are produced using cell culture. Recombinant monoclonal antibodies are produced using cell culture. Vaccines are regulated as biological products. Vaccines are regulated as a biological products. DNA recombination increases genetic diversity. DNA recombination increases genetic diversity. Recombinant vaccines do not contain live pathogen. Recombinant vaccines do not contain live pathogen. Immune response after vaccination includes antibody production, memory cell formation, and T cell activation, means all of the above. Immune response after vaccination includes antibody production, memory cell formation, and T cell activation. Sera are usually administered by parental route. Sera are usually administered by parental route with the help of an injection. Recombinant technology has replaced animal derived insulin because less immunogenic. Recombinant technology has replaced animal derived insulin because less immunogenic. Vaccine potency depends on dose, storage, and administration schedule. All of the above. Vaccine potency depends on all of the above. Recombinant DNA technology requires sterile conditions to avoid contamination. Recombinant DNA technology requires sterile conditions to avoid contamination. Second last question. Immunological products are must be tested for pyrogens because they are injectables. Immunological products must be tested for pyrogens because they are injectables. Overall aim of recombinant technology in pharmacy is to produce safe and effective biological products. So these are the 100 questions on biological products or immunological products. Immunological products must be tested for pyrogens because they are injectables. So guys, our next topic is isomerism, tautomerism, fermentation, synthesis of antibiotics, diazo reaction, and chemistry of steroids. Let's start. Question and their answer only, like one liner question. Isomers are compounds having the same molecular formula. Isomers are compounds having the same molecular formula. Structural isomerism differs in structural arrangement. Structural isomerism differs in structural arrangement. Chain isomerism occurs due to difference in carbon chain arrangement. Position isomerism occurs due to difference in functional group position. Functional isomers differ in functional group. Metamerism is shown by compounds containing ether or amine group. Metamerism is shown by compounds containing ether or amine group. Stereoisomers differ in spatial arrangement. Stereoisomers differ in spatial arrangement. Optical isomerism is due to presence of asymmetric carbon. Optical isomerism is due to presence of a asymmetric carbon. Enantiomers rotate plane polarized light in opposite directions. Enantiomers. Enantiomers rotate plane polarized light in opposite directions. Racemic mixture shows optical rotation of 0. Racemic mixture shows optical rotation of a 0. Uh, geomet- uh, Geometrical isomerism occurs due to restricted rotation around double bond. Geometrical isomerism occurs due to restricted rotation around double bond. Cis trans isomerism is an example of a geometrical isomerism. Okay, it's move around double bond. Cis trans isomerism is an example of a geometrical isomerism. Tautomerism is a type of dynamic equilibrium. Tautomerism is a type of a dynamic equilibrium. Keto-enol tautomerism involves migration of a hydrogen atom. Keto-enol tautomerism involves migration of hydrogen atom. Tautomerism differs from isomerism because it involves interconversion of a hydrogen bond. Keto form is generally more stable than enol form due to lower energy. Keto form is generally more stable than enol form due to lower energy. Phenol shows enol form due to aromaticity. Phenol shows enol form due to aromaticity. Fermentation is defined as anaerobic biological processes. Fermentation is defined as anaerobic biological process. Fermentation is carried out by microorganisms. Alcohol fermentation converts glucose to ethanol and carbon dioxide. Alcohol fermentation converts glucose to ethanol and carbon dioxide. Microorganism used for alcoholic fermentation is Cerevisiae. Microorganism used for alcoholic fermentation is Saccharomyces cerevisiae. Antibiotics are produced industrially by fermentation. Penicillin is produced by fermentation using Penicillium chrysogenum. Streptomycin is by Streptomyces griseus. Fermentation medium contains carbon source, nitrogen source, and minerals. All of the above. So fermentation medium contains all of the above like carbon, nitrogen source, and minerals. Submerged fermentation uses liquid medium. Submerged fermentation uses liquid medium. Surface fermentation is carried out on solid surface. Surface fermentation is carried out on a solid surface. Antibiotic synthesis involves microbial metabolism. Antibiotic synthesis involves microbial metabolism. Semi-synthetic antibiotics are prepared by chemical modification of a natural antibiotics. Semi-synthetic antibiotics are prepared by chemical modification of a natural antibiotics. Example of semi-synthetic penicillin is ampicillin. Example of semi-synthetic penicillin is a ampicillin. Diazo reaction is characteristic of aromatic primary amines. Diazotization reaction involves formation of a diazonium salt. Diazotization is carried out at a temperature 0 to 5 degrees Celsius. Diazotization is carried out at temperature 0 to 5 degrees Celsius. Reagent used in a diazotization is sodium nitrite and HCl. Reagent used in diazotization is sodium nitrite and HCl. Diazonium salts are unstable above 25 degrees Celsius. Mainly, what is the normal temperature of diazonium? 0 to 5. If temperature go beyond 25 degrees Celsius, then it's unstable. Coupling reaction of a diazonium salt produce azodize. Diazo reaction is used for detection of aromatic amines. Steroids are compounds containing cyclopentano per hydrophenanthrin nucleus means CPPH. CPP cyclopentano per hydrophenanthrin nucleus. Steroids contain. Steroid nucleus consists of 4 fuse rings. Steroid nucleus consists of 4 fuse rings. Cholesterol is an example of a steroid. Cholesterol contains how many carbon atoms? Cholesterol contains 27 carbon atoms. Steroid hormones include estrogen. Steroid hormones include estrogen. Corticosteroids are synthesized in adrenal cortex. Cortex corticoids. Anabolic steroids are used to increase protein synthesis. Anabolic steroids are used to increase protein synthesis. Bile acids are derived from cholesterol. Bile acids are derived from cholesterol. Steroids are insoluble in water. Estrogen is a female sex hormone. Testosterone is classified as androgen. Progesterone is involved in maintenance of pregnancy. Progesterone is involved in maintenance of pregnancy. Cardiac glycosides differ from steroids because they contain sugar moiety. Okay, cardiac glycosides differ from steroid because they contain sugar moiety. Isomerism does not include polymerism, but isomerism contains structural isomerism, stereoisomerism, and geometric isomerism, but not polymerism. Optical activity is measured using polarimeter. Optical activity is measured using polarimeter. D and L notation is based on configuration. D, D and L notation is based on configuration. Epimers differed at one chiral carbon. Mutarotation occurs due to anomeric carbon. Mutarotation occurs due to anomeric carbon. Glucose shows mutarotation because of anomer formation. Glucose shows mutarotation because of anomer formation. Fermentation temperature is controlled to maintain microbial activity. Fermentation temperature is controlled to maintain microbial activity. Antibiotic yield is increased by mutation, strain selection, and medium optimization. Antibiotic yield is increased by mutation, strain selection, and medium optimization. Downstream processing includes extraction and purification. Downstream processing includes extraction and purification. Penicillin core structure is a beta-lactam ring. Cephalosporin also contained beta-lactam ring. Diazo dyes are mainly used in a textile industry. Diazo dyes are commonly mainly used in a textile industry. Stability of diazonium salt increases with cold temperature, mainly 0 to 5 degrees Celsius temperature required. Steroids show poor oral bioavailability due to first pass metabolism. Poor. Steroid shows poor oral bioavailability due to first pass metabolism. That's why it should be taking from IV routes. Cortisol is a glucocorticoid. Cortisol is a glucocorticoid. Aldosterone regulates electrolyte balance. Aldosterone regulates electrolyte balance. Steroid synthesis in lab is a complex because of multiple chiral centers. Steroid synthesis in lab is a complex because of a multiple chiral centers. Isomers having same functional group but different position are position isomers. Tautomerism occurs mainly in compounds containing carbonyl group. Tautomerism occurs mainly in compounds having carbonyl group. Enol form is stabilized by hydrogen bonding, aromaticity, and conjugation, all of the above. Enol form is stabilized by all like hydrogen bonding, aromaticity, and conjugation. Fermentation is preferred over chemical synthesis because it is eco-friendly. Antibiotic fermentation is usually aerobic except for erythromycin. Okay, it's a anaerobic for erythromycin, but penicillin, streptomycin, and tetracycline are aerobic fermentation. Erythromycin is produced by Streptomyces erythraeus. Diazonium salt react with phenols to form azo compounds. Steroids are classified under lipids. Steroids are classified under lipids. Cholesterol is a precursor of steroid hormones. Cholesterol is precursor of a steroid hormones. Vitamin D is synthesized from cholesterol. Vitamin D is synthesized from cholesterol. Isomerism increases complexity of drug action, drug synthesis, and drug stability. Isomerism increases complexity of drug action, drug synthesis, and drug stability. Optical purity is important because enantiomers may differ in biological activity. Optical purity is important because enantiomers may differ in a biological activity. Thalidomide tragedy was due to optical isomerism. Thalidomide tragedy was due to optical isomerism. Fermentation require sterilization to avoid contamination. Fermentation requires sterilization to avoid contamination. Antibiotic production phase is mainly stationary phase. Antibiotic production phase is a mainly stationary phase. Diazo reaction is an example of substitution. Diazo reaction is an example of a substitution. Steroid hormone acts by binding to nuclear receptors. Steroid hormones act by binding to nuclear receptors. Anabolic steroids misuse leads to liver toxicity, hormonal imbalance, behavioral changes, all of the above. Anabolic steroids misuse leads to all. Isomerism is important in pharmaceutical because it affects potency, safety, and pharmacokinetics. Keto-enol equilibrium shift towards keto form in aqueous solution. Keto-enol equilibrium shifts towards keto form in aqueous solution. Industrial fermentation is carried out in fermenter. Industrial fermentation is carried out in fermenter. Antibiotic synthesis requires strict control of pH, temperature, and aeration. Diazonium compounds are generally highly reactive. Diazonium compounds are generally highly reactive. Steroid chemistry is challenging due to multiple rings and stereochemistry. Steroid chemistry is challenging due to multiple rings and stereochemistry. Isomer separation technique includes chromatography, crystallization, resolution, all of the above. So, chromatography, crystallization, and resolution all are the isomer separation techniques. Fermentation is a part of industrial pharmacy, not a physical, organic, analytical. It's a part of an industrial pharmacy. Antibiotic produced by fermentation are natural or semi-synthetic. Antibiotics produced from by fermentation are natural or semi-synthetic. Diazo produces compounds with color. Okay. Steroids show anti-inflammatory action by inhibiting prostaglandin synthesis. So, prostaglandin responsible for inflammation. So, steroids inhibit prostaglandin. Isomerism is a concept mainly studied under organic chemistry. Tautomerism is reversible because it involves weak hydrogen migration. Tautomerism is reversible because it involves weak hydrogen migration. Fermentation products are purified by downstream processing, not filtration, distillation, sterilization. Fermentation products are purified by downstream processing. Overall importance of chemistry in pharmacy is to design and manufacture drugs safely. Overall importance of a chemistry in pharmacy is to design and manufacture drugs safely. So guys, now we are seeing pre-formulation studies and pharmaceutical additives. Okay, these are the new topics. Let's start. 100 questions for pre-formulation and pharmaceutical additives. Pre-formulation studies are carried out to study drug excipient interaction. Pre-formulation studies are done before formulation development. Physical properties studied in pre-formulation include solubility, particle size, and polymorphism. Means all properties studied in a pre-formulation. Chemical stability studies include effect of pH, temperature, and light. These are the chemical stability studies. Solubility of a drug affects bioavailability, stability, and formulation type. All solubility of a drug affects all. pKa value of a drug helps in determining ionization. pKa value of a drug helps in determining ionization. Weakly basic drugs are more soluble at weakly basic drugs are low soluble at low pH. Polymorphism refers to multiple crystal forms. Polymorphism refers to multiple crystal form. Different polymorphs of a drug may differ in solubility, melting point, and stability. Amorphous form of a drug is generally more soluble. Amorphous form of a drug is generally more soluble. Hygroscopic substances absorb moisture. Flow properties of powder are evaluated by angle of repose, Carr's index, and Hausner ratio. These three methods are useful for flow properties of a powder: angle of repose, Carr's index, and Hausner ratio. Poor flow property leads to problem in mixing, compression, and capsule filling. All of the above. Poor flow property leads to problem in mixing, compression, and capsule filling. Compressibility index is also known as Compressibility index is also known as a Carr's index. Compressibility CC. Compressibility Carr. Bulk density is defined as weight upon bulk volume. Bulk density is defined as weight upon bulk volume. Okay, these are the bulk density. Chemical degradation by water is called hydrolysis. Oxidative degradation is accelerated by light, heat, and oxygen. Oxidative degradation is accelerated by light, heat, and oxygen. Antioxidants are added to prevent oxidation. Antioxidants are added to prevent oxidation. Example of antioxidant is sodium metabisulfite. Example of antioxidant is sodium metabisulfite. Chelating agents improve stability by binding metal ions like chelate. These are the chelate forming agents. Binding metal ions. Example of chelating agent is EDTA. Okay, these are the hexadentate chelating agents. Preservatives are added to prevent microbial growth. Preservatives are added to prevent microbial growth. Preservatives are required mainly in liquid dosage forms, not in solid, gases, or powders, but mainly in liquid dosage forms. Preservatives are required. Commonly used preservative in oral liquid is methyl paraben or propyl paraben. Commonly used preservative in oral liquids is a methyl paraben. Benzyl alcohol is commonly used as benzyl alcohol is commonly used as preservative. Benzyl alcohol is commonly used as a preservative. Preservative effectiveness depends on pH, concentration, and a dosage form. Preservative effectiveness depends on pH, concentration, and dosage form. Ideal preservative should be stable and effective. Suspending agents are used to prevent sedimentation. Okay, suspending agents are used to prevent sedimentation. Example of suspending agent is acacia. Okay, example of suspending agent is acacia. Suspending agent increases viscosity. Suspending agent increases viscosity. Ideal suspension should show easy redispersibility. Ideal suspension should show easy redispersibility. Emulsifying agents are used to stabilize emulsions. Emulsifying agents are used to stabilize emulsions. Emulsifying agent works by reducing interfacial tension. Emulsifying agents work by reducing interfacial tension. Example of emulsifying agent is twin 80. Okay. Example of emulsifying agent is twin 80. Hydrophilic emulsifying agents favor formation of O by W. Okay. Hydrophilic means O by W, water loving. Lipophilic W by O. Lipophilic emulsifiers favor formation of a W by O emulsions. HLB value is used to select emulsifying agents. HLB value is used to select emulsifying agents. Higher HLB value favors O by W emulsions. Okay. Hydrophilic lipophilic balance like Higher HLB means it's a O by W emulsions. Additives are included to improve appearance, improve stability, and improve acceptability. All of the above. Sweetening agents are added to improve taste. Artificial sweetener example is aspartame. Artificial sweetener, aspartame. Flavoring agents are added to mask unpleasant taste. Okay. Coloring agents are added mainly for identification purposes. Coloring agents are added mainly for identification. Vehicles are defined as inert carriers. Vehicles are defined as inert carriers. Vehicle should be pharmacologically inert. Common vehicle for oral liquid is purified water. Common vehicle for oral liquid is purified water. Oily vehicles are mainly used in injectables like injections. Oily vehicles are mainly used in injections. Vehicles affect drug stability, absorption, and bioavailability. All of the above. Vehicles affect stability, absorption, and bioavailability. Water used in a pharmaceutical preparation must be sterile. Okay. Purified water is used for means water used in a pharmaceutical preparations must be pure. Purified water is used for oral preparations. Purified water is used for oral preparations. Water for injection is free from both microorganisms and pyrogens. Water for injection is free from both microorganisms and pyrogens. Water for injection is prepared by distillation. Water for injection is prepared by distillation. Sterile water for injection is used for parenteral preparations. Sterile water for injection is used for parenteral preparations. Water for injection must be stored in sterile conditions. Water for injection must be stored in sterile conditions. Preservatives are generally not added to parenteral preparations like large volume. Preservatives are generally not added to parenteral preparations but mainly in large volume but are added to oral liquids, topical preparations and suspensions. Compatibility studies are done to check drug excipient interaction. pH modifiers are used to improve taste, improve stability, and control ionization. pH modifiers are used to improve taste, stability, and ionization. Buffer system helps to maintain pH. Example of buffer used in a pharmaceutical is phosphate buffer. Viscosity modifiers are added to improve flow, improve stability, and control sedimentation, all of the above. Preservative concentration should be minimum effective. Preservative concentration should be minimum effective. Preservative efficacy testing ensures microbial safety. Preservative efficacy testing ensures microbial safety. Suspending agents reduce sedimentation by increasing viscosity. Emulsion instability may result in creaming, cracking, and phase separation. Emulsion instability may result in all like creaming, cracking, and phase separation. Pharmaceutical water must comply with IP standards. Indian protocol, international protocol, okay, Indian protocol, IP, international pharmacopoeia. IP means Indian pharmacopoeia. Distilled water differs from purified water by method of preparation. Vehicles used in a parenteral must be pyrogen free. Preservatives may interact with drug, container, or excipients. Pre-formulation studies reduce time of development, cost, and formulation failure. Particle size reduction improves dissolution rate, bioavailability, uniformity, or all of the above. Preservatives are ineffective against spores. Preservatives are ineffective against spores. Ideal emulsifying agent should be stable and effective. Ideal emulsifying agent should be stable and effective. Non-ionic surfactants are preferred because they are less affected by pH. Vehicles influence drug release by affecting solubility, diffusion, and partitioning. All of the above. Additives should be pharmacologically inert. Okay, means not active, it's a inert. Means there is no their action, they just produce some comforts. Okay, additives. Sweeteners should be avoided in diabetic patients. Coloring agents should be approved and safe. Water used for ophthalmic preparations must be sterile and pyrogen free. Preservative incompatibility leads to loss of efficacy. Emulsions require preservatives because they contain water phase. Pre-formulation studies help in selecting dosage form, excipients, and packaging. Pre-formulation study helps in selecting dosage form, excipients, and packaging. Preservatives are not required in single dose sterile injections. Preservatives are not required in single dose sterile injections. Vehicles should not affect drug activity. Vehicles should not affect drug activity. High viscosity in suspension results in slow sedimentation. Emulsifying agents must be selected based on HLB value, pH, and drug solubility. Okay, all of the above. Emulsifying agents must be selected based on HLB value, pH, and drug solubility. Pre-formulation is a bridge between discovery and formulations. Pharmaceutical additives must comply with pharmacopoeial standards. Outer hardness affects solubility, stability, cleaning process, all of the above. Outer hardness affects all of the above like solubility, stability, and cleaning process. Ideal vehicle should have no pharmacological activity. They only supportive works. Preservatives effectiveness decreases with increased pH, organic matter, or incompatible excipients. Preservatives effectiveness decreases with increased pH, organic matter, and incompatible excipients. Non-aqueous vehicles are used when drug is non-aqueous vehicle is used. Non-aqueous vehicles are used when drug is water unstable, so that's why use oily. Preservatives in injections are avoided because of toxicity risk. Preservatives in injections are avoided because of toxicity risk. Emulsions are thermodynamically unstable. Emulsions are thermodynamically unstable. Suspensions are preferred for drugs that are insoluble, so that's why make a suspensions. Vehicles for topical preparations include ointment bases, cream bases, or gel bases. Vehicles for topical preparations include ointment base, cream base, or gel base. Preservatives must be compatible with drug packaging excipients. Preservatives must be compatible with drug packaging and excipients. Pre-formulation studies improve product quality, safety, and efficacy. All of the above. Pre-formulation studies improve product quality, safety, and efficacy. Pharmaceutical water quality is monitored to ensure safety, stability. Okay. Appearance. Pharmaceutical water quality is monitored to ensure appearance, safety, stability, and quality. Vehicles affect patient compliance by influencing taste, appearance, or ease of administration. Vehicles affect patient compliance by influencing taste, appearance, or ease of administration. Overall goal of pre-formulation study is to Overall goal of pre-formulation study is to develop safe and effective dosage form. Okay. Overall goal of a pre-formulation study is to develop safe and effective dosage form. Vehicles affect patient compliance by influencing taste, appearance, ease of administration. Uh, Pre-formulation study improve product quality, safety and efficacy. Preservatives must be compatible with drug packaging excipients. Vehicles for topical preparations include ointment base, cream base, gel base. Suspensions are preferred for drugs that are insoluble. Emulsions are thermodynamically unstable. Preservatives in injections are avoided because of a toxicity risk. So that's why preservatives are not added in injections. Uh, Preservatives effectiveness decreases with increased pH, organic matter, incompatible excipients. Ideal vehicle should have no pharmacological activity. Water hardness affects solubility, stability, and cleaning process. So guys, now we are studying means seeing MCQs about tablets, capsules, liquid orals, parenterals, ophthalmics, semi-solids or aerosols. Mainly actually 70% pharmaceutics. Okay, pharmaceutical technology. Let's start only question and answer because of a time. Dosage form is defined as finished pharmaceutical product. Tablet is a solid dosage form prepared by compression. Most common method of a tablet manufacture is wet granulation. Binder is added to tablets to improve cohesion. Disintegrants help tablets to break into granules. Super disintegrant example is cross carbamate sodium. Okay, CMS like cross carbamate sodium. Super disintegrant example is cross carbamate sodium. Lubricants are added to tablets to increase lubricants are added to tablet is reduce friction. Okay, lubricants. Common lubricant used in a tablet is magnesium stearate. Common lubricant used in tablet is magnesium stearate. Tablet coating is done to increase weight, mask taste or protect drug. All of the above. Enteric coated tablets dissolve in intestine. Sugar coating disadvantage include increased size and advantages like masking taste, protection or identification. Film coating is preferred because it is fast and economical. Capsule are solid dosage forms in which drug is enclosed in a gelatin shell. Hard gelatin capsule are suitable for powder and granules and for soft gelatin liquid oils. Soft gelatin capsule contain liquid or semi-solids. Plasticizer used in a soft gelatin capsule is glycerin. Plasticizer glycerin soft gelatin capsule. Capsules are not suitable for drugs that are hygroscopic. Capsules are not suitable for drugs that are hygroscopic. Liquid oral dosage form includes syrups. Syrup is a concentrated aqueous solution of sugar. Elixir is alcoholic sweet solution. Elixir is a alcoholic sweet solution. Suspension is a homogeneous system. Okay, sorry. Heterogeneous system is two phase combined in suspension. Emulsion is a type of liquid in a liquid. In emulsion, one is a oil phase or another is a liquid phase. O by W emulsion example is oil in water, it's a milk. W by O emulsion example is cold cream, W by O, and vanishing cream is a O by W, and for cold cream, W by O. Parenteral preparations are administered by parenteral route. Parenteral preparations are administered by parenteral route. Parenterals must be sterile and pyrogen free. Large volume parenterals are greater than 100 ml. Okay, for saline bottles, IV injections like small volume parenterals are usually bolus injections. IV injection is administered into vein. IV injection is administered into vein. Intramuscular injection is given into muscle detrusal muscle and gluteus muscles. Okay, muscles. Subcutaneous injection is given into subcutaneous tissue. Advantages of parenteral includes rapid action, accurate dose, and useful in unconscious patients. So all of the above. Advantages of parenterals include rapid action, accurate dose, and useful in unconscious patients. Ophthalmic preparations are meant for eyes of the eye. Ophthalmic preparations must be sterile and isotonic. Ophthalmic ointments are prepared because they prolong contact time. Ophthalmic ointments are prepared because they prolong contact time. Isotonicity of ophthalmic solutions is adjusted using sodium chloride. Isotonicity of ophthalmic solutions is adjusted using sodium chloride. Semi-solid dosage form includes ointments. Semi-solid dosage form includes ointments. Tablet is a solid, capsule is solid, and syrup is a liquid. But ointment is a semi-solid. Ointments are meant for external application on a skin surface. Creams are semi-solid emulsions. Creams are semi-solid emulsions. Gels are colloidal systems. Gels are colloidal systems. Aerosols are dosage forms containing drug with propellant. Okay, aerosols are dosage form containing drug with propellant. Metered dose inhalers are used for asthma. Meter dose inhalers are used for asthma. Suppositories are administered by rectal route. Okay, suppositories are administered by rectal route. Base commonly used in a suppository is cocoa butter. Base commonly used in suppository is a cocoa butter. Advantages of suppositories include avoid first pass metabolism, suitable for vomiting patients, and local actions. So all of the above. So advantages include all. Transdermal patches deliver drug through skin. Dermis is a skin layer. Transdermal patches deliver drug through skin. Advantages of transdermal delivery include controlled release, avoid first pass metabolism, improve compliance. Advantages of a transdermal delivery include all. Lozenges are meant to dissolve in mouth. Lozenges are meant to dissolve in a mouth. Chewable tablets are designed to be chewed before swallowing. C. Option C is correct. Chewable tablets are designed to be chewed before swallowing. Effervescent tablet contains acid and alkali. Effervescent tablets contain acid and alkali. Modified release dosage form release drug in a controlled manner. Modified release means little by little. Modified release dosage form release drug in a controlled manner. Sustained release dosage forms maintain drug level for long duration. Sustained release means longer duration. Delayed release dosage form release drug after a time lag. Delayed delayed release dosage forms release drug after a time lag. Liquid dosage forms are preferred for liquid dosage forms are preferred for pediatric patients, geriatric patients, or dysphagic patients. So all of the above. So liquid dosage form is prepared for all categories of patients like pediatric, geriatric, or dysphagic. Stability of liquid dosage forms is generally lower than solids. Stability of liquid dosage form is generally lower than solids. Preservatives are required in liquid dosage forms, not in solid, not in gases, okay, not in powders, but mainly preservatives used in a liquid. Multi-dose parenterals contain preservatives. Okay, multi-dose parenterals contain preservatives. Container contains no preservatives, sweeteners, or coloring agents. Multi-dose, okay, contain preservatives. Reconstitution is required for dry syrups. Multidose because of storing long duration. Parentals. Reconstitution, but in some exam they are not preservatives adding, okay, in multidose. Reconstitution is required for dry syrups. Dry syrups are preferred to improve stability. Dry syrups are preferred to improve stability. Ophthalmic solutions should be free from particulate matter. Ophthalmic solutions should be free from particulate matter. Nasal dosage forms are intended for local or systemic action. Nasal dosage forms are intended for local or systemic action. Ear preparations are called otics. Ear, ophtha means eye, and otics means ear. Nasal means nose, topicals for topical skin. Topical dosage form acts mainly by local action. Okay. Topical dosage forms act mainly by local action. Mouth dissolving tablets disintegrate in mouth. Okay, naam in their naam, a name, mouth dissolving, so obviously dissolve in a mouth. Advantage of mouth dissolving tablet is easy administration. Advantage of mouth dissolving tablets is easy administration. Powders for injection must be sterile. Powders for injection must be sterile, means free from microorganism. Lyophilization is used to improve stability of a parenterals. Lyophilization is used to improve stability of a parenterals. Reconstituted injection should be used immediately or within specified time. Reconstituted injections should be used immediately or within specified time. Inhalation dosage forms deliver drug to lungs. Inhalation dosage forms deliver drug to lungs. Nebulizers convert liquid into aerosol mist. Nebulizer converts liquid into aerosol mist. Advantages of inhalation route include rapid onset, local effect, or a reduced dose. All of the above. Advantages of inhalation route include rapid onset, local effect, and reduced dose. Rectal route avoids first pass metabolism. Rectal route avoids first pass metabolism. Vaginal dosage form includes tablets, suppositories, and pessaries. All of the above. Vaginal dosage forms include tablets, suppositories, or pessaries. Dosage forms improve drug stability, drug delivery, or patient compliance. Means all of the above factors, dosage form improves. Ideal dosage form should be safe, effective, and convenient. Ideal dosage form should be safe, effective, and convenient. Controlled release dosage form reduce dose frequency. Controlled release dosage form reduce dose frequency. Pediatric dosage form should be sweet and palatable. Pediatric dosage form should be sweet and palatable. Geriatric dosage forms should consider swallowing difficulty. Geriatric means old patient. So, taste and dose accuracy, all of the above. Correct answer, all of the above. Geriatric dosage forms should consider swallowing difficulty, taste and dose accuracy. Tablets unsuitable for coating include chewable tablets. Unsuitable, okay, because they we are chewing. Floating tablets remain in stomach. Floating tablets remain in a stomach. Oral route is not suitable for acid level drugs, unconscious patients, or vomiting patients. All of the above. So correct answer, all of the above. Oral route is not suitable for acid level drugs, unconscious patients, or vomiting patients. Bioavailability is affected by dosage form, route of administration, and drug properties. All of the factors affect bioavailability of a drug. Pharmaceutical suspensions require shaking before use because of a sedimentation. Emulsions are thermodynamically unstable. Because of temperature, they are unstable. Oral liquids should be labeled as shake well before use if required. Okay. Oral liquids should be labeled as a shake well before use. Stability testing of a dosage form ensures safety, efficacy, and quality. All of the above. Correct answer, all of the above. Stability testing of a dosage forms ensures safety, efficacy, and quality. Container closure system affects stability, protection, and convenience. All of the above. Correct answer. Container closure system affects stability, protection, and convenience. Blister packs are commonly used for tablets and capsules. Ampoules are used to pack liquid injections. Ampoules are used to pack liquid injections. Vials may contain single dose, multiple doses, liquid or powder, all of the above. So, vials may contain all like single dose, multi dose, or a liquid or a powder. Ophthalmic suspensions require sterile. Ophthalmic suspensions require shaking, sterility, fineness of particles. Pharmaceutical dosage forms are designed mainly to improve drug delivery. Pharmaceutical dosage forms are designed mainly to improve drug delivery. Transdermal patches provide drug by diffusion. Okay. Transdermal patches provide drug by diffusion means moving from higher concentration to lower concentration. Ointment bases may be hydrocarbon, absorption basis, or water soluble. Any of the, okay, all of the above. Ointment basis may be hydrocarbon, absorption, or water soluble. Creams are preferred over ointments because they are easily washable. Creams are preferred over ointments because they are easily washable. Gels provide drug release by diffusion. Same like patches, gels provide diffusion release by diffusion. Pharmaceutical dosage forms must comply with pharmacopoeial standards like IP standards. Route of administration influences onset of action, duration of action, drug effect, all of the above. So, all of the above. Selection of dosage form depends on drug properties, patient factors, therapeutic purpose, all of the above. Selection of dosage form depends on drug properties, patient factors, or a therapeutic purpose. Overall purpose of dosage form is to deliver drugs safely and effectively. So moving to the next point, chapter. Next topic is a novel drug delivery systems, also called NTDS. ओके, सो इसमें कौन कौन से टॉपिक्स है, क्वेश्चंस है, वो हम देखेंगे. क्वेश्चंस और ओनली आंसर्स फॉर क्विक रिकैप. ओके, so novel drug delivery system is designed to improve drug targeting and control release. Sustained release dosage forms are designed to release drug for a prolonged period. Sustained release. Controlled drug delivery system differs from sustained release by predictable and controlled release rate. Main advantage of sustained release system is reduced dosing frequency. Controlled release system aim to maintain therapeutic drug concentration. Controlled release system aim to maintain therapeutic drug concentration. A zero order drug release means constant drug release with a time. Zero order means constant release. Matrix tablets release drug mainly by both diffusion and erosion. Okay. Matrix tablets release drug mainly by diffusion and erosion. Reservoir system control drug release by coating membrane. Reservoir systems control drug release by coating membrane. Microencapsulation involves coating of drug particles with polymer. Microencapsulation involves coating of drug particles with polymer. Purpose of microencapsulation is to mask test, protect drug, or control release. All of the above. Common polymer used in a microencapsulation is gelatin, ethyl cellulose, और polyvinyl alcohol. We also call it a PVA. Okay, ये सभी यूज होते हैं पॉलीमर फॉर माइक्रो इनकैप्सुलेशन में. gelatin, ethyl cellulose, or polyvinyl alcohol. Co-acervation is a method of microencapsulation. Co-acervation is a method of a microencapsulation. Spray drying is used for microencapsulation. Spray drying is used for a microencapsulation or a co-acervation. Mucosal drug delivery enhances drug absorption by direct entry into systemic circulation. Mucosal drug delivery enhances drug absorption by direct entry into systemic circulation. Buccal drug delivery avoids first pass metabolism and enzymatic degradation, both B and C. Like buccal drug delivery avoids first pass metabolism and enzymatic degradation. Sublingual route provides rapid onset. Mucoadhesive system adhere to mucosal surface. Mucoadhesive system adhere to mucosal surface. Example of mucoadhesive polymer is carbopol. Mucoadhesive polymer carbopol. Implantable drug delivery system are placed inside body tissue. Implantable, so inside body tissue. Advantage of implantable drug delivery system is continuous drug release. A disadvantage of implantable system includes surgical intervention. Surgical intervention means invasive. Transdermal drug delivery delivers TDD. Transdermal drug delivery delivers drug through skin. Advantage of transdermal system is controlled release. Transdermal patches consist of drug reservoir, adhesive layer, or a backing membrane. All of the above. Transdermal patches consist of all of the above. Ideal drug for transdermal delivery should be low dose and a lipophilic. Okay, for transdermal our skin is a lipophilic, so low dose and lipophilic drugs होना चाहिए. Gastroretentive drug delivery system remain in stomach. Floating drug delivery system work on the principle of low density. और इसकी वजह से वो क्या होता है, वो फ्लोट होती है हमारे स्टमक में. ओके, जीआई फ्लूइड के ऊपर. फ्लोटिंग ड्रग डिलीवरी सिस्टम वर्क ऑन अ प्रिंसिपल ऑफ लो डेंसिटी. Gastroretentive system are useful for drugs that act locally in stomach. Nasal drug delivery provides rapid absorption. Nasal drug delivery provides rapid absorption. Advantage of nasal drug delivery is नॉन इन्वेजिव रूट, मतलब कोई कट करने की ज़रूरत नहीं होती, हम उसको डायरेक्टली इनहेल करते हैं, सो नॉन इन्वेजिव. पल्मोनरी ड्रग डिलीवरी delivers drug to lungs. Pulmo means lungs. Pulmonary route provides large surface area for absorption. Pulmonary route provides large surface area for absorption. Metered dose inhalers are used in asthma. Metered dose inhalers are used in asthma. Targeted drug delivery aims to deliver drug to a specific site, means targeted part. Advantage of targeted drug delivery system is reduced dose, मतलब जहाँ पर चाहिए हम वहीं पर ही हमारा ड्रग देंगे. ओके, उसकी वजह से छोटे ड्रग्स में भी डोज में भी काम हो जाएगा. लिपोसोम्स आर लिपिड वेसिकल्स. ओके, लिपोसोम्स लिपिड, उसके नाम में क्या दिख रहा है, लिपिड. जोम्स कैप्सूल्स. ओके, वेसिकल्स. Liposomes are useful in targeted delivery because they encapsulate both हाइड्रोफिलिक एंड लिपोफिलिक ड्रग्स. ओके, मतलब लिपोसोम्स में हम लिपिड्स बोलते हैं. ओके, बट उसमें हम हाइड्रोफिलिक और लिपोफिलिक दोनों भी ड्रग्स को इनकैप्सुलेट करते हैं. नैनो पार्टिकल्स यूज इन ड्रग डिलीवरी सिस्टम हैव साइज रेंज. इन्होंने नैनो पार्टिकल की साइज पूछी है जो कि 1 से 1000 नैनोमीटर के बीच में होती है. नैनो पार्टिकल्स 1 to 1000 नैनोमीटर. Ocular drug delivery systems are intended for ocular मतलब eye and otic means ear. Major challenge in ocular drug delivery is rapid tear drainage. मतलब आंखों में जो पानी होता है उसकी वजह से क्या होता है, हमारा ड्रग रिलीज हो जाता है. ओके, जो कि एक चैलेंज होता है. इन सिटू जेल्स आर यूज इन ocular delivery टू इंक्रीज रेसिडेंस टाइम. रेसिडेंस टाइम मतलब उस ड्रग की विस्कोसिटी हम ज़्यादा बढ़ेंगे, उसकी वजह से क्या होगा, वो ज़्यादातर टाइम तक हमारे आँख में रहेगा. ओके, इन सिटू जेल्स. In situ gels are used in ocular delivery to increase residence time. Intrauterine drug delivery system is used mainly for infection, contraception, pain, cancer. Mainly for contraception. Okay, उसको prevent करते हैं drugs. IUD devices. Intrauterine drug delivery system. Example of intrauterine devices is a copper T. Example of intrauterine device is copper T. Advantage of intrauterine drug delivery system is local and long term action. पर्टिकुलर पार्ट पर एक्शन करता है और ज़्यादा टाइम के लिए रहता है. टारगेटेड ड्रग डिलीवरी रिड्यूसेस साइड इफेक्ट्स. पैसिव टारगेटिंग इज बेस्ड ऑन enhance permeability and retention effect. Passive targeting is based on enhance permeability and retention effect. Active targeting involves ligand binding to receptors. Active targeting involves ligand binding to receptors. Antibody drug conjugate are examples of targeted drug delivery. Antibody drug conjugates are examples of targeted drug delivery. Controlled release system improve therapy by reducing fluctuations in a plasma drug levels. Controlled release systems improve therapy by reducing fluctuations in plasma drug levels. Drug release from transdermal patch occurs mainly by diffusion. Okay. What is the mechanism for transdermal? Is a diffusion. Skin barrier to drug permeation is stratum corneum. स्किन पर कौन सा पार्ट होता है जो कि बैरियर की तरह काम करता है ड्रग परमिशन में, जो कि होती है हमारी स्ट्रैटम कॉर्नियम. पेनेट्रेशन इनहांसर्स इंक्रीज ड्रग परमेबिलिटी. पर पेनेट्रेशन परमेबिलिटी. गैस्ट्रो रिटेंटिव सिस्टम इंक्रीज गैस्ट्रिक रेसिडेंस टाइम. रिटेंशन करना किसका? गैस्ट्रिक सिस्टम्स का. सो गैस्ट्रिक रेसिडेंस टाइम. स्वेलेबल गैस्ट्रो रिटेंटिव सिस्टम वर्क्स बाय एक्सपांडिंग इन स्टमक. स्वेलेबल एक्सपांड हो जाता है. नेजल ड्रग डिलीवरी अवॉइड्स फर्स्ट पास मेटाबॉलिज्म. Pulmonary drug delivery is suitable for proteins and peptides. Pulmonary drug delivery is suitable for protein and peptides. Targeted drug delivery system is especially useful in cancer therapy. Targeted drug delivery system is especially useful in a cancer therapy. Liposomes improve drug delivery by reducing toxicity. Liposomes improve drug delivery by reducing toxicity. Ocular inserts are designed to provide sustained drug release. Ocular inserts are designed to provide sustained drug release. Intrauterine drug delivery system provides contraception by local hormone or copper release. Intrauterine drug delivery system provides contraception by local hormone or copper release. Major limitation of a nasal drug delivery system is rapid clearance. Major limitation of nasal drug delivery system is rapid clearance. Controlled release of formulations. Controlled release formulations are not suitable for drug with long half life. Okay, उसकी वजह से उनको कंट्रोल रिलीज में नहीं लेना चाहिए. Implantable drug delivery system is commonly used for chronic therapy. Implantable drug delivery system is commonly used for chronic therapy. Implant for chronic therapy long duration के लिए होता है. Transdermal system improve compliance by reduced dosing frequency. Gastroretentive drug delivery system is not suitable for drugs that are unstable in a gastric pH. Nasopulmonary route provides drug delivery via nose and lungs. Targeted drug delivery system increases therapeutic index by decreasing side effects. Targeted drug delivery system increases therapeutic index by decreasing side effects. Liposomes are biodegradable because they are made of lipids. Liposomes are biodegradable because of made up of lipids. Ocular drug delivery require adjustment of isotonicity, pH or sterility, all of the above. So correct answer all of the above. Ocular drug delivery requires adjustment of isotonicity, pH and sterility. Intrauterine system provides long-term contraception. Intrauterine systems provide long-term contraception. Controlled drug delivery improves patient compliance by decreasing frequency of administration. Microcapsules differ from microspheres because microcapsules have core shell structure. Okay. Microcapsules differ from microspheres because microcapsules have core shell structure. Microspheres release drug mainly by diffusion and erosion. Mucoadhesive drug delivery system prolong drug residence by adhesion to mucus. Mucoadhesive. Implantable drug delivery system reduce need for frequent dosing. Transdermal systems are unsuitable for drugs that are highly hydrophilic. अनसुटेबल इसलिए ड्रग को कैसे होना चाहिए, लिपोफिलिक होना चाहिए. फ्लोटिंग ड्रग डिलीवरी सिस्टम रिक्वायर्स प्रेजेंस ऑफ अ गैस जनरेटिंग एजेंट्स. इसकी वजह से वो क्या होगा, फ्लोट होगा. नेजल ड्रग डिलीवरी इज लिमिटेड बाय म्यूकोसिलरी क्लियरेंस. पल्मोनरी ड्रग डिलीवरी सिस्टम रिड्यूसेस डोज बिकॉज ऑफ हाई लंग एब्सॉर्प्शन. उसकी वजह से क्या होगा, ड्रग कम हो जाएगा. Targeted drug delivery system reduces systemic exposure and hence reduce toxicity. Targeted DDS reduces systemic exposure and hence reduce toxicity. Ocular inserts are an example of sustained release systems. Ocular inserts are examples of a sustained release systems. थोड़ा थोड़ा रिलीज होगा ड्रग्स. Intrauterine drug delivery system avoids systemic absorption. Intrauterine drug delivery system avoids systemic absorption. Controlled drug delivery is especially beneficial for chronic diseases. Controlled drug delivery is especially beneficial for chronic diseases. Microencapsulation improves stability by protecting drug from environment. Microencapsulation improves stability by protecting drug from environment. Mucoadhesive drug delivery system is commonly used in oral cavity, rectum or vagina. So all of the above answer. Mucoadhesive drug delivery system is commonly used in all. Implantable drug delivery system must be biocompatible. Implantable drug delivery system must be biocompatible. Transdermal patches are example of controlled release systems. Gastroretentive drug delivery increases bioavailability by increasing gastric residence time. A nasopulmonary drug delivery system is useful for peptides and proteins. Targeted drug delivery system uses carriers like liposomes, nanoparticles, or monoclonal antibodies. All of the above. Targeted drug delivery system uses carriers like all liposomes, nanoparticles, or monoclonal antibodies. Ocular drug delivery require frequent dosing due to tear turnover. Intrauterine drug delivery system reduces failure rate because of long-term local delivery. Sustained release formulations should not be crushed because it may destroy release control. Sustained release formulations should not be crushed because it may destroy release control. Microencapsulation is useful for taste masking, controlled release, or protection from environment. Microencapsulation is useful for taste masking, controlled release, or protection from environment. Mucoadhesive drug delivery system increases bioavailability by prolonged contact time. Implantable drug delivery system is removed when drug is finished or adverse effect occurs. Patient desires therapy completed. Transdermal drug delivery system avoids first pass metabolism. Transdermal drug delivery avoids first pass metabolism. Gastroretentive drug delivery system is useful for drugs with narrow absorption window. Gastroretentive drug delivery system is useful for drugs with a narrow absorption window. Targeted drug delivery improves therapy by delivering drug at a desired site. Targeted means desired sites. Overall goal of novel drug delivery system is to improve safety, efficacy and compliance. So guys, our next topic is storage conditions, medical devices और route of administration. सो मैं जो कोर्स कर रहा हूँ उसमें मेडिकल डिवाइसेस है, सो मैं उसके भी कुछ क्वेश्चन बताऊंगा जो कि सिलेबस में पूछे हैं। ओके, स्टोरेज कंडीशंस कैसी होनी चाहिए, रूट ऑफ एडमिनिस्ट्रेशन, उसके रिगार्डिंग क्वेश्चन होंगे। तो मैं सिर्फ क्वेश्चन और आंसर बताऊंगा बिकॉज हम क्विक रिकैप कर रहे हैं। ओके, so proper storage of pharmaceutical is required to maintain stability and potency. Storage conditions mainly affect drug stability. Raw materials should be stored according to pharmacopoeial requirements. Hygroscopic materials should be stored in airtight containers because वाटर से वो क्या होती है, डिग्रेड हो जाते हैं मॉइस्चर की वजह से। लाइट सेंसिटिव ड्रग्स शुड बी स्टोर्ड इन अ अम्बर कलर्ड कंटेनर्स, जो कि डार्क कलर की होती है। टेम्परेचर सेंसिटिव ड्रग्स आर स्टोर्ड इन रेफ्रिजरेटर बिकॉज रेफ्रिजरेटर में टेम्परेचर कम होता है। कोल्ड स्टोरेज टेम्परेचर इज़ यूजुअली 2 to 8 डिग्री सेल्सियस। जो हमारी वैक्सीन्स होती है वो हम कोल्ड स्टोरेज में स्टोर करके रखते हैं, कोल्ड 2 to 8 डिग्री। कंट्रोल रूम टेम्परेचर रेफर्स टू 20 to 25 डिग्री सेल्सियस, याद रखना 20 to 25। ह्यूमिडिटी कंट्रोल स्टोरेज इज रिक्वायर्ड फॉर हाइग्रोस्कोपिक ड्रग्स। ह्यूमिडिटी कंट्रोल स्टोरेज इज रिक्वायर्ड फॉर हाइग्रोस्कोपिक ड्रग्स। FIFO principle stands for first in first out, first in first out. Okay, FIFO principle stands for first expiry first out, first expiry first out. Raw material should be stored with proper labeling, identification और segregation. segregation मतलब सेगमेंट्स होते हैं, यहाँ पर ये प्रोडक्ट, वहाँ पर ये प्रोडक्ट। Quarantine area is used for untested materials. Quarantine for untested materials. Rejected materials should be stored separately and labeled. Rejected materials should be stored separately and labeled. Storage area should be protected from dust, पेस्ट और मॉइस्चर। इन तीनों से भी बचा के रखना होता है स्टोरेज एरिया को, डस्ट, पेस्ट और मॉइस्चर। फिनिश फार्मास्यूटिकल प्रोडक्ट्स मस्ट बी स्टोर्ड अकॉर्डिंग टू लेबल इंस्ट्रक्शंस। वैक्सीन्स मस्ट बी स्टोर्ड अंडर कोल्ड चेन, अभी हमने ऊपर देखा था उसका टेम्परेचर कितना होता है 2 से 8 डिग्री। ब्रेक इन कोल्ड चेन रिजल्ट्स इन लॉस ऑफ एफिकेसी। नार्कोटिक ड्रग्स रिक्वायर स्टोरेज अंडर लॉक एंड की। Narcotic drugs require storage under lock and key. Medical devices are defined as a products used for diagnosis or a treatment. Medical devices act by physical or mechanical action like glucometers, oximeters. Okay. Example of medical devices is syringe, tablet, capsule, syrup. ये क्या है, फार्मास्यूटिकल्स है, मेडिसिन होते हैं। ओके, बट सिरिंज क्या है, हमारा एपरेटस है जो कि एक डिवाइस है। मेडिकल डिवाइसेस आर रेगुलेटेड अंडर मेडिकल डिवाइस रूल्स। स्टराइल मेडिकल डिवाइसेस मस्ट बी स्टोर्ड टू मेंटेन स्टेरिलिटी। सिंगल यूज मेडिकल डिवाइसेस शुड बी डिस्कार्डेड आफ्टर यूज, उसका एक ही सिंगल यूज होना चाहिए। स्टोरेज ऑफ मेडिकल डिवाइसेस शुड प्रिवेंट डैमेज, कंटामिनेशन और मिक्सअप्स, all of the above. Storage of medical devices should prevent all of the above like damage, contamination or mix-ups. Route of administration refers to path taken by drug into body. उसको हम क्या बोलते हैं, रूट ऑफ एडमिनिस्ट्रेशन, कि हम ड्रग कहाँ से ले रहे हैं, IV ले रहे हैं, ओरली ले रहे हैं, टॉपिकली ले रहे हैं। ओरल रूट इज मोस्ट कॉमन बिकॉज इट इज कन्वीनियंट एंड सेफ। ओरल रूट इज नॉट सुटेबल फॉर एसिड लेबल ड्रग्स बिकॉज एसिड लेबल मतलब क्या हुआ, एसिड के प्रेजेंस में उनका डिग्रेडेशन हो जाता है, इसकी वजह से उसको ओरल रूट से नहीं लेते। पेरेंटल रूट बाईपास फर्स्ट पास मेटाबॉलिज्म। इंट्रावेनस रूट प्रोवाइड्स immediate action. Intramuscular injections are absorbed faster than oral. Intramuscular injections are absorbed faster than oral. Subcutaneous route is suitable for स्मॉल वॉल्यूम्स सबक्यूटेनियस, उसका एंगल कितना होता है गाइस? तो 45 डिग्री होता है। ओके, याद रखना। टॉपिकल रूट इज मेनली यूज फॉर लोकल इफेक्ट, टॉपिकल स्किन पर दिया जाता है लोकल इफेक्ट के लिए। ट्रांसडर्मल रूट डिलीवर ड्रग्स थ्रू स्किन। इनहेलेशन रूट इज मेनली यूज फॉर अस्थमा, जो कि पंप यूज करते हैं हम। रेक्टल रूट अवॉइड्स फर्स्ट पास मेटाबॉलिज्म पार्शली, रेक्टल रूट। vaginal route is mainly used for local action, route is mainly used for a local action. Ocular route delivers drug to ocular eye. Nasal route provides advantage of rapid absorption. Buccal route avoids first part metabolism. Sublingual route gives rapid onset. Implantable route is useful for a chronic therapy. Route of administration affects onset of action, बायोअवेलेबिलिटी और पेशेंट कंप्लायंस, ये तीनों भी फैक्टर को अफेक्ट्स करता है रूट ऑफ एडमिनिस्ट्रेशन। चॉइस ऑफ रूट डिपेंड्स ऑन ड्रग प्रॉपर्टीज, पेशेंट कंडीशन, थेरेपेटिक पर्पस, मतलब ड्रग कौन कैसा है, पेशेंट की कंडीशन कैसी है और हम किसके लिए ले रहे हैं, इसके अकॉर्डिंग चॉइस किया जाता है रूट ऑफ एडमिनिस्ट्रेशन को। ओरल लिक्विड डोसेज फॉर्म्स रिक्वायर स्टोरेज अवे फ्रॉम लाइट, हीट, माइक्रोवेल कंटेमिनेशन, इन तीनों चीज़ों से ओरल लिक्विड को दूर रखना होता है। पेरेंटल प्रोडक्ट शुड बी स्टोर्ड टू प्रिवेंट पायरोजन कंटेमिनेशन, माइक्रोवेल ग्रोथ और फिजिकल डैमेज, इन तीनों को प्रिवेंट करने के लिए हमें पेरेंटल प्रोडक्ट्स को स्टोर किया जाता है। पेरेंटल प्रोडक्ट शुड बी स्टोर्ड टू प्रिवेंट पायरोजन कंटेमिनेशन, माइक्रोवेल ग्रोथ और फिजिकल डैमेज। मेडिकल डिवाइसेस कंटेनिंग इलेक्ट्रॉनिक्स रिक्वायर स्टोरेज अवे फ्रॉम मॉइस्चर, डस्ट और हीट, इन तीनों से भी मेडिकल डिवाइस को दूर रखा जाता है। स्टोरेज इंस्ट्रक्शंस ऑन लेबल आर मैंडेटरी, जो कि मैंडेटरी होना चाहिए। स्टोरेज कंडीशंस कैसे होते हैं उनके लेबल पर। रेफ्रिजरेटेड स्टोरेज इज नॉट सुटेबल फॉर इमल्शन सेंसिटिव टू फ्रीजिंग, ऐसा सस्पेंशन है, इमल्शन है जो कि फ्रीजिंग से सेंसिटिव हो जाता है, तो उसको हमें रेफ्रिजरेटर में नहीं स्टोर करना चाहिए। रॉ मटेरियल्स शुड बी प्रोटेक्टेड फ्रॉम मिक्स अप बाय कलर कोडिंग, प्रॉपर लेबलिंग और सेपरेट स्टोरेज, ऑल ऑफ द अबव। Raw materials should be protected from mix-up by all of the above. Shelf life of a drug depends on storage condition, packaging, or stability. All of the above. Shelf life of a drug depends on all these factors like उसकी स्टोरेज कंडीशन कैसी है, उसकी पैकेजिंग कैसी की है और उसकी स्टेबिलिटी कैसी है। मेडिकल डिवाइसेस फॉर इम्प्लांटेशन मस्ट बी स्टराइल, must be biocompatible, must be non-toxic. Okay. Route with highest bioavailability is IV. इससे क्वेश्चन पूछा गया है कि 100% बायोअवेलेबिलिटी किसकी होती है और हाईएस्ट बायोअवेलेबिलिटी किसकी होती है, जो कि IV रूट की होती है उसका। ओके, ओरल रूट शोज वेरिएबिलिटी ड्यू टू फर्स्ट पास मेटाबॉलिज्म, गैस्ट्रिक एम्पटिंग और फूड इफेक्ट, इन तीनों चीज़ों से क्या होता है, वेरिएबिलिटी होती है ड्रग के डोज में। ओरल रूट स्टोरेज अंडर नाइट्रोजन एटमॉस्फेयर प्रिवेंट्स ऑक्सीडेशन, स्टोरेज अंडर नाइट्रोजन एटमॉस्फेयर प्रिवेंट्स ऑक्सीडेशन। मेडिकल डिवाइसेस पैकेजिंग मस्ट इंश्योर आइडेंटिफिकेशन, प्रोटेक्शन और स्टेरिलिटी इफ़ एप्लीकेबल, उसके पैकेजिंग पर लिखा गया होता है तो हमें पता चल जाता है कि उसका पैकेजिंग कैसी है। इंजेक्टेबल रूट रिक्वायर aseptic कंडीशंस बिकॉज इट बाईपास स्किन बैरियर, उसकी वजह से क्या होता है कि उसे असेप्टिक होना चाहिए। ओरल रूट इज अनसुटेबल इन अनकॉन्शियस पेशेंट, जो पेशेंट कोमा में है उसे पता ही नहीं कि वो क्या कर रहा है, सो उसको हम ओरल रूट नहीं दे सकते। टॉपिकल रूट मिनिमाइजेस सिस्टेमिक साइड इफेक्ट्स। स्टोरेज एरिया शुड हैव मॉनिटरिंग ऑफ अ टेम्परेचर, ह्यूमिडिटी, क्लीनलीनेस, इन तीनों भी फैक्टर का मॉनिटरिंग करनी चाहिए स्टोरेज एरिया में। एक्सपायर्ड फार्मास्यूटिकल शुड बी डिस्पोज प्रॉपरली। मेडिकल डिवाइसेस आर क्लासिफाइड बेस्ड ऑन अ रिस्क, यूसेज और इन्वेजिवनेस, इन तीनों भी फैक्टर के अकॉर्डिंग मेडिकल डिवाइस को क्लासिफाइड किया है। रूट ऑफ एडमिनिस्ट्रेशन फॉर इमरजेंसी ड्रग इज यूजुअली आईवी। इमरजेंसी कंडीशन में हमें आईवी ड्रग देना होता है बिकॉज ऑफ फास्ट काम करता है। नेजल रूट इज लिमिटेड बाय स्मॉल डोज कैपेसिटी, रैपिड क्लियरेंस और इरिटेशन। नेजल रूट इज लिमिटेड बाय स्मॉल डोज कैपेसिटी, रैपिड क्लियरेंस और इरिटेशन। Storage of flammable materials require ventilation, fire safety measures, or a separate area. Ophthalmic preparations should be stored to prevent light exposure, contamination, or a temperature fluctuation. All of the above. Ophthalmic preparations should be stored to prevent light exposure, contamination, or temperature fluctuation. Parenteral route is preferred when oral absorption is poor, correct. Rapid action is needed, emergency condition, patient is unconscious. इन तीनों भी conditions में हम parenteral route को देते हैं. Storage instructions: store in a cool place usually means cool place मतलब क्या 15 to 25 डिग्री सेल्सियस और कोल्ड टेम्परेचर कितना होता है हमारा 2 to 8 डिग्री सेल्सियस. Medical devices must be stored to avoid physical damage, functional failure, or contamination. All of the above. Medical devices must be stored to avoid physical damage, functional failure, or contamination. Route of administration affects drug absorption, distribution, onset of action. Route of administration affects drug absorption, distribution, onset of action. Oral route is safest because overdose can be reversed easily. Storage of antibiotics should prevent moisture exposure, light exposure, or heat exposure. Storage of antibiotics should prevent moisture exposure, light exposure, or heat exposure. Medical devices with expiry date should not be used after expiry date. जिस भी मेडिकल डिवाइस की एक्सपायरी डेट हो गई है उसके बाद उसे यूज़ नहीं करना चाहिए. Inhalation route provides rapid systemic and a local action. Inhalation route. Storage of insulin requires refrigeration. Storage of insulin requires refrigeration. Medical devices must comply with medical devices rules. Oral route is affected by food because of change in absorption. Storage of corrosive material requires plastic containers, प्रॉपर लेबलिंग और सेफ्टी प्रिकॉशंस मीन्स ऑल ऑफ द अबव. ये तीनों भी फुलफिलमेंट होनी चाहिए corrosive मटेरियल्स को स्टोर करने के लिए. रूट ऑफ एडमिनिस्ट्रेशन चूजन शुड मैक्सिमाइज थेरेपेटिक बेनिफिट. रूट ऑफ एडमिनिस्ट्रेशन चूजन शुड मैक्सिमाइज थेरेपेटिक बेनिफिट. मेडिकल डिवाइसेस फॉर क्रिटिकल यूज रिक्वायर strict quality control. Oral route has disadvantage: first pass metabolism. Storage of liquids should prevent evaporation, leakage, or contamination. Storage of liquids, all of the above, correct answer. Storage of liquids should prevent evaporation, leakage, or contamination. Oral route used for localized drug delivery, sorry, route used for localized lung delivery is inhalation. For like example, asthma. Medical devices should be traceable by बैच नंबर, सीरियल नंबर और मैन्युफैक्चरिंग डिटेल्स. इन तीनों भी चीज़ों में कोई भी होता है मिल जाता है आपको तो आपको मेडिकल डिवाइस को ट्रेस कर सकते हो. स्टोरेज कंडीशंस आर पार्ट ऑफ अ GMP लाइक गुड मैन्युफैक्चरिंग प्रैक्टिसेस. रूट ऑफ एडमिनिस्ट्रेशन शुड मिनिमाइज एडवर्स इफेक्ट्स. रूट ऑफ एडमिनिस्ट्रेशन शुड मिनिमाइज एडवर्स इफेक्ट्स. Oral route is not preferred when rapid action is required. Oral route is not preferred when rapid action is required. मतलब इमरजेंसी की कंडीशन में आप क्या करोगे, ओरल रूट को नहीं दोगे, आप दोगे पैरेंटल रूट को डायरेक्टली IV में. मेडिकल डिवाइसेस में रिक्वायर कैलिब्रेशन टू इंश्योर एक्यूरेसी. आपको मेडिकल डिवाइस बार बार कैलिब्रेशन करना चाहिए बिकॉज आपको रिजल्ट एक्यूरेट आना चाहिए. स्टोरेज एरिया एक्सेस शुड बी restricted. Storage area access should be restricted. Route of administration affects dosing frequency by influencing absorption rate, duration of action, or bioavailability. Route of administration affects dosing frequency by influencing absorption rate, duration of action, or bioavailability. Parenteral route requires trained personnel because it is invasive. Okay, इनवेजिव मतलब आपको इंजेक्शन देना होगा, सो उसके लिए क्या होगा, ट्रेंड पर्सनली चाहिए, स्किल वर्कर. स्टोरेज ऑफ रॉ मटेरियल्स शुड इंक्लूड रिकॉर्ड ऑफ रिसिप्ट, इशू, बैलेंस. मतलब जो स्टोर का बंदा होता है, वर्कर होता है, उसके पास क्या क्या डेटा होना चाहिए. रिसिप्ट होनी चाहिए कि कितना मटेरियल अंदर है, कितना गया है, किसने इशू किया था, उसकी डेट होनी चाहिए. अभी बैलेंस मतलब कितना बैलेंस है स्टोर में, एरिया, और एरिया मतलब मटेरियल्स, वो भी याद होना चाहिए उसको. ये सब क्या होना चाहिए, डॉक्यूमेंटेड होना चाहिए कि रिसिप्ट होनी चाहिए मटेरियल की, इशू कब किया, बैलेंस कब किया. मेडिकल डिवाइसेस फॉर होम यूज मस्ट बी यूजर फ्रेंडली. Nasal route is useful for drugs acting on a CNS. Nasal route is useful for drugs acting on a CNS. Storage of expired device should be clearly segregated. Oral route shows poor bioavailability for drugs with extensive first pass metabolism. Medical devices are inspected to ensure safety, performance और quality. इन तीनों all of the above correct answer. क्यों करना चाहिए मेडिकल डिवाइस का एक इंस्पेक्शन, बिकॉज ऑफ उसकी सेफ्टी चेक करने के लिए, वो उसका परफॉर्मेंस कैसा है वो चेक करने के लिए, और क्वालिटी चेक करने के लिए. मेडिकल डिवाइसेस आर इंस्पेक्टेड टू इंश्योर सेफ्टी, परफॉर्मेंस एंड क्वालिटी. स्टोरेज कंडीशंस मेंशन्ड इन फार्माकोपिया आर मैंडेटरी. Storage conditions mentioned in pharmacopoeia are mandatory. Overall purpose of proper storage and correct route selection is to improve safety and efficacy. Overall purpose of a proper storage and a correct route selection is to improve safety and efficacy. Move to the next topic. So, hi friends, in this video we see some important questions on industrial pharmacy, in which we cover three topics like pilot plant and scale up, technology development and transfer, and regulatory authorities and requirements. Uh, let's uh, let's start. Only questions and their answers. Okay. So question number first. Pilot plant is a bridge between a laboratory and a full-scale production. Main purpose of pilot plant study is to study scale-up feasibility. Scale-up refers to increasing batch size. Pilot plant helps to identify problems related to raw material, equipment, and process parameters. All of the above, correct? Scale-up problems may arise due to change in mixing, heat transfer, mass transfer, all of the above. Geometric similarity during scale-up ensures same shape and proportions. Geometric similarity during scale-up ensures same shape and proportions. Mixing efficiency during scale-up depends on impeller design, speed of agitation, or vessel size. All of the above. Scale-up of tablet compression mainly considers punch size, compression force, or die size. All of the above factors uh, considered during scale-up of a tablet compression. During scale-up of a liquid dosage form, critical factor is a viscosity. Okay. Pilot plant batches are generally larger than lab scale but smaller than a production. Main objective of scale up is to maintain quality and consistency. Validation is required during scale up to ensure reproducibility. A process validation ensures that process produces consistent quality. Technology development involves idea generation, formulation optimization, and process optimization. All of the above process content technology development. Technology transfer means moving technology from R&D to manufacturing. Successful technology transfer requires documentation, training, and communication. All of the above. Technology transfer document includes master formula record, process parameters, or quality specifications. All of the above. Poor technology transfer leads to product failure, batch rejection, regulatory issues. All of the above. Development phase mainly focuses on optimization. Development phase mainly focuses on optimization. Commercial production starts after successful validation. Commercial production starts after successful validation. Regulatory authorities ensure safety, quality, and efficacy. Regulatory requirements are mandatory for entire product life cycle. Regulatory requirements are mandatory for entire product life cycle. In India, drug regulation is governed by Drug and Cosmetic Act 1940. CDSO stands for Central Drug Standard Control Organization. CDSO functions under Ministry of Health and Family Welfare. DCGI stands for Directoral Drug Controller General of India. Okay. Option A. DCGI stands for Drug Control Drug Controller General of India. DCGI is responsible for approval of new drug and clinical trials. DCGI, Drug Controller General of India, is responsible for approval of new drugs and clinical trials. GMP stands for Good Manufacturing Practice. GMP ensures that products are safe and of consistent quality. GMP covers personal, premises, and equipment, all of the factors. Who GMP guidelines are issued by World Health Organization. WHO GMP guidelines are issued by World Health Organization WHO. Regulatory submission dossier includes quality data, safety data, and efficacy data. So all data includes in a regulatory submission, mainly quality, safety, and efficacy. CTD stands for Common Technical Document. Technology transfer is considered complete when process is reproducible at a commercial scale. A scale of failure may result in variation in quality, process deviation, product recall, all of the above. That's called scale of failure. Critical process parameters are those which affect quality attributes. Critical process parameters are those which affect quality attributes. Critical quality attributes CQA. Critical quality attributes refer to attributes affecting safety and efficacy. QBD stands for quality by design. QBD approach focuses on understanding process and control. QBD approach focuses on understanding process and control. Scale up of fermentation require control of pH, temperature and aeration. Scale up of fermentation requires control of pH, temperature and aeration. Technology transfer from R&D to production is also called vertical transfer. Technology transfer from R&D to production is also called a vertical transfer. Pilot plant equipment should be similar to production equipment. Change control system is required to manage process changes. Regulatory inspection ensures compliance with GMPs, SOPs, standard operating procedures, legal requirements, and good manufacturing practices. All of the above. Regulatory inspection ensures all of the factors. SOP stands for Standard Operating Procedure. SOPs are required to ensure consistency, traceability, and compliance. All of the above. SOPs are required to ensure consistency, traceability, and compliance. Documentation is important because it provides evidence of a compliance. Documentation is important because it provides evidence of a compliance. Validation documentation includes IQ, OQ, PQ, all of the above documentation. IQ stands for installation qualification. IQ stands for installation qualification. OQ verifies that equipment operates as intended. Operates as intended. OQ verifies that equipment operates as intended. PQ confirms that process produces consistent product. PQ confirms that process produces consistent product. Technology transfer failures are often due to poor communication, incomplete documentation, and lack of training. These three factors are technology transfer failures. A regulatory authority for drugs in USA is FDA, Food and Drug Administration, CDSO for India. AMA regulates drug in Europe, European Medical Agency. AMA stands for European Medical Agency. This regulates drugs in Europe. ICH stands for International Council of Harmonization. ICH stands for International Council for Harmonization. ICH guidelines focus on harmonization of regulatory requirements. Scale up requires re-evaluation of process parameters, equipment, and quality control. Scale up requires re-evaluation of process parameters, equipment, and quality control. Pilot plant studies reduce risk during commercial production. Pilot plant studies reduce risk during commercial production. A regulatory approval is required before marketing of a product. Technology transfer ensures continuity of a research, quality, and documentation. A technology transfer ensures continuity of a research quality and documentation. Scale up of parenterals requires strict control of sterility, pyrogen levels, and particulate matter, all of the above. Change in equipment size may affect mixing time, heat transfer, and product quality. All of the effects due to change in equipment size. Regulatory audits are conducted to verify compliance. Regulatory audits are conducted to verify compliance. Batch manufacturing record BMR includes raw material details, process steps, and in-process controls. These three includes under batch manufacturing record like raw material details, process steps, and in-process controls. Like batch manufacturing records, technology transfer should be planned during development stage. Technology transfer should be planned during development stage. A risk assessment is a part of GMP, QBD, or validation. Risk assessment is a part of good manufacturing practices, quality by design, and validation. Regulatory compliance reduces risk of product recall, legal action, and market rejection. Pilot plant data helps in process optimization, equipment selection, and cost estimation. All of the above. Pilot plant data helps in process optimization, equipment selection, and cost estimation. Scale up should be gradual to reduce variability. Scale up should be gradual to reduce variability. Regulatory requirements differ based on country, dosage form, and a product type. In on that basis, regulatory requirements differ. Technology transfer to another site is called horizontal transfer. Okay, means another site is called horizontal transfer, but technology transfer from R&D to production is called a vertical transfer, and another site is called horizontal transfer. Scale up of solid dosage form focuses on granulation, compression, and coating, all of the above. Scale up of solid dosage forms focuses on granulation, compression, and coating. Regulatory submissions So guys, our next topic is formulation of cosmetic and standards, herbal drug technology, and herbs as a pharmaceutical raw materials. Let's start cosmetic science and herbal drug technology. Question number first, we only see question and their answers. Cosmetics are defined as a preparations used for beautifying and cleansing. Cosmetics differ from drug because cosmetics do not alter body functions. Regulatory control of cosmetics in India is under Drug and Cosmetic Act. Cosmetic formulations must comply with BIS standards, Bureau of Indian Standards. Okay, BIS standards. Cosmetics should be free from harmful microorganisms. Preservatives are added to cosmetics to prevent microbial growth. A common preservative used in a cosmetic is parabens. Common preservative used in a cosmetic is a parabens. Emulsions are commonly used in a cosmetic such as creams. Cold cream is an example of a W by O, okay, emulsion. Vanishing cream is an example of a O by W emulsion. Shampoos are formulated mainly to cleanse hair and scalp. Surfactant in shampoo act as a cleansing agents. Surfactants in shampoos act as a cleansing agents. Herbal cosmetics contain ingredients derived from plants. Herbs means plants. Herbal cosmetic contain ingredients derived from plants. Advantage of herbal cosmetic is fewer side effects. Standardization of herbal products ensures consistency and quality. Herbal drug technology deals with processing of herbal drugs. Herbal drug technology deals with processing of herbal drugs. Crude drugs obtained from plants include leaves, roots, and bark. All of the above contain crude drugs. We obtain crude drugs from that plant organs like leaves, roots, and bark. Collection of crude drugs should be done at a proper season and stage. Drying of crude drug is done to prevent microbial growth. Drying of crude drug is done to prevent microbial growth. Shade drying is prepared for drugs containing volatile oils. Okay, shade drying means dark drying is prepared for drugs containing volatile oils. Size reduction of crude drug improves extraction efficiency. Size reduction of a crude drug improves extraction efficiency. Maceration is a method of extraction. Maceration is a method of extraction. Percolation is used for extraction of active constituents. Percolation is used for extraction of active constituents. Solvent used for extraction depends on nature of active constituents. According to nature of active constituents, we add solvent for extraction. Alcohol is commonly used as a solvent because it extracts wide range of constituents. Alcohol is commonly used as a solvent because it extracts wide range of constituents. Herbal drugs should be stored to prevent light exposure, moisture, and pest infestation. That's why herbal drugs should be stored. Powder crude drugs are stored in airtight containers. Okay. Powder crude drugs are stored in an airtight container. Adulteration of a herbal drug refers to addition of an inferior material, means rather than active constituents, other drugs in a mix. Quality control of a herbal drug includes microscopic evaluation, and chemical test. These three are the quality control of a herbal drugs. Standardization standardization of a cosmetic ensures safety, quality, and performance of a drugs or cosmetics. Okay. BI stands for Bureau of Indian Standards. B Bureau of Indian Standards. Cosmetic labeling should include manufacturer name, ingredients, and a batch number. Shelf life of cosmetic depends on formulation, storage, and packaging. Shelf life of cosmetic depends on formulation, storage, and packaging. Skin creams should have pH close to skin pH, means same pH. Talcum powder is used as a absorbent. Talcum powder is used as absorbent. Deodorants work by killing bacteria and masking odor. Okay, and reducing sweat. Antiperspirant reduce sweating. Antiperspirants reduce sweating by blocking sweat glands. Lipsticks mainly contain oils and waxes. Lipsticks mainly contain oils and waxes. Herbal hair oils are used for nourishing scalp. Herbal hair oils used for nourishing scalp. Stability testing of cosmetic ensures safety and shelf life. Stability testing of cosmetics ensures safety and shelf life. Herbal drug technology aims to ensure quality and efficacy of a herbal drugs. Herbal drug technology aims to ensure quality and efficacy of a herbal drugs. Ash value determination indicates inorganic matter. Ash value determination indicates inorganic matter. Loss on drying determines moisture content. Extractive value indicates soluble constituents. Extractive value indicates soluble ingredients. Foreign organic matter refers to adulterants. Cosmetic should not contain toxic heavy metals. Cosmetic should not contain toxic heavy metals. Herbal raw materials must be authenticated by pharmacognosist. Okay, herbal raw material must be authenticated by pharmacognosist. Herbal extracts are concentrated by evaporation. Herbal extracts are concentrated by evaporation. WHO guidelines for herbal medicines emphasize quality, safety, and efficacy. WHO guidelines for herbal medicines emphasize quality, safety, and efficacy. Cosmetic manufacturing must follow GMP, like good manufacturing practices. Cosmetics manufacturing must follow good manufacturing practice. Creams are classified as semi-solid dosage form. Creams are classified as a semi-solid dosage form. Herbal drug stability is affected by light, moisture, and temperature. Herbal drug stability is affected by light, moisture, and temperature. Essential oils in herbal cosmetics are obtained by steam distillation. Essential oils in herbal cosmetics are obtained by steam distillation. Herbal cosmetics are preferred because they are natural and mild. Herbal cosmetics are preferred because they are natural and mild. Colorants used in cosmetic must be approved and safe. Emollients in cosmetics used to soften skin. Emollients in cosmetics are used to soften skin. Humectants help in retaining moisture. Humectants help in retaining moisture. Glycerin in cosmetic act as a humectant. Glycerin in cosmetic acts as a humectant. Herbal drugs are classified based on a morphology, chemical nature, pharmacological action, all of the above. So all of the above. Herbal drugs are classified based on their morphology, their chemical nature, and their pharmacological action. Powder cosmetics require preservative mainly when containing moisture. Powder cosmetics require preservatives mainly when containing moisture. Storage of herbal raw materials should prevent insect infestation, fungal growth, and moisture absorption. So, all of the above. Storage of herbal raw materials should prevent insect infestation, fungal growth, and moisture absorption. Cosmetic products should be tested for skin irritation, stability, and microbial load. All of the above, correct? Labeling of herbal cosmetics should include ingredients, direction of use, and warnings. Herbal drug standardization. Herbal drug standardization reduces variability. Herbal raw materials should be free from contaminants. Sunscreens protect skin from UV radiation. Uh, SPF indicates protection against UVB. Okay. Herbal sunscreens may contain aloe vera, turmeric, and sandalwood oil. Means sandalwood. All of the above contained in herbal sunscreens. Toothpaste is classified as toothpaste is classified as a cosmetic. Abrasives in toothpaste helps in cleaning teeth. Abrasives. Abrasives in a toothpaste help in cleaning teeth. A fluoride in toothpaste is used to prevent dental caries. Fluoride in toothpaste is used to prevent dental caries. Herbal toothpaste may contain Herbal toothpaste may contain neem, clove, and meswak. All of the above. Herbal toothpaste may contain neem, clove, and meswak. Cosmetic creams should be free from irritants. Cosmetic creams should be free from irritants. Herbal drug processing should follow scientific principles. Herbal raw materials are authenticated using microscopy, and chemical test. All tests are for authentication of herbal raw materials like microscopy, and chemical test. Cosmetics shelf life is influenced by all of the above, like preservatives, packaging, storage conditions are influenced by cosmetic shelf life. Herbal extracts should be standardized for marker compounds. Herbal extracts should be standardized for marker compounds. Cosmetic manufacturing requires clean environment to prevent contamination. Cosmetic manufacturing requires clean environment to prevent contamination. Hair dyes should be tested for skin sensitivity, stability, and for color. Hair dyes should be tested for skin sensitivity, stability, and color. Herbal drug formulations are often prepared as tablets, capsules, and syrups. Cosmetics intended for eye area must be non irritant. Herbal drugs as a raw material should be poorly identified. Cosmetic preservatives should be effective against bacteria, fungi, and yeast. All of the above. Cosmetic preservatives should be effective against bacteria, fungi, and yeast. Herbal drug technology bridges traditional medicine and modern pharmacy. Herbal drug technology bridges traditional medicine and modern pharmacy. Cosmetics regulations ensure safety of consumers, product quality, and legal compliance. All of the above. Cosmetics regulations ensure safety of consumers, product quality, and legal compliance. Herbal drugs require stability studies because they are complex mixtures. Okay, so that's why stability studies are required. Cosmetic formulations must avoid prohibited substances. Cosmetic formulations must avoid prohibited substances. Herbal cosmetics often use extracts instead of a synthetic actives. Okay, in herbal there is no synthetic extracts instead of synthetic actives. Storage of cosmetics should prevent heat exposure, light exposure, microbial contamination. Storage of cosmetics should prevent heat exposure, light exposure, and microbial contamination. Herbal raw material quality affects safety, efficacy, consistency, all of the above. Herbal raw material quality affects safety, efficacy, and consistency. So, guys, our next topic is Ayush, herbal formulations, nutraceuticals, and herbal cosmetics. Okay, in which we see some MCQs about Ayush system, herbal formulations, nutraceuticals, and herbal cosmetics. Let's start. Question number one, in which you only see question and their answer. Ayurveda is an ancient system of medicine originating in India. Ayurveda literally means science of a life. Okay. Ayurveda literally means science of a life. The three doshas in Ayurveda are Vat, Pitta, Kapha. Siddha system of medicine originated in South India. Siddha, South India. Siddha medicine is closely associated with Tamil culture. Okay. Siddha medicine is closely associated with Tamil culture. Unani system of a medicine originated in Greece. Unani system of a medicine originated in Greece. Unani system is based on the theory of four humors. Okay, Unani system is based on a theory of four humors. The four humors in Unani are blood, phlegm, yellow bile, and black bile. Homeopathy was founded by Samuel Hahnemann. Homeopathy was found by Samuel Hahnemann. Principle of homeopathy is like cures like. Homeopathic medicines are prepared by potentization. Potentization. Homeopathic medicines are prepared by potent. Homeopathic medicines are prepared by potentization. Ayush stands for Ayurveda, Yoga, Unani, Siddha, and Homeopathy. Regulatory body for Ayush in India is under Ministry of Ayush. Okay. Regulatory body for Ayush in India is under Ministry of Ayush. Herbal syrup are classified as liquid dosage forms. Herbal syrup mainly contain sugar and herbal extract. Herbal mixtures are also known as decoctions. Herbal mixtures are also known as decoctions. Decoctions are prepared by boiling crude drug with water. Decoctions Decoctions are prepared by boiling crude drugs with water. Herbal tablets are prepared by compression. Advantage of herbal tablet is accurate dosing. Novel herbal dosage forms are designed to improve bioavailability. Novel herbal dosage forms are designed to improve bioavailability. Phytosomes are complexes of herbal extracts with phospholipids. Phytosomes are complexes of herbal extracts with phospholipids. Phytosomes improve bioavailability by enhancing absorption. Phytosomes are especially useful for poorly bioavailable phytoconstituents. Nutraceuticals are products that provide health benefits beyond nutrition. Nutraceuticals are products that provide health benefits beyond nutrition. Nutraceuticals are positioned between food and drugs. Example of nutraceutical is a vitamin supplement. Functional foods are food that provide additional health benefits. Functional foods are foods that provide additional health benefits. Herbal cosmetics are cosmetics containing plant-based ingredients. Herbs means plant. Advantage of herbal cosmetic is better skin compatibility. Advantage of a herbal cosmetic is a better skin compatibility. Herbal face creams are used mainly for beautification and skin care. Medicinal plants used in Ayurveda are described in a Charak Samhita. Medicinal plants used in Ayurveda are described in Charak Samhita. Bhasmas in Ayurveda are mineral preparations. Bhasmas in Ayurveda are mineral preparations. Siddha medicines extensively use minerals and metals. Siddha medicine extensively use minerals and metals. Unani formulations include Ark, Majun, and Sharbat. Unani formulations include Ark, Majun, and Sharbat. Homeopathic dilutions are expressed as XCLM. Okay. Homeopathic dilutions are expressed as XCLM. Herbal syrups require preservatives mainly because they contain water and sugar. Herbal syrup require preservatives mainly because they contain water and sugar. Shelf life of herbal formulations depend on raw material quality, processing, and storage conditions. Herbal tablets may require disintegrants to facilitate breakdown. Herbal tablets may require disintegrants to facilitate breakdown. Novel herbal drug delivery system helps in targeted and controlled delivery. Nutraceuticals are regulated in India under Food Safety and Standard Act. Herbal cosmetic must not claim therapeutic cure. They only like beautification, moisturizing or protection. Antioxidants in nutraceutical helps in oxidative damage reduction. Antioxidant in nutraceuticals help in oxidative damage reduction. Probiotics are defined as beneficial live microorganisms. Probiotics are defined as beneficial live microorganisms, and prebiotics are substances that promote growth of a beneficial bacteria. Herbal hair oils mainly act by nourishing scalp and hair. Herbal formulations require standardization to ensure quality and consistency. Marker compounds are used for standardization. Bioavailability of herbal drugs is often low because they are complex mixtures. So, novel delivery systems overcome limitations of herbal drugs by enhancing absorption. Herbal nutraceutical capsules are classified as food supplements. Herbal nutraceutical capsules are classified as food supplements. Ayurvedic dosage form includes Churna, Vati, Asava, and Arishta. Means all. All are the Ayurvedic dosage forms. Asava and Arishta are prepared by fermentation. Siddha formulations include Churnam, Parpam, and Chenduram. These three are the Siddha formulations: Churnam, Parpam, and Chenduram. Unani Sharbat is equivalent to syrup. Unani Sharbat is equivalent to syrup. Homeopathic globules are made of sucrose. Homeopathic globules are made of a sucrose. Herbal mixtures often show variability due to seasonal variation, geographic source, and a processing. Okay. Nutraceuticals may help in prevention of lifestyle disorders. Nutraceuticals may help in prevention of lifestyle disorders. Omega 3 fatty acids are used as a nutraceuticals. Omega 3 fatty acids are used as a nutraceuticals. Herbal cosmetics should be tested for skin irritation, stability, microbial load. Herbal cosmetics should be tested for skin irritation, stability, and microbial load. Phytosomes are different from liposomes because phytosomes have chemical complex formation. Novel herbal drug delivery system improves patient compliance by reducing dosing frequency. Nutraceutical labeling must not claim disease cure. Herbal raw materials used for formulations must be authenticated. Shelf life of herbal syrups is generally shorter than tablets. Shelf life of herbal syrups is generally shorter than tablets. Herbal tablets may require coating to mask taste. Nutraceuticals are mainly used for health promotion. Nutraceuticals are mainly used for health promotion. Herbal cosmetics regulations ensure consumer safety. Herbal cosmetics regulations ensure consumer safety. Ayush drugs require licensing from state licensing authority. Okay. Ayush drugs require licensing from state licensing authority. Novel herbal drug delivery system may include nanoparticles, phytosomes, and lipid carriers. Novel herbal drug delivery system may include nanoparticles, phytosomes, and lipid carriers. Herbal nutraceuticals are often used as preventive healthcare products. Herbal nutraceuticals are often used as a preventive healthcare products. Ayurvedic formulations emphasize holistic approach. Ayurvedic formulations emphasize holistic approach. Siddha system considers disease as an imbalance of a dosha elements like metal elements. Siddha system considers disease as imbalance of elements. Unani medicine emphasizes temperament like Mijaj. Okay. Unani medicine emphasizes temperament, Mijaj. Homeopathic medicines are generally administered in very small doses. Homeopathic medicines are generally administered in a very small doses. Herbal formulations must be free from heavy metals beyond limits. Herbal formulations must be free from heavy metals beyond limits. Nutraceutical safety evaluation includes toxicity, quality, and contaminants. All of the above correct. Nutraceutical safety evaluation includes toxicity, quality, and contaminants. Herbal cosmetics may include plant extracts for antioxidant effect, moisturizing effect, or anti-aging effects. Okay. Herbal cosmetics may include plant extracts for antioxidant effect, moisturizing effect, or anti-aging effect. Novel herbal drug delivery system improves therapeutic efficacy by enhancing bioavailability. Herbal drug standardization reduces variability. Herbal drug standardization reduces variability. Nutraceuticals differ from drugs because they are used for health maintenance, not curation. Okay. Herbal cosmetic creams should have pH close to skin pH. Ayush systems emphasize use of natural substances. Ayush systems emphasize use of natural substances. Herbal formulations may show interaction due to multiple constituents. Herbal formulations may show interaction due to multiple constituents. Novel herbal drug delivery system is particularly useful for poorly bioavailable phytoconstituents. Herbal nutraceuticals are marketed mainly as a over-the-counter supplements. Ayurvedic churnas are equivalent to powders. Ayurvedic churnas are equivalent to powders. Herbal mixtures require labeling of ingredients, directions, and warnings. All of the above. So, herbal mixture require labeling of ingredients, directions, and warnings. Nutraceuticals may support management of diabetes, hypertension, or hyperlipidemia. Nutraceuticals may support management of diabetes, hypertension, and hyperlipidemia. Herbal cosmetics must comply with cosmetic rules. Herbal cosmetic must comply with the cosmetic rules. Novel herbal drug delivery system reduces variability in drug absorption. Novel herbal drug delivery system reduces variability in a drug absorption. Herbal formulation stability is affected by light, moisture, temperature. All of the above factors are affected herbal formulation stability. Next, a nutraceutical should not replace medical treatment without advice. Nutraceuticals should not replace medical treatment without advice. Herbal cosmetics advertising should be scientific and truthful. Herbal cosmetics advertising should be scientific and truthful. Novel herbal drug delivery system requires evaluation of particle size, release profile, and stability. All of the above, correct? Novel herbal drug delivery system requires evaluation of particle size, release profile, and stability. Ayush medicines must be manufactured under GMP, like good manufacturing practices. Herbal nutraceutical capsules often contain extracts or powders. Okay, capsules. Herbal nutraceutical capsules often contain extracts or powders. Herbal cosmetics are preferred by consumers due to natural origin, perceived safety, and skin friendliness. All of the above factors. That's why herbal cosmetics are preferred by consumers because of natural origin, perceived safety, and skin friendliness. Novel herbal drug delivery system helps in reducing dose and side effects. Novel herbal drug delivery system helps in reducing dose and side effects. Ayush systems promote preventive and holistic healthcare. Ayush system promotes preventive and holistic healthcare. Overall aim of an Indian system of medicine, herbal formulations, nutraceuticals, and herbal cosmetics is to provide safe, effective, and natural healthcare products. Okay, these are the main aim of our Indian system of medicine. Uh, Ayush system promotes preventive and holistic healthcare. Novel drug, a novel herbal drug delivery system helps in reducing the dose and side effects. Herbal cosmetics are preferred due to consumers due to natural origin, perceived safety, and skin friendliness. Herbal nutraceutical capsules often contain extracts or powders. Ayush medicines must be manufactured under GMP. Novel herbal drug delivery system requires evaluation of a particle size, release profile, and stability. Herbal cosmetics advertising should be scientific and truthful. Nutraceuticals should not replace medical treatment without advice. A novel herbal drug delivery system reduces variability in a drug absorption. Herbal cosmetics must comply with the cosmetic rules. Nutraceuticals may support management of a diabetes, hypertension, hyperlipidemia, all drugs, diseases. Herbal mixtures require labeling of ingredients, direction, and warnings. So guys, our next topic is UV visible spectroscopy, in which we see atomic absorption spectroscopy, IR spectroscopy, NMR spectroscopy, mass spectrometry, thermal analysis like DTA, DSC, and TGA, X-ray diffraction like XRD. So let's start. UV visible spectroscopy is based on absorption of radiation due to electronic transitions. UV region of an electromagnetic spectrum lies between 200 to 400 nanometer wavelength. UV region of an electromagnetic spectrum lies between 200 to 400 nanometer. Beer-Lambert law relates absorbance with concentration and a path length. Beer-Lambert law relates absorbance with concentration and path length. A limitation of Beer-Lambert law occurs at high concentration. Chromophore is a group that absorbs UV visible radiation. Chromophore is a group that absorbs UV visible radiation. Oxochromes increases absorption intensity. Oxochromes increase absorption intensity. UV spectroscopy is widely used for quantitative analysis. UV spectroscopy is widely used for quantitative analysis. Atomic absorption spectroscopy is used mainly for metals analysis. AAS is used mainly for metal analysis. Principle of atomic absorption spectroscopy is based on absorption of a radiation by free atoms. Okay, principle of AAS based on absorption of a radiation by free atoms. Radiation source used in atomic absorption spectroscopy is hollow cathode lamp. Radiation source hollow cathode lamp in AAS. Flame used in AAS commonly is air acetylene. Which flame used in atomic absorption spectroscopy is air acetylene. Atomic absorption spectroscopy is more sensitive than UV visible spectroscopy for UV visible spectroscopy for trace metal analysis. IR spectroscopy is based on a molecular vibration. IR spectroscopy is based on a molecular vibrations. IR spectrum is usually plotted as a percentage transmitters versus wave number. IR spectrum is usually plotted as a percentage transmitters versus wave number. IR region lies between 4000 to 400 centimeter inverse. Functional group identification is best done by IR spectroscopy. Functional group identification is best done by IR spectroscopy. OH stretching vibration appears around 2500 to 3500 centimeter inverse in between 2500 to 3500. Carbonyl stretching appears near 1700 centimeter inverse. हे दोन्ही पण कार्बन. Carbonyl stretching appears near 1700 centimeter inverse. Fingerprint region in IR lies between 1500 to 400 centimeter inverse. Fingerprint region in IR lies between 1500 to 400 centimeter inverse. NMR spectroscopy is based on a nuclear spin, nuclear magnetic resonance. NMR means nuclear magnetic resonance. It's based on a nuclear spin. Nucleus commonly used in a NMR is 1 hydrogen. Chemical shift is measured in ppm, parts per minute. Okay, parts per million. Chemical shift is measured in a ppm. TMS is used in NMR as internal standard. TMS means trimethylsilane. Okay, is used in a NMR as a internal standard. NMR provides information about नहीं सर बोलिए. NMR provides information about structure and environment of atoms. Splitting of NMR signals is due to spin-spin coupling. Mass spectrometry is used to determine molecular weight. Principle of mass spectrometry involves ionization and fragmentation. Principle of mass spectrometry involves ionization and fragmentation. Mass spectrum plots M by Z versus intensity. Mass spectrum plots M by Z versus intensity. Molecular ion peak represents parent molecule. Molecular ion peak represents parent molecule. Base peak is the peak with highest intensity. Base peak is the peak with highest intensity. Fragmentation patterns help in structure elucidation. Fragmentation pattern helps in structure elucidation. Electron impact ionization is commonly used in a mass spectrometry. Electron impact ionization is commonly used in a mass spectrometry. Thermal analysis studies change in physical properties with a temperature. Thermogravimetric analysis measures change in a weight. TGA measures change in a weight. Differential scanning calorimetry DSC measures change in a heat flow. Okay, DSC measures change in a heat flow. DTA compares temperature differences between sample and standard. DTA compares temperature difference between sample and standard. Thermal analysis is useful for studying polymorphism, purity, and stability. All of the above. Thermal analysis is useful for studying polymorphism, purity, and stability. Melting point determination is done using differential scanning calorimetry. Melting point determination is done using differential scanning calorimetry. X-ray diffraction analysis is based on scattering of X-rays. X-ray diffraction analysis is based on scattering of X-rays. X-ray diffraction is mainly used for crystalline substances. X-ray diffraction is mainly used for crystalline substances. Bragg's law relates wavelength and angle. Bragg's law it relates wavelength and angle. XRD helps in identification of a polymorphs. X-ray diffraction, identification of a polymorphs. Amorphous substance show in XRD, broad peaks. Okay, amorphous substances shows in X-ray diffraction. It's a broad peak. UV spectrophotometer uses which detector? UV spectrophotometer uses photomultiplier tube, PMT. Double beam spectrophotometer improves accuracy, sensitivity, and stability, all of the above. Deuterium lamps is used in a UV region. Deuterium lamp is used in a UV region. Tungsten lamp is used in visible region. Okay, tungsten in visible region and deuterium in a UV region. IR sample preparation for solid is done using KBR pellet. IR sample preparation for solids is done using KBR pellet. NMR solvent should be deuterated. NMR solvent should be deuterated. Shielded protons appear upfield. Okay. Shielded protons appear upfield. Deshielded protons appear downfield. DD. ओके जैसे कैसे याद रखना है आपको डी से डी डी शील्डेड डाउनफील्ड शील्डेड अपफील्ड एस यू मास एनालाइजर सेपरेट्स आयन बेस्ड ऑन अ एम बाय जेड रेशो mass analyzer separates ions based on a m by z ratio. Quadrupole analyzer is used in a ms. Quadrupole analyzer is used in a mass spectrometry. Thermal analysis helps in detecting moisture content, decomposition, and phase transitions. Thermal analysis helps in detecting moisture content, decomposition, and phase transitions. Differential scanning calorimetric curve shows exothermic and endothermic peaks. DSC curve shows endothermic and exothermic peaks. XRD pattern is a characteristic of a crystal structure. UV spectroscopy is not suitable for compounds lacking chromophore. Atomic absorption spectroscopy requires sample to be in a liquid or a solution form. IR spectroscopy cannot be used for a quantitative analysis. Okay. IR spectroscopy is only used for a functional group analysis, structural confirmation, and polymorphism. NMR is a non-destructive because it does not ionize sample. Okay, that's why it's a non-destructive. Mass spectrometry is destructive due to ionization. Mass spectrometry is destructive due to ionization. Thermal analysis instruments require control heating rate. Thermal analysis instruments require control heating rate. XRD requires sample to be crystalline. XRD requires sample to be crystalline. UV spectroscopy is commonly used in assay of drugs. UV spectroscopy is commonly used in assay of drugs. IR spectroscopy helps in detection of functional groups. IR spectroscopy helps in detection of functional groups. NMR peak area is proportional to number of protons. NMR peak area is proportional to number of protons. Mass spectrometry provide information about isotope pattern, fragmentation, and molecular weight. Okay, all of the above. Mass spectrometry provides information about isotopic pattern, fragmentation, and molecular weight. Thermal gravimetric analysis (TGA) is useful in studying moisture content, decomposition, and stability. Thermal gravimetric analysis is useful in studying moisture content, decomposition, and stability. XRD is widely used in a pharmaceutical industry for polymorph identification. XRD is widely used in a pharmaceutical industry for polymorph identification. UV visible spectroscopy requires sample to be colored or absorbing. Atomic absorption spectroscopy is a type of atomic spectroscopy. IR spectroscopy cannot detect metal ions directly. IR spectroscopy can detect functional groups, hydrogen bonding, and structural features. NMR require application of a magnetic field. NMR requires application of a magnetic field. Mass spectrometer components includes ion source, mass analyzer, and a detector. All components contained include in a mass spectrometer like ion source, mass analyzer, and detector. Differential scanning calorimetry is preferred over DTA because it provides quantitative heat flow data. Okay, differential scanning calorimetry is preferred over DTA because it provides quantitative heat flow data. XRD can differentiate between polymorphs. UV spectrophotometry is governed by Biot-Lambert law. AAS is not suitable for analysis of organic molecules, but atomic absorption spectroscopy is only for ions like sodium, iron, or calcium. IR spectra are usually obtained using FTIR instruments. Uh, IR spectra are usually obtained using FTIR instrument. FTIR stands for Fourier Transform Infrared. याद रखना FTIR stands for Fourier Transform Infrared. NMR spectroscopy provides most detailed information about molecular structure. Okay. NMR spectroscopy provides most detailed information about molecular structure. Mass spectrometry sensitivity is highest for trace analysis. Mass spectrometry sensitivity is highest for trace analysis. Thermal analysis requires reference material for DTA. Okay, differential thermal analysis. XRD patterns are unique for each crystal lattice. UV spectroscopy is limited for compounds with no chromophore. AAS can detect metals at a ppm level. Atomic absorption spectroscopy can detect metals at a ppm level. IR spectroscopy sample preparation does not include flame atomization. Okay, but IR spectroscopy sample preparation does include KBR pellet, mull method, or solution method, but flame atomization not included. NMR chemical shift depends on electronic density, magnetic field, and reference compound. NMR chemical shift depends on like all factors like electron density, magnetic field, and reference compound. Mass spectrometry cannot directly measure concentration without calibration. Mass spectrometry can directly measure molecular weight, fragment scent, and isotopic abundance, but not a concentration without calibration. Differential scanning calorimetry is useful in a pharmaceutical analysis for polymorphism, drug excipient compatibility, and stability. Okay, differential scanning calorimetry is useful in pharmaceutical analysis for polymorphism, drug excipient compatibility, and stability. XRD requires monochromatic radiation, usually from copper target. XRD requires monochromatic radiation, usually from copper target. UV visible spectroscopy is widely used because it is simple and economical. UV visible spectroscopy is widely used because it is a simple and economical. AAS requires hollow cathode lamp specific for each element. IR spectroscopy can identify functional groups by peak position, not a intensity, not a width, not all of the above. Because of a peak position. Okay. IR spectroscopy can identify functional groups by peak position. NMR is less sensitive compared to mass spectrometry. NMR is less sensitive compared to mass spectrometry. Mass spectrometry requires high vacuum. Mass spectrometry requires high vacuum. Thermal analysis helps in quality control by detecting impurities, stability issues, phase changes, all of the above. Thermal analysis helps in quality control by detecting impurities, stability issues, and phase changes. XRD analysis is not suitable for amorphous liquids. Okay. XRD analysis is suitable for crystalline solids, polymers, and solid drugs, but not for amorphous liquids. Analytical techniques are selected based on a nature of drug, purpose of analysis, sensitivity required, all of the above. Analytical techniques are selected based on a nature of drug, purpose of analysis, sensitivity required. Overall purpose of analytical techniques in pharmacy is to ensure identity, purity, and quality of drugs. Okay. So these are the some base questions on spectrometry. Analytical techniques are selected based on nature of drug, purpose of analysis, and sensitivity required. XRD analysis is not suitable for amorphous liquids. So guys, our next topic is quality assurance, quality management system, total quality management, ICH guidelines, quality by design, and documentation, calibration, and validation. Let's start question and their answer. Quality assurance is primarily concerned with ensuring quality in all stages. Quality control focuses mainly on testing and inspection. Quality management system refers to organized structure of for quality. Quality management system refers to organized structure for quality. Main objective of quality management system is to ensure consistent quality products. Total quality management emphasizes involvement of all employees. Total quality management focuses on prevention of defects. Continuous improvement is a key principle of total quality management. Continuous improvement is a key principle of total quality management. Customer satisfaction is central to total quality management. Customer satisfaction is central to total quality management. ICH stands for International Council for Harmonization. ICH stands for International Council for Harmonization. ICH guidelines aims to harmonization of regulatory requirements. ICH-Q series guidelines related to quality. Q means quality. ICH-Q8 deals with pharmaceutical development. Q8 pharmaceutical development. ICH-Q9 related to quality risk management. ICH-Q10 describes pharmaceutical quality system. Quality by design means designing quality into product. Quality by design, designing quality into product. Quality by design approach is based on scientific understanding and risk management. Critical quality attributes CQA are attributes affecting safety and efficacy. Critical quality attributes are attributes affecting safety and efficacy. Critical process parameters CPP are parameters that affect product quality. Critical process parameters are parameters that affect product quality. Design space in QBD refers to approved operating ranges. Design space means approved operating ranges. Operating within design space is considered acceptable. Operating within design space is considered acceptable. Documentation is important because it provides proof of a compliance. Good manufacturing practice GMP documentation follows principle of a ALCOA. Okay. GMP documentation follows principle of ALCOA. ALCOA stands for accurate, legible, contemporaneous, original, attributable. ओके फिर से देखिए एक्यूरेट ए फॉर एक्यूरेट लेजिएबल ओके एक्यूरेट लेजिएबल contemporaneous original and attributable. SOP stands for standard operating procedure. SOPs are prepared to ensure consistency and uniformity. Master formula record contains manufacturing instructions. Batch manufacturing record BMR is prepared to record actual production details. Documentation errors should be corrected by single line cancellation with signature. Documentation errors should be corrected by single line cancellation with signature. Calibration is the process of comparing instrument with standard. Calibration is the process of comparing instrument with standard. Calibration ensures accuracy of measurements. Calibration ensures accuracy of measurements. Instruments should be calibrated at defined intervals. Instruments should be calibrated at defined intervals. Validation is defined as documented evidence of a consistency. Process validation ensures that process produces consistent quality. Equipment validation includes IQ, OQ, PQ, all of the above. Okay. Equipment validation includes all like IQ, OQ, PQ. IQ stands for installation qualification. IQ stands for installation qualification. OQ verifies that equipment operates as intended. OQ verifies that equipment operates as intended. PQ confirms that equipment PQ confirms that equipment operates consistently under routine conditions. Validation is mandatory for a new process, modified process or equipment, all of the above. Revalidation is required when significant changes occurs. Change control system is used to manage process and system changes. A deviation refers to departure from approved procedure. Deviation means DD, departure from approved procedure. CAPA stands for corrective and preventive action. CAPA. CAPA stands for corrective and preventive action. A root cause analysis is a part of a CAPA. Root cause analysis is a part of a CAPA. Quality audit is conducted to verify compliance with a quality system. Quality audit is conducted to verify compliance with quality system. Internal audit is performed by company personnel. External audit is conducted by regulatory agencies. Quality manual describes overall quality policy and system. Quality manual describes overall quality policy and system. Training records are a part of QA documentation. Training records are part of a QA documentation. Document control ensures use of current approved documents. Document control ensures use of current approved documents. Obsolete documents should be destroyed or archived. Data integrity ensures that data is accurate and reliable. GDP in data integrity stands for GDP in data integrity stands for good data practice. Okay, good data practice. GDP good data practice. Electronic records must comply with Olkoya principles. अभी हमने ऊपर देखा था accurate, legible, compensates, original. Okay. Risk management in QBD is described in risk management, total quality risk management, QRM, quality risk management, Q9. Quality culture refers to attitude towards quality. Quality culture refers to attitude towards quality. Supplier qualification is a part of a QA, quality assurance. Supplier qualification is a part of a QA. Vendor audit ensures quality of a supplied materials. Stability studies are required to establish shelf life. Validation protocol includes objective, acceptance criteria, and test procedures, all of the above. Validation protocol includes objective, acceptance criteria, and test procedure. Validation report summarizes executed activities and results. Validation report summarizes executed activities and results. Calibration standards should be traceable to national standards. Calibration standards should be traceable to national standards. Out of specification results indicates product fails to meet specification OOS. Out of specification means product fails to meet specification. Out of specification investigation is required to determine root cause. Quality metrics are used to measure performance of a quality system. Quality metrics are used to measure performance of a quality system. Management review is required to assess effectiveness of a quality management system. Management review is required to assess effectiveness of a quality management system. Quality policy is established by top management. Quality policy is established by top management. Continuous improvement cycle is also called PDCA. Continuous improvement cycle, okay, is also called PDCA. PDCA stands for process, develop, check and approve. PDCA, product, process, develop, check and approve. Validation master plan outlines overall validation strategy. Validation master plan outlines overall validation strategy. GMP compliance ensures legal manufacturing, consistent product quality, and patient safety. All of the options are correct for GMP compliance, like legal manufacturing, consistent product quality, and patient safety. Calibration status of instruments should be indicated by label or tag. Audit observations are classified as minor, major, and critical. Major deviation affects product quality. Major deviation affects product quality. Critical deviation may lead to product recall. Critical deviation may lead to product recall. Quality risk assessment tool includes FMEA, HACCP, and fishbone diagram. All of the above. These all of the options are the correct or tools for the quality risk assessment. FME stands for failure mode and effect analysis. FMEA stands for failure mode and effects analysis. FMEA stands for failure mode and effects analysis. Validation of analytical method ensures method reliability, accuracy and precision, and reproducibility. All of the above correct for ensuring validation of analytical methods. Let's see again. Validation of analytical method ensures method reliability, accuracy and precision, and reproducibility. Cleaning validation ensures equipment is clean, no cross contamination, acceptable residue levels. Okay, all of the correct for cleaning validation. Quality objectives should be measurable. Okay, quality objectives should be measurable. Quality management review frequency is decided by top management. Validation is documented to satisfy regulatory requirements. Annual product review evaluates consistency of a product quality. Documentation control includes documentation control includes approval, distribution, and revision. All of the above. Calibration failure may lead to incorrect measurements. Calibration failure may lead to incorrect measurements. QBD reduces need for end product testing. Quality by design reduces need for end product testing. ICH-Q11 deals with APIs development. ICH-Q11 deals with APIs development. Risk management is a Q9. Clinical trials stability it's another. But ICH-Q11 is a API development. Okay, APIs. Data integrity violations affect product quality and compliance. Data integrity violations affect product quality and compliance. Quality assurance department is independent of a production. Quality assurance department is independent of a production. Validation activities should be planned before production. Quality system documentation hierarchy starts with a quality manual. Starting from quality manual, quality system documentation hierarchy starts with a quality manual. Calibration frequency depends on instrument stage, stability, and risk. Calibration frequency depends on instrumentation usage, stability, or a risk. All of the above. GMP training should be provided to all personnel. Okay. Good manufacturing practices training should be provided to all personnel. Quality management system effectiveness is measured through audits, metrics, and management review. All of the above factors measured quality management system effectiveness. Okay. Audits, matrices, and management review. Validation acceptance criteria must be predefined. Validation acceptance criteria must be predefined. Change control ensure changes are evaluated and approved. Change control ensures changes are evaluated and approved. SOP revision should be done when process change and regulatory changes. Then SOP revision should be done. Okay. When process change and regulatory changes. Quality assurance ensures compliance with regulatory requirements, GMP, and internal policies. All of the above. So, quality assurance ensures compliance with all of the above, like GMP, regulatory requirements, and internal policies. Validation provides confidence that process is under control. Okay. Validation provides confidence that process is under control. Proper documentation helps in traceability, accountability, and compliance. For all of the above option, proper documentation helps are needed for traceability, accountability, and compliance. Overall goal of a quality assurance, quality management system, and validation is to ensure safe, effective, and quality pharmaceutical products. So these are the 100 questions on quality assurance, quality management system, and validation. Let's see one recap. Proper documentation helps in traceability, accountability, and compliance. Validation provides confidence that process is under control. Quality assurance ensures compliance with GMP, regulatory requirements, and internal policies. SOP revision should be done when process change or regulatory changes. Change control ensures changes are evaluated and approved. Validation acceptance criteria must be predefined. Quality management system effectiveness is measured through audits, metrics, and management review. GMP training should be provided to all personnel. Calibration frequency depends on instrument usage, stability, or risk. Quality system documentation hierarchy starts with a quality manual. Validation activities should be planned before production. Quality assurance department is independent of a production. Okay. Data integrity violations affect product quality and compliance. So guys, our next topic is a pharmacy practice. तो चलिए स्टार्ट करते हैं. ओनली क्वेश्चन एंड आंसर्स लाइक वन लाइनर. The primary objective of community pharmacy is to provide patient-oriented pharmaceutical care. Which license is required to run a retail pharmacy in India? Form 20 and 21. ओके, रिटेलर के लिए कौन सा चाहिए? 20 और 21. Minimum qualification required to register as a pharmacist is a D Pharma. Legal responsibility for dispensing drug lies with registered pharmacist. Okay. FIFO means first in, first out. FIFO inventory method is based on a expiry date, means first expire, first out. On the basis of a expiry date, wholesale drug license is issued in फॉर्म 20B एंड 21B. ओके. और रिटेलर के लिए कौन सा होता है? सिर्फ 20 एंड 21. बट होलसेल के लिए बी ऐड होता है उसमें, 20B एंड 21B. विच रजिस्टर्ड रिकॉर्ड्स डेली सेल्स इन अ फार्मेसी? सेल्स रजिस्टर्ड. ओके. सेल्स की एंट्री किस में होती है? सेल्स रजिस्टर में. Sales register records daily sale in a pharmacy. Vaccine should be stored at 2 to 8 degree Celsius. उसको हम क्या बोलते हैं? Cold temperature. OTC drugs can be sold without prescription. उसको एक क्या बोलते हैं? OTC को ओवर द काउंटर. ओके, मतलब विदाउट प्रिस्क्रिप्शन आप उसको बेच सकते हो. Schedule H drugs are dispensed with prescription only. Schedule H क्या कहता है? Only prescription drugs. Schedule X drugs require डुप्लीकेट प्रिस्क्रिप्शन. ओके, डुप्लीकेट प्रिस्क्रिप्शन मतलब एक मेडिकल वाले के पास रहेगी और एक पेशेंट के पास रहेगी. ओके. हॉस्पिटल फार्मेसी मेनली फोकसेस ऑन अ पेशेंट केयर. Head of hospital pharmacy is chief pharmacist. Hospital pharmacy, chief pharmacist. Hospital formulary is list of approved drugs. Okay. Hospital formulary is approved list of drugs. Formulary is prepared by Drug and Therapeutic Committee. Formulary is prepared by Drug and Therapeutic Committee. Main advantage of hospital formulary is rational drug use. ओके, मतलब जितनी चाहिए उतने ड्रग आप दे सकते हो, ऐसे नहीं कि उसका इलीगल यूज़ करते हो. ड्रग इंफॉर्मेशन सेंटर प्रोवाइड्स ड्रग रिलेटेड इंफॉर्मेशन. यूनिट डोज सिस्टम सप्लाइज मेडिसिन सिंगल डोज. यूनिट डोज मतलब सिंगल डोज. Major benefit of a unit dose system is reduce medication errors. मतलब एट अ टाइम आप एक ही ड्रग बेचते हो, इसलिए मेडिकेशन एरर में प्रॉब्लम नहीं आता. फ्लूअर स्टॉक सिस्टम सप्लाइज ड्रग टू नर्सिंग स्टेशंस. फ्लूअर स्टॉक सिस्टम सप्लाइज ड्रग्स टू नर्सिंग स्टेशन. Disadvantage of फ्लूअर स्टॉक system is drug wastage. Individual prescription order system is centralized. Individual prescription order system is centralized. Emergency drug distribution is mainly for ICU and casualty. Crash cart contains emergency life-saving drugs. Crash cart contains emergency life-saving drugs. Controlled drugs are stored under lock and key. Okay. Narcotic drugs record is maintained in special register. Narcotic drugs record is maintained in a special register. ADR stands for Adverse Drug Reaction. Pharmacovigilance deals with drug safety. ABC analysis is based on cost. ABC analysis is based on a cost. Weight analysis is based on a criticality. Okay, vital, essential, or desirable. It is based on a criticality. EOQ stands for economic order quantity. Essential नहीं, economic order quantity. Good pharmacy practice emphasizes ethics and patient safety. Counseling improves patient compliance. LASA drugs means look alike, sound alike. Okay. LASA drug means look alike, sound alike. Look alike, sound alike. Expired drugs should be destroyed or returned. Expired drugs should be destroyed or returned. Purchase order is issued by pharmacy. Cold chain maintenance is essential for Cold chain is maintenance is essential for vaccines. मतलब temperature. OPD pharmacy serves outpatient departments. ओपीडी का लॉन्ग फॉर्म में क्या है? ओपीडी, आउट पेशेंट्स डिपार्टमेंट, ओपीडी. आईपीडी फार्मेसी सर्व्स एडमिटेड पेशेंट्स, मतलब इन पेशेंट डिपार्टमेंट्स. ओके. ड्रग डिस्ट्रीब्यूशन सिस्टम एम्स टू ensure timely supply. Drug distribution system aims to ensure timely supply. Bulk drug distribution is least safe because of more medication errors. Bulk drug distribution is least safe because of more medication errors. Inventory control reduces capital investment. Pharmacy ethics mainly concern patient welfare. Prescription is a legal document. Generic substitution should be done with proper approval. Medication error is preventable event. Medication error is a preventable event. High alert drug require extra precautions. High alert drug require extra precautions. Pharmacy layout should ensure proper workflow. Pharmacy layout should ensure proper workflow. Hospital pharmacy records include drug usage records. Reorder level indicates time to reorder. Overstocking leads to wastage. Overstocking leads to wastage. Understocking causes therapy interruption. Okay. Understocking causes therapy interruption. Pharmacy audit checks record and compliance. Pharmacy audit checks record and compliance. Prescription abbreviation BED means twice daily. Okay. Bis in die means 2 times a day. Hospital drug policy ensures rational use of drugs. Hospital drug policy ensures rational use of drug. Patient medication history helps in preventing drug interactions. Medication reconciliation is done at admission and discharge. Medication reconciliation is done at admission and discharge. Pharmacy and therapeutic committee reviews drug use policies. Storage condition cool place means 8 to 15 degree Celsius and cold temperature मतलब 2 to 8 degree Celsius. Cool 8 से 15. Sound inventory system ensures continuous drug availability. Sound inventory system ensures continuous drug availability. Proper labeling prevents errors. Proper labeling prevents errors. Pharmacy service quality depends on accuracy and counseling. Pharmacy service quality depends on accuracy and counseling. Hospital pharmacy is a part of a supportive service, not clinical, administrative, not diagnostic, but it's a supportive service. Okay. Hospital pharmacy is a part of a supportive service. Stock ledger records receipt and resume. Stock ledger records receipt and issues. Controlled drug sale requires prescription and register. Controlled drug sale requires prescription and register. Pharmacy manpower planning ensures right staff at a right time. Hospital pharmacy works closely with medical and nursing staff. Hospital pharmacy works closely with medical and nursing staff. Medication error reporting helps in quality improvement. Pharmacy law ensures patient safety. Drug distribution system should be safe and efficient. Drug distribution system should be safe and efficient. Drug recall is done due to quality defect. Hospital emergency pharmacy must be 24-hour functional. Hospital emergency pharmacy must be 24-hour functional. Medication chart is maintained by pharmacist and nurse. Expiry date indicates shelf life. Expiry date indicates shelf life. Drug storage should avoid light and moisture. Drug storage should avoid light and moisture. Pharmacy inventory aims to minimize capital blocking. Pharmacy inventory aims to minimize capital blocking. Drug abuse prevention is role of a pharmacist. Drug abuse prevention is a role of a pharmacist. Prescription without date is invalid. Prescription without date is invalid. Hospital pharmacy improves therapeutic outcome. Hospital pharmacy improves therapeutic outcome. Pharmacy service evaluation measures quality of care. Drug storage rack should be elevated from floor. Drug storage rack should be elevated from floor. Patient counseling should be clear and understandable. Hospital pharmacy budget planning considers drug requirement. Hospital pharmacy budget planning considers drug requirement. Pharmacy management involves planning, organizing, and controlling. Medication errors are common in bulk distribution system. Medication errors are common in bulk distribution system. Pharmacy layout should ensure patient privacy. Pharmacy layout should ensure patient privacy. Drug usage evaluation helps in rational therapy. Drug usage evaluation helps in a rational therapy. Hospital pharmacy supports entire healthcare system. Pharmacy records are important for legal compliance. Pharmacy records are important for a legal compliance. Drug distribution delay may cause therapeutic failure. Pharmacy SOP ensures standardized practices. Quality assurance in pharmacy focuses on safety and effectiveness. Quality assurance in pharmacy focuses on safety and effectiveness. Pharmacy technician works under registered pharmacist. Medication error prevention includes double checking. Medication error prevention includes double checking. Hospital pharmacy contributes to patient safety. Pharmacy management objective is efficient patient care. Drug distribution system should be store centered. Okay, sorry, patient centered. A drug distribution system should be patient centered. Role of pharmacist in hospital includes dispensing and monitoring. Pharmacist role in hospital pharmacy is dispensing and monitoring. Effective pharmacy practice results in improved health outcomes. Effective pharmacy practice results in improved health outcomes. So these are the 100 questions on hospital pharmacy. Just to recap, effective pharmacy practice results So guys, our next topic is Drugs and Cosmetic Act 1940 and Rules 1940, in which we see definitions, statutory bodies and standard, misbranded, adulterated, spurious drugs and cosmetics. Let's start. Only questions and their answer. The Drug and Cosmetic Act was enacted in the year 1940. Drug and cosmetic rules came into force in 1945. The main objective of Drug and Cosmetic Act is to regulate import, manufacture and distribution of drugs. According to the act, a drug includes substance for diagnosis, treatment or prevention. Medical devices are considered as a drugs. Okay. Medical devices are considered as a drugs. Cosmetics are intended for cleansing and beautifying, which is not a cosmetic. Tablet is a drug. Shampoo, face cream and toothpaste are example of a cosmetic. According to the act, drug includes substances used for diagnosis. Okay. The authority responsible for enforcement of the act at a central level is CDSO, Central Drug Standard Control Organization. The head of CDSO is the head of CDSO is Drug Controller General of India (DCGI). The head of a CDSO is a Drug Controller General of India. DTAB stands for Drug Technical Advisory Board. DTAB is constituted under Section 5. DTAB is constituted under Section 5. The main function of DTAB is to advise central and state governments. Chairman of a DTAB is a DCGI, Controller General of India. DCC stands for Drug Consultative Committee. Okay, DCC stands for Drugs Consultative Committee. DCC is constituted under Section 6 and DTAP is constituted under Section 5. Main function of DCC is to ensure uniform implementation. Main function of DCC is to ensure uniform implementation. DCC consists of central and state representatives. DCC consists of central and state representatives. Standard quality drug means drug complying with standards are called a standard quality drug. Standard of drugs are prescribed in Schedule A. Standards of drugs are prescribed in Schedule A. A drug is deemed not of a standard quality if it does not comply with the prescribed standards are called not the standard quality. Misbranded drug means a drug with a false or misleading label. Misbranded. Misbranded drug means drug with a false or misleading label. A drug is misbranded if a label bears false claim. A drug is misbranded if label bears false claim. Misbranding mainly relates to labeling and appearance. Adulterated drug means contaminated or filthy drugs. A drug is adulterated if it contains harmful or toxic substances. Adulteration mainly affects quality and purity. Adulteration mainly affects quality and purity. Spurious drug means imitation of another drug. Spurious drug means imitation of another drug. A drug is spurious if it is manufactured under false manufacturer name. Okay. Spurious drugs are dangerous because they may not contain any active ingredients. Spurious drugs are dangerous because they may not contain active ingredients. Cosmetics are misbranded if label is a misleading. Okay, misbranded means misleading label. Cosmetic is adulterated if it contains harmful substance. A spurious cosmetic includes a duplicate of a popular brand. Spurious cosmetics include duplicate of popular brand. Import of misbranded drug is prohibited. Import of adulterated drug is prohibited. Penalty for spurious drug is imprisonment and fine. Penalty for spurious drug is imprisonment and fine. Drug inspector is appointed under section 21. Drug inspector is appointed under section 21. Powers of a drug inspector include search and seizure. Okay. Sample analysis is done by government analyst. Government analyst submit reports in section form 13. Government analyst submit report in a form 13. Central Drug Laboratory is located at Kolkata. CDL, Kolkata. Central Drugs Laboratory is located at Kolkata. Schedule relating to standard of a cosmetic is schedule relating to standard of a cosmetic is a schedule S. Okay. A false therapeutic claim makes a drug. False therapeutic claims makes a drug misbranded. Okay. Uh, False therapeutic claim makes a drug misbranded. Use of filthy containers causes drug to be adulterated. Filthy. Okay. Use of filthy containers cause drug to be adulterated. Absence of active ingredients make drugs spurious. Wrong manufacturer name leads to spurious drug. Wrong manufacturer name leads to spurious drugs. Which body advises on technical matters of drugs? A DTAP. Which body advises on technical matters of a drug is a DTAP. Informants at state level is by state drug controller. Informants enforcement at state level is by state drug controller. Drugs Act applies to drug and cosmetics. Drugs Act applies to drugs and cosmetic. Import of drug is regulated under section chapter 2. Okay. Import of drugs is regulated under chapter 2. Manufacture and sale of drug is regulated under chapter 4. इंपोर्ट के लिए कौन सा होता है? चैप्टर 2 होता है और मैन्युफैक्चर एंड सेल के लिए चैप्टर 4 होता है. सेल ऑफ मिस ब्रांडेड कॉस्मेटिक इज प्रोहिबिटेड. Legal proceedings under the Act are initiated by drug inspector. Legal proceedings under the Act are initiated by a drug inspector. Sampling procedure is given under section 23. Sampling procedure is given under section 23. Analyst report is considered evidence. Analyst report is considered evidence. Spurious drug may be punished with life imprisonment. Spurious drug may be punished with life imprisonment. Medical devices are notified as drugs. Medical devices are notified as drugs. Example of medical device include syringes. Misbranding does not include contamination. Misbranding includes false label, wrong claim, and misleading design. Contamination means adulterated drugs. Adulteration involves contamination. Spurious drug involves false identity. Spurious drug involves false identity. The act extends to whole of India. Cosmetic includes articles intended to be applied to a human body. Penalty provisions are given under Chapter 7. Penalty provisions are given under Chapter 7. Repeat offense attracts enhanced punishment. A repeat offense attracts enhanced punishment, which is not a statutory body. PCI is not a statutory body, but DTAP, DCC, CDSO are the statutory bodies. The Act ensures safety, efficacy, and quality. The Act ensures safety, efficacy, and quality. Drug inspector works under licensing authority. Drug inspector works under licensing authority. Spurious cosmetics are those initiating popular brands. Spurious cosmetics are those imitating popular brands. The term misbranded applies to both drugs and cosmetics. Government analyst is appointed by central or state government. Government analyst is appointed by central or state government. Drug sample must be sealed in sealed container. Drug samples must be sealed in a sealed container. Standards of drugs are mentioned in Schedule B. Okay. Standards of drugs are mentioned in a Schedule B. Schedule E relates to poisonous substances. Schedule E relates to poisonous substances. Misbranded cosmetics may cause confusion to consumer. Misbranded cosmetics may cause confusion to consumer. Adulterated cosmetics may cause harm to users. Adulterated cosmetics may cause harm to users. Spurious drug offense is a serious offense. Which section defines drug and cosmetics? Section 3rd. Okay. Section 3rd defines drug and cosmetics. Legal definition of cosmetics is given under Section 3rd. Legal definition of a cosmetic is given under Section 3rd. Spurious drugs are often counterfeit. Spurious drugs are often counterfeit. Label claim must be truthful. Label claim must be truthful. Cosmetic safety is assessed by regulatory authority. DTAP members include experts from medical and pharmaceutical fields. DCC meetings aim to coordinate enforcement. DCC meetings aim to coordinate enforcement. The Act prevents substandard drugs. The Act prevents substandard drugs. Sale of spurious cosmetic is illegal. Sale of a spurious cosmetic is illegal. Misbranded drugs may mislead patients. Misbranded drugs may mislead patients. Cosmetics Act covers beauty products. Okay, cosmetics, beauty products. Offenses under the Act are criminal. The Act aims to protect public health. A spurious drug may have wrong manufacturer name. Adulteration can occur during manufacture, storage, and or transport. All of the above. In three conditions, adulteration can occur in manufacturing, in storage, and in transport conditions. Misbranding mainly concerns label and claims. Misbranding mainly concerns label and claims. Import of spurious drug is prohibited. Cosmetics containing harmful dye are adulterated. Cosmetics containing harmful dye are adulterated. Drug quality is ensured by standard compliance. Which chapter deals with import of drugs? Chapter 2. Chapter 2 deals with the import of drugs. Prosecution under the Act requires sanction of authority. Prosecution under the Act requires sanction of authority. Cosmetic imitation of a famous brand is spurious. Cosmetic imitation of a famous brand is a spurious. Drugs and Cosmetic Act primarily safeguards patient safety and public health. Drugs and Cosmetic Acts primarily safeguards patient safety and public health. So these are the 100 questions on a Drug and Cosmetics Act 1940, in which we see some definitions: adulterated drugs, misbranded drugs, and spurious drugs. Let's see one recap. Drug and Cosmetic Act primarily safeguards patient safety and public health. Cosmetic imitation of a famous brand is a spurious. Prosecution under the Act requires sanction of authority. Uh, Chapter 2 deals with the import of drugs. Drug quality is ensured by standard compliance. Cosmetic containing harmful dye are adulterated. Import of spurious drug is prohibited. Misbranding mainly concerns label and claims. Adulteration can occur during manufacture, storage, and transport. A spurious drug may have wrong manufacturer name. The Act aims to protect public health. Offenses under the Act are criminal. Cosmetic Act covers medical beauty products. Misbranded drug may mislead patients. Sale of a spurious cosmetic is illegal. Okay. The act prevents substandard drugs. DCC meetings aim to coordinate enforcement. DTAB members include experts from a medical and a pharmaceutical field. Cosmetic safety is assessed by regulatory authority. Label claim must be truthful. Spurious drugs are often counterfeit. Legal definition of cosmetic is given under section 3rd. Which section defines drug and cosmetics are the section 3rd. Spurious drug offense is a serious offense. Adulterated cosmetics may cause harm to users. Misbranded cosmetic may cause confusion to customer. Schedule E relates to poisonous substances. Standard of drugs under mention in Schedule B. Drug sample must be sealed in a sealed container. A government analyst is appointed by a central or state government. The term misbranded applies to both drug and cosmetics. Spurious cosmetic are those imitating popular brands. Drug inspector works under licensing authority. The act ensures safety, efficacy, and quality. PCI is not a statutory body, but DTAB, DCC, and CDSO are the statutory body. Repeat offense attracts enhanced punishment. Okay. Penalty provisions are given under Chapter 7. Penalty given under Chapter 7. Cosmetic includes article intended to be applied to a human body. The act extends to whole of India. Spurious drug involves false identity. Adulteration involves contamination. And misbranding does not include contamination, but misbranding includes false label, wrong claim, and misleading design. Example of a medical device include syringes. Medical devices are notified as a drugs. Spurious drug may be punished with life imprisonment. Analyst report is considered evidence. Sampling procedure is given under section 23rd. Sampling procedure is given under section 23rd. Legal proceedings under the act are initiated by drug inspector. Sale of misbranded cosmetics are prohibited. Manufacture and sale of a drug is regulated under Chapter 4. Import Chapter 2 and manufacture and sale Chapter 4. It's double. Okay. Drug Act applies to drug and cosmetics. Informants at a state level is by state drug controller. Which body advises on a technical matters of a drug? DTAP. Wrong manufacturer name leads to spurious drug. Absence of active ingredients make a drug spurious. Use of filthy container causes drug to be adulterated. False therapeutic claim makes a drug misbranded. Schedule relating to standard of a cosmetic is a S. Central Drugs Laboratory is located at Kolkata. Government analyst submits report in a section 13, and sample analysis is done by government analyst. Powers of a drug inspector includes search and seizure. Drug inspector is appointed under section 21. So guys, next parts of a Drugs and Cosmetic Act 1940 and rules 1945. So in which we see some MCQs on the basis of government analyst, his duties and procedures, drug inspector, duties, powers and procedures, import, manufacture, sale and distribution of drugs, and good manufacturing practices and good laboratory practices. Let's start. Government analyst is appointed under section 20 and drug inspector is appointed under section 21. Government analyst is appointed by central or state government. Government analyst is appointed by central or state government. Main duty of a government analyst is to analyze drug samples, Government analyst submits analysis reports in form number 13. Okay, remember, government analyst submits analysis report in a form 13. Report of government analyst is considered as a evidence. Government analyst must send report within reasonable time. Government analyst must send a report within reasonable time. Central Drug Laboratory is located in Kolkata. Appeal against government analyst report is made to Central Drug Laboratory. Appeal against government analyst Appeal against government analyst report is made to Central Drug Laboratory. Sample for analysis is received from drug inspector. Sample for analysis is received from drug inspector. Government analyst must maintain confidentiality. Government analyst must maintain confidentiality. Drug inspector is appointed under section 21 and government analyst appointed under section 20. Drug inspector is appointed by central sorry drug inspector is appointed by state government or central government also. Minimum qualification for drug inspector includes a degree in pharmacy or pharmaceutical sciences. Main duty of a drug inspector is to enforce drugs and cosmetic acts. Drug inspector can inspect pharmacies and factories. Okay. Drug inspector can inspect pharmacies and factories. Drug inspector has power to search and seize of drugs. Drug inspector can take samples under section 23. Drug inspector can take samples under section 23. Procedure for taking sample is given in section 23. Drug inspector must issue receipt after taking sample in form 11. Drug inspector must issue receipt after taking sample in a form 11. Drug inspector sends samples to government analyst. Drug inspector maintains diary in official diary. Drug inspector maintains a diary in an official diary. Drug inspector must produce identity card during inspection. Drug inspector cannot try offenders. Drug inspector cannot try offenders. Import of drugs is regulated under section 2 मतलब chapter 2. Import of drugs. Okay. Import of drug is regulated under chapter 2. Import of drug requires license in section मतलब form 10. Import of drugs require license in form 10. Import license for drug is issued by Central Licensing Authority CLA. Import license for drug is issued by Central Licensing Authority. Import of spurious drug is prohibited. Manufacture of drug is regulated under Chapter 4. Manufacture and sale under the Chapter 4 and import Chapter 2. Manufacturing license for drug is issued in Form 24. Manufacturing license for drugs is issued in a Form 24. Manufacturing license is issued by State Licensing Authority. Sale of drug is regulated under Chapter 4. Manufacture and sale both are regulated under Chapter 4 but import under Chapter 2. A retail sale license is issued in Form 20 and 21. Okay. And for wholesale, Form 20B and 21B. And for retailer, Form 20 and 21. Wholesale sale license is issued in Form 20B and 21B. Sale of misbranded drug is prohibited. Sale of misbranded drugs is prohibited. Distribution of drug must ensure availability and safety. Distribution of drugs must ensure availability and safety. GMP stands for Good Manufacturing Practice. GMP stands for Good Manufacturing Practice. GMP guidelines are given in Schedule M.
GMP ensures consistent product quality. GMP ensures consistent product quality. GMP covers personal, premises, and equipment guidelines, all of the above. Validation is a part of a GMP. Documentation is important in GMP to ensure traceability. SOP stands for Standard Operating Procedures. GLP stands for Good Laboratory Practices. GLP stands for Good Laboratory Practices. GLP ensures laboratory safety and data integrity. GLP ensures laboratory safety and data integrity. GLP applies mainly to quality control laboratories. GLP applies to mainly quality control laboratories. GLP focuses on personal training, equipment calibration, and documentation, all of the above. GLP focuses on all factors like personal training, equipment calibration, and documentation. GMP does not include advertisement, but GMP include premises, quality control, and hygiene. Self inspection is required under good manufacturing practices. Self inspection is required under good manufacturing practices. Batch manufacturing record is a part of a good manufacturing practices. Batch manufacturing record is a part of a good manufacturing practice. Quality control department is responsible for testing and release. Change control is a concept of a good manufacturing practices. Change control is a concept of a good manufacturing practices. Calibration ensures accurate measurements. Calibration ensures accurate measurements. Validation ensures process consistency. Validation ensures process consistency. GMP training should be given to all personnel like managers, operators, and inspectors. All of the above. GMP training should be given to all personnel. GLP documentation includes raw data, test reports, and SOPs. All data contained in a GLP documentation. Quality assurance ensures compliance with standards. Quality assurance ensures compliance with standards. Cross contamination is prevented by proper segregation. Cross contamination is prevented by proper segregation. GMP is legally enforceable under Schedule M. Okay. GLP is applicable to research labs, quality control labs, and testing labs. Good laboratory practice is applicable to all types of labs like research labs, QC labs, or testing labs, all of the above. Drug inspector checks compliance of a good laboratory practices, good manufacturing practices, or GDP. Okay, all of the above. Inspection report is submitted to licensing authority. Inspection report is submitted to licensing authority. Manufacturing without license is prohibited. Manufacturing without license is prohibited. Sale without license is illegal. Sale without license is illegal. Import of drug requires compliance with import rules. Import of drugs require compliance with GLP means import rules. GMP ensures product quality by process control. GMP ensures product quality by process control. GLP ensures reliability of test results. GLP ensures reliability of test results. Drug inspector can prosecute with permission of a licensing authority. A drug inspector can prosecute with permission of a licensing authority. Sampling procedure ensures fairness, legal validity, and accuracy. Sampling procedure ensures all of the above like fairness, legal validity, and accuracy. Import license is cancelled by central authority. Import license is cancelled by central authority.
GMP compliance is mandatory for manufacturers because good manufacturing practice. So license should be a compliance is mandatory for manufacturers. GLP non-compliance leads to invalid results. Okay. Drug inspector must follow prescribed procedures. Drug inspector must follow prescribed procedures. GMP helps in product recall prevention. GMP helps in product recall prevention. GLP helps in regulatory submission. Good laboratory practices helps in a regulatory submission. Inspection frequency depends on risk and compliance history. Inspection frequency depends on a risk and compliance history. Drug inspector records seizure in Form 17. Drug inspector records seizure in Form 17. Manufacturing premises must be clean and hygienic. Manufacturing premises must be clean and hygienic. GLP requires archiving of data for long term. Good laboratory practices requires archiving of data for long term. GMP applies from raw material to finished products. Good manufacturing practices applies from a raw material to finished products. Drug inspector ensures drugs are safe and standard. Drug inspector ensures drugs are safe and standard. Import of drugs without license is prohibited. GMP includes pest control to prevent contamination. GLP ensures study reproducibility by standardized procedures. Good laboratory practices ensures study reproducibility by standardized procedures. Drug inspector reports non-compliance to licensing authority. Drug inspector reports non-compliance to licensing authority. Manufacturing record helps in traceability. Manufacturing records help in traceability. GLP quality assurance unit is mandatory. GLP quality assurance unit is a mandatory. GMP audits are conducted to improve compliance. Good manufacturing practices audits are conducted to improve compliance. Drug inspectors' duty include educating license holders. Drug inspector duty includes educating license holders. Import, manufacturer, and sale aim to ensure public health protection. GMP non-compliance may lead to license suspension. GMP non-compliance may lead to license suspension. GLP ensures credibility of laboratory data. GLP ensures credibility of laboratory data. Drug inspector can seize records related to drug manufacture and sale. Import of drug must comply with Indian standards. Import of drugs must comply with the Indian standards. Good manufacturing practice documentation must be accurate and updated. Good manufacturing practices documentation must be accurate and updated. Good laboratory practices raw data must be traceable. Good laboratory practices raw data must be traceable. Drug inspector cannot prosecute without sanction. Drug inspector cannot prosecute without sanction. GMP ensures batch to batch consistency. Good laboratory practices supports regulatory approved by reliable data. GLP supports regulatory approval by reliable data. Import, manufacture, and sale provisions ensure drug safety. Overall objective of good manufacturing practices and good laboratory practices is quality, safety, and reliability. So let's one another recap. GLP supports regulatory approval by reliable data. GMP ensures batch to batch consistency. Drug inspector cannot prosecute without sanction. GLP raw data must be traceable. GMP documentation must be accurate and updated. Import of drugs must comply with foreign Indian standards. Drug inspector can seize records related to drug manufacture and sale. GLP ensures credibility of a laboratory data. GMP non-compliance may lead to license suspension. Import, manufacture, and sale aim to ensure public health protection. Drug inspectors' duty include educating license holders. GMP audits are conducted to improve compliance. GLP quality assurance unit is a mandatory. Manufacturing records help in a traceability. Drug inspector reports non-compliance to licensing authority. GLP ensures study reproducibility by standardized procedures. GMP includes pest control to prevent contamination. So guys, our next topic is schedules under drug and cosmetic rules 1945. Cosmetic rules 2022 मतलब 2020 new rules and medical devices rules 2017. So let's start. Schedule A of drugs and cosmetic rules contains forms. Schedule B deals with the fees for test and analysis. Schedule C relates to biological products. Schedule C1 includes vaccines and sera. Schedule D relates to import of drugs is exempted. Okay. Schedule D relates to import of drugs is exempted schedule acts. Schedule E contains list of poisonous substances. Schedule F deals with biological products standards. Okay. Schedule G drug carry label warning to a Schedule G taken under supervision. Okay, medical supervisors. Schedule H drugs are sold with prescription only. Schedule H drugs are sold with prescription only. Schedule H1 was introduced to control antibiotics abuse. Schedule H1 was introduced to control antibiotics abuse. Schedule X drug require duplicate prescription. Schedule J contains disease for which drug should not claim to cure. Schedule K relates to exempted drugs, okay, for import. Exempted drugs. Schedule L refers to laboratory standards. Schedule L refers to laboratory standards. Schedule M contains good manufacturing requirements. Schedule M contains good manufacturing requirements. Schedule M1 is applicable to homeopathic medicines. Schedule M2 for cosmetics and Schedule M3 for medical devices. Okay. M1 for homeopathic medicines. Schedule N deals with retail pharmacy requirements. मतलब कि हॉस्पिटल जो फार्मासिस्ट आपका जो मेडिकल स्टोर होता है उसमें मिनिमम क्या रिक्वायरमेंट्स होनी चाहिए जो कि शेड्यूल एन में दिया जाता है. शेड्यूल ओ कंटेंस डिसइंफेक्टेंट्स. यहाँ पर स्टेरिलाइजेशन मेथड्स हुआ है बट उसका आंसर डिसइंफेक्टेंट्स होता है. ओके. शेड्यूल पी स्पेसिफाइज शेल्फ लाइफ ऑफ ड्रग्स एंड P1 पैक साइज ऑफ ड्रग्स. पी क्या होता है नॉर्मली पी शेल्फ लाइफ ऑफ ड्रग्स. शेड्यूल क्यू कंटेंस कलर परमिटेड इन कॉस्मेटिक्स. ओके याद रखना. शेड्यूल क्यू कंटेंस कलर्स परमिटेड इन कॉस्मेटिक्स. शेड्यूल आर रिलेट्स टू स्टैंडर्ड्स फॉर कॉस्मेटिक्स नहीं होता जो कि कॉन्ट्रासेप्टिव होता है. ओके. स्टैंडर्ड्स फॉर कॉन्ट्रासेप्टिव्स जो कि आते हैं आर में हमारे. स्टैंडर्ड फॉर कॉस्मेटिक ने कॉन्ट्रासेप्टिव्स. शेड्यूल एस कंटेंस मेडिकल डिवाइसेस लिस्ट नहीं. शेड्यूल एस कंटेंस कॉस्मेटिक्स सो उसका ऑप्शन होगा एस. शेड्यूल टी इज रिलेटेड टू आयुष गुड मैन्युफैक्चरिंग प्रैक्टिसेस. शेड्यूल यू मेंटेन records to be maintained. Schedule U contains records to be maintained. Schedule V specifies patent medicines. ओके. प्रिस्क्रिप्शन ड्रग्स हमारे आते हैं शेड्यूल एच में और नार्कोटिक ड्रग्स आते हैं हमारे शेड्यूल एक्स में और कॉस्मेटिक्स शेड्यूल एस. कॉस्मेटिक रूल्स वेर नोटिफाइड इन द ईयर लेटेस्ट कौन से ईयर में आए हैं? 2020 में आए थे। कॉस्मेटिक रूल्स 2020 आर एप्लीकेबल टू कॉस्मेटिक्स। Licensing authority for cosmetic manufacturer is state licensing authority. Licensing authority for cosmetics manufacturer is a state licensing authority. Import of cosmetic requires license in cosmetic 3 form cos 3. Okay, याद रखना, import of cosmetic require license in form cos 3rd. Manufacturing license for cosmetic is issued in cos 2 form cos 2. Manufacturing license for cosmetics is issued in a form cos 2. Cosmetic registration is granted by a central government, a central authority. Cosmetic registration is granted by central authority. Cosmetics labeling must include batch number, expiry date, or manufacturer name, all of the above. Cosmetic labeling must include all like batch number, expiry date, or manufacturer name. Cosmetic rule aims to ensure safety and quality. Animal testing for cosmetic in India is prohibited. Cosmetic adverse event reporting is mandatory. Cosmetic adverse event reporting is mandatory. Misbranded cosmetics are those with false or a misleading label are called misbranded cosmetics. Adulterated cosmetics contain harmful substances. Adulterated cosmetics contain harmful substances. Spurious cosmetics imitate popular brands. Spurious cosmetics imitate popular brands. Medical devices rules were notified in 2017. Medical devices rule apply to medical devices. Medical devices are regulated as a drugs. Risk-based classification of medical devices includes class A, B, C, and D. Class A higher risk, B means class A lower risk, B lower to moderate, C moderate to higher, and D for a higher risk. Okay. Class A medical devices are low risk. Class D medical devices are higher risk. Licensing authority for class 1A devices is a state licensing authority. Licensing authority for class C devices is a central authority. Import license for medical devices is granted by CDSO, मतलब central authority, Central Drug Standard Control Organization. Import license for medical devices is granted by central authority. Medical device manufacturer requires manufacturing license. Medical device manufacturer requires manufacturing license. Quality management system for devices is based on ISO 13485. Okay. QMS for medical devices is based on ISO 13485. Clinical investigation of a medical devices is governed by medical devices rules. Post marketing surveillance of devices is a mandatory. Material vigilance deals with a medical devices. Material vigilance deals with the medical devices. Adverse events of a devices must be reported to CDSO. Okay. Adverse events of devices must be reported to CDSO. Medical device labeling must include device name, manufacturer details, and their use. All of the above content medical device labeling. Import of unsafe medical devices is a prohibited. Import of unsafe medical devices is a prohibited. Schedule E under devices rules refer to risk classification. Okay. Schedule E under devices rules refers to risk classification. Schedule F under devices rules deals with a quality management system. E for risk assessment, F for quality management system, QMS. Shelf life of medical device is determined by manufacturer. Shelf life of a medical device is determined by manufacturer. Sale of medical devices without license is illegal. Okay. Cosmetic manufacturing premises must follow good manufacturing practices. Cosmetic manufacturing premises must follow good manufacturing practices. Cosmetic import without registration is a prohibited. Cosmetic import without registration is a prohibited. Medical device recall is initiated by manufacturer. Medical device recall is initiated by manufacturer. Schedule Y mainly relates to clinical trials. Schedule Y mainly relates to clinical trials. Cosmetic shelf life is indicated by expiry date, manufacturing date, or use before, all of the above. So, cosmetics shelf life is indicated all. Schedule are a part of a act, rule, constitution, or IPC. So, schedule are a part of a rules. Schedules are a part of a rules. Medical device adverse reporting system is called material vigilance. Okay. Medical device adverse reporting system is called material vigilance. Cosmetics adverse reporting system is called cosmetovigilance. CDSO regulates drug, cosmetics and devices all. CDSO regulates drugs, cosmetic and devices. Schedule M compliance is mandatory for manufacturers. Device clinical investigation approval is granted by central authority. A device clinical investigation approval is granted by central authority. A cosmetic testing laboratory must follow good laboratory practices. Cosmetic testing laboratory must follow good laboratory practices. Medical device distributor must be licensed. Medical device distributor must be licensed. Schedule H1 drugs require record maintenance for 3 years. Prescription drugs maintain record for 3 years. Schedule H1 drugs require record maintenance for 3 years. Cosmetic import license validity is 5 years. Cosmetic import license validity is a 5 years. Medical device manufacturing site inspection is done by a drug inspector or a CDC officer, any one of check inspect medical device manufacturing. Schedule K exempts drugs from a license. Schedule K exempts drugs from a license. Schedule Q restricts color in a cosmetics. Schedule Q restricts color in a cosmetics. Cosmetic rule emphasizes consumer safety. Okay. Medical device rules emphasize risk-based regulation. Medical devices rules emphasize risk-based regulation. Class B medical devices are moderate risk. Okay. Low to moderate risk. मतलब moderate risk. Schedule U maintenance records are kept by a manufacturer. Schedule U maintenance records are kept by a manufacturer. Cosmetic label must not contain misleading claims, but label must be contain batch number, ingredients or manufacturer details, but not any misleading data. Medical device shelf life must be supported by stability data. Medical device shelf life must be supported by stability data. Device vigilance ensures safety of users. Device vigilance ensures safety of users. Cosmetic rules replace old cosmetic provisions. Cosmetics rule replace old cosmetic provisions. Schedule S list is related to cosmetics. Sorry, not a medical device. It's for a cosmetic. Class A devices require state license. Cosmetic manufacturing without license is prohibited. Medical device importer must comply with the Indian standards. Okay, and if a exporter must comply with the foreign standards. Schedule T applies to Ayush medicines. Okay, Schedule T applies to Ayush medicines. Cosmetic quality is ensured by good manufacturing practices. Medical device labeling symbol requirements are prescribed under schedule. Medical device labeling symbol requirements are prescribed under schedules. Sale of spurious cosmetic is illegal. Sale of a spurious cosmetic is illegal. Schedule J prevents false therapeutic claims. Device clinical data is evaluated by CDSO.
Device clinical data is evaluated by CDSO. Cosmetic ingredients restriction is given in a Schedule Q. Okay. Coulter colors. Cosmetic ingredients restriction is given in a Schedule Q. Medical device recall classification is based on a risk. Medical device recall classification is based on a risk. Schedule provides technical details. Schedules provide technical details. Cosmetic Rules 2022 promote safety, quality, and transparency. Okay. Cosmetic Rules 2020 promotes safety, quality, and transparency. Overall aim of a schedules, cosmetic, and device rules is public health protection. Okay, these are the rule. Let's see once again. Quick recap. Cosmetic rules 2020 promote safety, quality, and transparency. Schedule provide technical details. Medical device recall classification is based on a risk. Cosmetic ingredient restriction is given in a Schedule Q. Device clinical data is evaluated by CDSO. Schedule J prevents false therapeutic claims. Sale of a spurious cosmetic is illegal. Medical device labeling symbol requirement are prescribed under schedule. Cosmetic quality is ensured by a good manufacturing practices. Schedule T applies to Ayush medicines. Medical device importer must comply with the Indian standards. Cosmetic manufacturing without license is a prohibited. Class A devices require state license. Schedule S list is related to cosmetics. Cosmetic rules replace old cosmetic provisions. Device vigilance ensures safety of users. A medical device shelf life must be supported by a stability data. A cosmetic label must not contain any misleading claims. Schedule U maintenance records are kept by a manufacturer. Class B medical devices are a moderate risk. Medical devices rules emphasize risk-based regulation. Cosmetic rule emphasize consumer safety. Schedule Q restricts color in a cosmetics. Schedule K exempts drugs from a license. Okay. D and K. Medical device manufacturing site inspection is done by a drug inspector and a CDSO officer, or cosmetic import license validity is of 5 years. Schedule H1 drug requires record maintenance for 3 years. Medical device distributor must be a license. Cosmetic testing laboratory must follow good manufacturing practices. Good laboratory practices. Device clinical investigation approval is granted by central government, not state. Schedule M compliance is mandatory for manufacturers.
So guys, in this video we see Drug and Magic Remedies Objectionable Advertisement Act 1954 and rules, Narcotic Drug and Psychotropic Substances NDPX Act 1985, Essential Narcotic Drugs, Register Medical Institution RMI, and Narcotic Drugs Psychotropic Substances rules with Maharashtra focus. Okay, so let's start. Drug and Magic Remedies Act was enacted in the year 1954. याद रखना, DMR 1954. Main objective of Drug and Magic Remedies Act is to prohibit misleading advertisements. The act applies to drug and magic remedies both. मतलब जो हम बोलते हैं तंत्र मंत्र जादू टोना, ओके, कि इससे आप ठीक हो जाओगे, इससे वो हो जाएगा, उसको प्रिवेंट करने के लिए हम इस एक्ट को लाया गया है 1954 में. मैजिक रेमेडी रेफर्स टू ट्रीटमेंट क्लेमिंग मिरेक्युलस क्योर, मतलब जादू, ओके, मिरेक्युलस हो जाएगा ये मेडिसिन खाने से, बट ऐसा कुछ नहीं होता. उसको प्रिवेंट करने के लिए हम इस एक्ट को यूज़ करते हैं. मैजिक रेमेडी रेफर्स टू ट्रीटमेंट क्लेमिंग मिरेक्युलस क्योर. एडवर्टाइजमेंट अंडर द एक्ट इंक्लूड्स न्यूज़पेपर नोटिस, सर्कुलर और लेबर, किसी भी तरह से एडवर्टाइज देते हैं इसमें. द एक्ट प्रोहिबिट्स एडवर्टाइजमेंट रिलेटेड टू सर्टन शेड्यूल डिसीजेस, ओके, कुछ सेक्सुअल डिसऑर्डर्स हो गए, ओके, कि आप इससे ये हो जाएगा, कुछ क्रोनिक डिसीज हो गए, इससे ठीक हो जाएंगे, उसको हम प्रिवेंट्स करेंगे उस एडवर्टाइजमेंट को. Schedule under Drug and Magic Remedies Act list disease for which advertisement is prohibited. मतलब इस शेड्यूल में ऐसा दिया है कि ऐसे कुछ लिस्ट दी है डिसीजेस की जो कि ड्रग से ट्रीटमेंट नहीं हो सकती उनकी. ओके. क्लेमिंग क्योर फॉर कैंसर इन एडवर्टाइजमेंट इज प्रोहिबिटेड. Claiming cure for cancer in an advertisement is prohibited. Advertisements promoting abortion are illegal. Enforcement authority under Drug and Magic Remedies Act is Drug Inspector. Informants authority under Drug and Magic Remedies Act is a Drug Inspector. Penalty for first offense include imprisonment or fine. Repeat offense attracts enhanced punishment. मतलब आपकी सजा बढ़ सकती है. द एक्ट एक्सटेंड्स टू होल ऑफ इंडिया. ये एक्ट पूरे इंडिया के लिए लागू हुआ है. मिसलीडिंग एडवर्टाइजमेंट अफेक्ट्स पब्लिक हेल्थ. ड्रग एंड मैजिक रेमेडीज एक्ट एम्स टू प्रोटेक्ट कंज्यूमर्स. जो उसका कंज्यूम करेंगे मेडिसिन को, उनको प्रिवेंट करने के लिए इस ड्रग को एक्ट को लाया गया है. एनडीपीएस नार्कोटिक ड्रग एंड साइकोट्रोपिक सब्सटेंसेस एक्ट वॉज इनेक्टेड इन द ईयर 1985. और 1954 में क्या आया था? ड्रग एंड मैजिक रेमेडीज एक्ट. नार्कोटिक ड्रग एंड साइकोट्रोपिक सब्सटेंसेस एक्ट कंट्रोल्स नार्कोटिक ड्रग एंड साइकोट्रोपिक सब्सटेंसेस. मेन ऑब्जेक्टिव ऑफ एनडीपीएस एक्ट इज टू रेगुलेट एंड कंट्रोल अब्यूज ऑफ नार्कोटिक ड्रग्स. एडिक्शन के लिए यूज़ किए जाते हैं इस ड्रग्स को, उनको प्रिवेंट करने के लिए, अब्यूज़ को प्रिवेंट करने के लिए हम इस ड्रग एक्ट को लाया गया है. नार्कोटिक ड्रग इंक्लूड्स कैनाबिस, गांजा बोलते हैं उसको, ओपियम, अफीम, कोका, ये सभी ड्रग्स आते हैं हमारे नार्कोटिक ड्रग्स में. ओके, ऑल ऑफ दी अबव. साइकोट्रोपिक सब्सटेंसेस अफेक्ट ब्रेन एंड माइंड, लाइक हेलुसिनेशन कॉज होता है. एनडीपीएस एक्ट अप्लाइज टू होल ऑफ इंडिया, नॉट ड्रग, होल ऑफ इंडिया. Essential narcotic drugs are defined under NDPS Act. Essential narcotic drugs are defined under Narcotic Drug Psychotropic Substances Act. Essential narcotic drugs are mainly used for pain management and medical use. Mainly मेजर सर्जरी, मेजर पेन हो रहा होगा, मेनली आर्मी में मॉर्फिन का यूज़ किया जाता है, इंजेक्शंस का. सो वो क्या है? इसेंशियल नार्कोटिक ड्रग्स है. बट क्यों यूज़ किए जाते हैं? मेडिकल यूज़ के लिए. एक कोई एक्सीडेंट हुआ है इमरजेंसी में. ओके. एग्जाम्पल्स ऑफ इसेंशियल नार्कोटिक ड्रग इंक्लूड मॉर्फिन. अभी मैंने आपको बताया था कि मॉर्फिन. मैन्युफैक्चरर ऑफ इसेंशियल नार्कोटिक ड्रग रिक्वायर्स स्पेशल ऑथराइजेशन, जो कि सेंट्रल गवर्नमेंट ही देती है, वही उसको मैन्युफैक्चर कर सकते हैं उस ड्रग्स को. पोजेशन ऑफ नार्कोटिक ड्रग्स विदाउट ऑथराइजेशन इज प्रोहिबिटेड. NDPS Act prescribes punishment based on a quantity. Small quantity under Narcotic Drug and Psychotropic Substances Act attracts lesser punishment. Commercial quantity attracts severe punishment. Commercial quantity attracts severe punishment. NDPS offenses are criminal. It's a criminal law. Criminal है एक प्रकार के acts. NDPS Act provides punishment of a बोथ इम्प्रिजनमेंट एंड फाइन. मतलब आपको जुर्माना भी हो सकता है, जेल भी हो सकती है. सर्च एंड सीजर अंडर एनडीपीएस एक्ट मस्ट फॉलो प्रिस्क्राइब प्रोसीजर. ओके. अरेस्ट अंडर एनडीपीएस एक्ट कैन बी मेड बाय ऑथोराइज ऑफिसर. मेनली तो ड्रग इंस्पेक्टर ही होते हैं और नार्कोटिक ऑफिसर्स. एनडीपीएस एक्ट इज कंसिडर्ड स्ट्रिंजेंट बिकॉज ऑफ हार्श पनिशमेंट. NDPS Act is considered stringent because of harsh punishment. A bail under NDPS Act is very strict. Bail under NDPS Act is very strict. NDPS rules were notified in 1986. एक्ट कब आया था NDPS का? जो कि आया था 1985 में. और रूल्स कब आए? 1986 में. NDPS रूल्स रेगुलेट मैन्युफैक्चर एंड पोजीशन, इम्पोर्ट एंड एक्सपोर्ट एंड ट्रांसपोर्ट. ये सभी आते हैं हमारे एनडीपीएस रूल्स के अंदर में. RMI स्टैंड्स फॉर रजिस्टर मेडिकल इंस्टीट्यूशन. ओके, जो कि कॉलेज होते हैं, इंस्टीट्यूशंस होते हैं, ना कि रजिस्टर मेडिकल इन्वेस्टिगेटर, इंस्पेक्टर ऐसा कुछ नहीं होता, जो कि इंस्टीट्यूशन होते हैं. रजिस्टर मेडिकल इंस्टीट्यूशन. रजिस्टर मेडिकल इंस्टीट्यूशन इज ऑथोराइज टू possess and dispense essential narcotic drugs. RMI registration is granted by a state authority. हर एक स्टेट की अलग अलग अथॉरिटी होती है। रजिस्टर मेडिकल इंस्टीट्यूशन, RMI must maintain records of essential narcotic drugs. Essential narcotic drug records must be preserved for 3 years, like cosmetic की तरह ही। Essential narcotic drugs records must be preserved for 3 years. NDPS Act empowers government to control cultivation, control manufacture, and control sale, all of the above. NDPS Act empowers government to control cultivation, control manufacture, control sale. Cultivation of opium poppy is allowed only with government license. Cannabis includes charas, ganja, hashish oil, all of the above. So charas cannabis contains all charas, ganja, hashish oil. Okay. Medical use of a narcotic drug is allowed under control. टोटली बैन नहीं है, इलीगल भी नहीं है, ऑप्शनल भी नहीं है, बट कभी कभी कुछ इमरजेंसी कंडीशंस होती है, वहाँ पर नार्कोटिक ड्रग्स का यूज़ किया जाता है, मेनली आर्मी में। ओके। NDPS एक्ट इंश्योर्स बैलेंस बिटवीन मेडिकल नीड एंड अब्यूज प्रिवेंशन. Storage of essential narcotic drug requires lock and key. Transport of narcotic drug requires authorization. Transport of a narcotic drug requires authorization. Maharashtra narcotic drug and psychotropic substances rules are framed by state government. Maharashtra NDPS rules apply to Maharashtra state. State drug control enforces NDPS rules at a state level. State का state की तरह ही होगा. Essential narcotic drugs are notified by central government. Essential narcotic drugs are notified by central government. NDPS Act repealed ओपीएम एक्ट एंड डेंजरस ड्रग्स एक्ट. ओके. ओपीएम एक्ट 1857 में आया था, डेंजरस एक्ट 1930 में आया था. नार्कोटिक ड्रग सब्सटेंस उसका प्रीवर्जन है, लाइक रिपील. ओके. 1985. कॉन्फिस्केशन ऑफ अ नार्कोटिक ड्रग इज डन बाय कोर्ट. कॉन्फिस्केशन ऑफ अ नार्कोटिक ड्रग इज डन बाय कोर्ट. NDPS Act prescribes minimum punishment to reduce abuse. NDPS Act prescribes minimum punishment to reduce abuse. Destruction of seized narcotic drug is done as per prescribed procedure. Essential narcotic drugs are exempted from certain restrictions for medical use. NDPS Act discourages drug abuse and trafficking. NDPS Act discourages drug abuse and trafficking. A registered medical institution can dispense narcotic drugs on a valid prescription. Prescription for essential narcotic drugs must be written. Okay. Prescription for essential narcotic drug must be written. NDPS offenses are non-compoundable. NDPS offenses are non-compoundable. Advertisement of a narcotic drug is restricted or prohibited. Okay. Advertisement of a narcotic drug is prohibited. Drug and Magic Remedies Act prevents false hope to a patients. Magic remedies often exploit patients' emotions. Magic remedies often exploit patients' emotions. NDPS Act authorizes search without warrant in certain situations. Essential narcotic drugs are supplied to registered medical institutions and hospitals. Essential narcotic drugs. NDPS Act aims to comply with international conventions. NDPS Act aims to comply with international conventions. Maharashtra NDPS rules supplement central NDPS rules. Okay. Maharashtra NDPS rules supplement central NDPS rules. Records under NDPS rules must be accurate and updated. NDPS Act applies to all of the above, like land, sea, airspace, everywhere. Storage place for narcotics should be secure. Storage place for narcotics should be secure. A disposal of expired narcotic drug requires authorization. Disposal of expired narcotic drugs requires authorization. Drug and Magic Remedies Act covers oral advertisements, visual advertisements, or audio advertisements. All of the advertisements covers under Drug and Magic Remedies Act. The NDPS Act is administered by Ministry of Finance. not health, not social justice, finance. NDPS Act is administered by Ministry of Finance. Essential narcotic drug improve palliative care. Essential narcotic drug improve palliative care. Unauthorized possession of a narcotics leads to punishment. NDPS Act allows treatment of addicts through de-addiction programs. Drug and Magic Remedies Act advertisements are regulated in public interest. Drug and Magic Remedies Act advertisements are regulated in a public interest. NDPS Act balances control with the medical use. RMI registration can be cancelled for violation of rules. अगर रूल्स का आपने उल्लंघन किया है तो उसका लाइसेंस कैंसिल भी हो सकता है. एनडीपीएस एक्ट डिस्करेजेस इलीगल ट्रैफिकिंग. NDPS Act discourages illegal trafficking. Essential narcotic drugs are supplied under strict control. Essential narcotic drugs are supplied under strict control. Maharashtra NDPS rules are enforced by State Drug Control Department. Okay. Magic remedies advertisements often claim instant cure. NDPS Act provides immunity to addicts for seeking treatment. Essential narcotic drugs are exempted from a complete prohibition. Essential narcotic drugs are exempted from complete prohibition. NDPS Act applies to citizens only, foreigners in India, Indians abroad. सबके लिए ये एक्ट लागू होता है. NDPS Act applies to all personals like foreign, Indian, citizens, everywhere, anyone's. Drug and Magic Remedies Act ensures consumer awareness, public protection, and ethical advertising, all of the above. Consumer awareness, public protection, ethical advertisements. NDPS Act offences are tried by special court, not any every court, only special courts. Essential narcotic drug helps in severe pain relief. Essential narcotic drugs help in a severe pain relief. NDPS Act encourages law enforcement. NDPS Act encourages law enforcement. Magic Remedies Act prohibits advertisement for diabetes cure claims. Magic Remedies Act prohibits advertisement for diabetes cure claims. NDPS Act classification is based on nature and quantity. Essential narcotic drugs availability is important for palliative care patients. NDPS Act violations attract criminal liability. NDPS Act violations attract criminal liability. Maharashtra NDPS rules support Central Narcotic Drug and Psychotropic Substances Act. Drug and Magic Remedies Act advertisements misleading, must not be misleading. Drug and Magic Remedies Act advertisement must not be misleading. NDPS Act ensures strict control to reduce addiction. NDPS Act ensures strict control to reduce addiction. Overall aim of a Drug and Magic Remedies Act and NDPS Act is public health and safety. Okay, so let's quick recap. NDPS Act ensures strict control to reduce addiction. Drug and Magic Remedies Act advertisement must not be misleading. Maharashtra NDPS rules support Central NDPS Act. NDPS Act violations attract criminal liability. Essential narcotic drugs availability is important for palliative care patients. NDPS Act classification is based on nature and quantity. Magic Remedies Act prohibits advertisement for diabetes cure claims. NDPS Act encourages law enforcement. Essential narcotic drug helps in severe pain relief. NDPS Act offences are tried by special court. Drug and Magic Remedies Act ensures public protection, ethical advertising, or consumer awareness, all of the above. The NDPS Act applies to citizens, foreigners, or Indians abroad. Essential narcotic drugs are exempted from a complete prohibition. Essential narcotic drugs are exempted from complete prohibition. NDPS Act provides immunity to addicts for seeking treatments. Magic remedies advertisements often claim instant cure. Maharashtra NDPS rules are enforced by central authority. Essential narcotic drugs supplied under strict control. NDPS Act discourages illegal trafficking. Okay. RMI registration can be cancelled for violation of rules. So guys, in this video we see Poison Act 1919, Maharashtra Poisons Rules 1970, and Pharmacy Act 1948. Let's start. The Poison Act was enacted in the year 1919. Okay, option A. Main objective of Poison Act 1919 is to regulate possession and sale of a poisons. Objective of Poison Act 1919 is possession and sale of a poisons. Poison Act extends to whole of India. Maharashtra poisons rules were framed in the year 1970. Option B. Maharashtra poisons rules were framed in the year 1970. Licensing authority under Maharashtra poisons rule is state government. Poisons can be sold only by licensed dealers. Poisons can be sold only by licensed dealers. Sale of poisons require maintenance of a poison register. Sale of poisons requires maintenance of a poison register. Poison register must contain name of a poison, क्वांटिटी सोल्ड कितनी सोल्ड की है कितना पॉइजन दिया है और किसने परचेस किया है, ये सभी डॉक्यूमेंट्स मेंशन होने चाहिए पॉइजन रजिस्टर में. पॉइजन शुड बी स्टोर्ड सेपरेटली एंड सिक्योरली. ओके, ओपनली नहीं रखना है, फूड के साथ नहीं रखना है, घर पे नहीं रखना है. बट जो पॉइजन्स होते हैं कुछ इंस्टीट्यूशन, ओके, सेपरेटली एंड सिक्योरली स्टोर करना चाहिए उसे. लेबल ऑन पॉइजन कंटेनर मस्ट इंक्लूड वार्निंग स्टेटमेंट. ओके, आपने बहुत बार देखा होगा कि क्रॉस का साइन होता है, खतरा होता है, वहाँ पर हड्डी होती है ऐसे. ओके, उसको बोलते पॉइजन मतलब खतरा. लेबल ऑन पॉइजन कंटेनर मस्ट इंक्लूड वार्निंग स्टेटमेंट. Maharashtra poisons rule apply within Maharashtra state. Sale of poison to minor is prohibited. Okay. Sale of poison requires purchaser to give written declaration. Okay. क्यों चाहिए, ए भी होना चाहिए वहाँ पर. Inspecting authority under Poisons Act is inspector appointed by state. A violation of Poisons Act attracts penalty or imprisonment. Pharmacy Act was enacted in the year 1948. फार्मेसी एक्ट कब आया था? 1948 में. और ड्रग एंड कॉस्मेटिक्स एक्ट कब आया था? 1940 में. मेन ऑब्जेक्टिव ऑफ फार्मेसी एक्ट 1948 is to regulate pharmacy education and a profession. Pharmacy Act extends to whole of India. Pharmacy Council of India is constituted under Pharmacy Act. PCI किसके अंदर आता है? फार्मेसी एक्ट के अंदर आता है. PCI is constituted under Section 3. PCI is constituted under Section 3. Main function of PCI is to prescribe minimum education standards. Main function of PCI is to prescribe minimum education standards. State Pharmacy Council is constituted under Section 19. PCI किसके अंदर में आता है? Section 3. फार्मेसी काउंसिल ऑफ इंडिया। और जो स्टेट फार्मेसी काउंसिल आती है वो किस में आती है? सेक्शन 19 में। स्टेट फार्मेसी काउंसिल मेंटेन्स रजिस्टर ऑफ अ फार्मासिस्ट। Minimum qualification to registered as a pharmacist is D Pharma. Registration of pharmacist is mandatory for dispensing drugs. Unregistered persons dispensing drug is prohibited. Central register of pharmacist is maintained by state council, PCI. सेंट्रल है ना, स्टेट का रजिस्टर कौन करता है? स्टेट काउंसिल। और सेंट्रल रजिस्टर कौन करेगा? सेंट्रल काउंसिल, मतलब पीसीआई। पीसीआई मेंबर्स आर नॉमिनेटेड बाय सेंट्रल गवर्नमेंट। पीसीआई मेंबर्स आर नॉमिनेटेड बाय सेंट्रल गवर्नमेंट। फार्मेसी एक्ट एम्स टू प्रोटेक्ट पब्लिक हेल्थ। Professional misconduct of pharmacist is dealt by State Pharmacy Council. Okay. Professional misconduct of a pharmacist is dealt by State Pharmacy Council. Poison license validity is usually 3 years. Poison license validity is usually 3 years. Renewal of poison license is granted by state authority. Renewal of poison license is granted by state authority. Sale of poison without license is illegal. Sale of a poison without license is illegal. Pharmacy Act ensures pharmacists are trained and qualified. Pharmacy Act ensures pharmacists are trained and qualified. Removal of pharmacist name from register is called deregistration. Okay. Removal of pharmacist name from register is called deregistration. PCI can approve pharmacy institutions. Education regulations are formed by PCI. Poison register entries must be made immediately after sale. ऐसा नहीं कि वीक के बाद, मंथ के बाद, ईयर लेवल, नहीं। आपने जब सेल किया तभी की एंट्री होनी चाहिए उस पॉइजन रजिस्टर में। किस किसने किसने परचेस किया है, कितनी क्वांटिटी परचेस की है, पॉइजन का नाम, ये सभी तभी मेंटेन करना है। सेल ऑफ पॉइजन रिक्वायर्स विटनेस सिग्नेचर इन poison register. Okay. Pharmacy Act does not regulate drug pricing. Okay. बट फार्मेसी एक्ट क्या क्या रेगुलेट करता है? एजुकेशन, रजिस्ट्रेशन एंड प्रोफेशनल कंडक्ट। बट ड्रग प्राइसिंग कौन डिपेंड करता है? जो कि मैन्युफैक्चरर कंपनीज करती है। महाराष्ट्र पॉइजन रूल्स क्लासीफाई पॉइजन इनटू शेड्यूल 1 and 2. Okay. Maharashtra poisons rule classify poisons into schedule 1 and 2. Possession of poison without license is prohibited. Possession of poison without license is prohibited. Pharmacy Act came into force in 1949. Okay. Pharmacy Act came into force in 1949. सबसे पहले कब आया था? 48 में। उसके बाद कब आया? 49 में। Pharmacist must display registration certificate. Poison container must be colored red or a distinct color. Poison container must be colored red or a distinct color. Pharmacy Act applies to pharmacist only, pharmacy institutions, एजुकेशन एंड प्रोफेशन, सभी के लिए ये एक्ट लागू होता है, फार्मेसी एक्ट। पीसीआई अप्रूवल इज रिक्वायर्ड फॉर फार्मेसी कोर्स। पीसीआई अप्रूवल इज रिक्वायर्ड फॉर फार्मेसी कोर्स। A sale of poison to intoxicated person is prohibited. State Pharmacy Council members include pharmacists, medical practitioners और गवर्नमेंट नॉमिनीज। ये सभी इंक्लूड होते हैं स्टेट फार्मेसी काउंसिल में मेंबर्स में। ओके, फार्मासिस्ट, मेडिकल प्रैक्टिशनर्स और गवर्नमेंट नॉमिनीज। फार्मेसी एक्ट इंश्योर्स ethical practice by code of ethics. A poison license can be cancelled for violation of rules. Central Register of Pharmacists includes name from all states. Central Register of Pharmacists includes names from all states. सभी स्टेट के नेम्स होते हैं उसमें सेंट्रल रजिस्टर में। PCI president is elected from members of council. PCI president is elected from members of a council. Sale of poison require purchaser age to be above 18। मतलब वो माइनर नहीं होना चाहिए। माइनर मतलब क्या, 18 से नीचे। ओके, बट आगे उसके ऊपर जो होगा एज ग्रुप 18 के बाद, वो सब सेल पॉइजन कर सकते हैं, परचेस कर सकते हैं, बट कुछ वैलिड रीज़न होगा तो तभी। फार्मेसी एक्ट प्रिवेंट्स अनक्वालिफाइड प्रैक्टिस। फार्मेसी एक्ट प्रिवेंट्स अनक्वालिफाइड प्रैक्टिस। महाराष्ट्र पॉइजन रूल्स रिक्वायर poison storage under lock and key. Professional misconduct inquiry is conducted by State Pharmacy Council. Professional misconduct inquiry is conducted by State Pharmacy Council. Pharmacy Act defines registered pharmacist as a person registered under Act. Poison license record must be preserved for 3 years. Poison license records must be preserved for 3 years. PCI can withdraw approval of pharmacy institution. PCI can withdraw approval of pharmacy institution. Sale of poison requires purpose of use to be recorded. Pharmacy Act is administered by Ministry of Health. Pharmacy Act is administered by Ministry of Health। और जो नारकोटिक्स का था वो फाइनेंस के अंदर में आता है। इंस्पेक्टर अंडर पॉइजन्स एक्ट कैन सर्च प्रीमाइसेस, सीज पॉइजन्स और इंस्पेक्ट रिकॉर्ड्स। ये सभी काम कर सकता है इंस्पेक्टर अंडर पॉइजन्स एक्ट के थ्रू। PCI advises government on pharmacy education. Maharashtra poisons rules are supplementary to Central Poisons Act. Pharmacy Act protects title of pharmacist. Pharmacist Act protects title of pharmacist. Use of word pharmacist by unregistered person is prohibited. Poison sale without entry in registered is illegal. PCI approval is mandatory before starting pharmacy college. PCI approval is mandatory before starting pharmacy college. State Pharmacy Council is a statutory body. State Pharmacy Council is a statutory body. Poison Act helps in prevention of accidental poisoning. Okay. Poison Act helps in prevention of accidental poisoning. Maharashtra poisons rules emphasize safe handling of poisons. Maharashtra poison rules emphasize safe handling of poisons. PCI inspections relate to pharmacy institutions. PCI institutions relate to inspection relates to pharmacy institutions. Pharmacy Act offenses are criminal. Poison containers must not resemble medicine containers, कॉस्मेटिक कंटेनर्स और फूड कंटेनर्स। उसका अलग ही नाम होगा। पॉइजन कंटेनर में पॉइजन ही नाम लिखा होगा, ना कि मेडिसिन कॉस्मेटिक फूड ऐसा कुछ। फार्मासिस्ट रजिस्ट्रेशन रिन्यूअल इज डन बाय स्टेट फार्मेसी काउंसिल। Maharashtra poisons rule enforcement is done by state authority. Maharashtra poisons rule enforcement is done by state authority. Pharmacy Act promotes professional ethics, competition, advertisement, mainly to professional ethics. Okay. Pharmacy Act promotes professional ethics. A sale of poison require identity of purchaser to be verified. Sale of poison requires identity of purchaser to be verified. Pharmacy Act separates profession from trade only. फार्मेसी एक्ट एजुकेशन होता है इंडस्ट्री इंपोर्ट के लिए, बट ट्रेड के लिए नहीं होता। सो फार्मेसी एक्ट सेपरेट्स प्रोफेशन फ्रॉम ट्रेड ओनली। PCI maintains central registered by compiling state registers. PCI maintains central register by compiling state registers. Poison license is displayed at license premises. Poison license is displayed at license premises. Pharmacy Act prevents misuse of professional title. Pharmacy Act prevents misuse of a professional title. Inspector under Poison Act is appointed by a state government. So guys, our next topic is intellectual property rights. We called as a IPR, Consumer Protection Act, and Right to Information Act, also called as a RTI Act. So let's start. IPR stands for Intellectual Property Rights. Intellectual property refers to creation of human intellect. Which of the following is an IPR? Trademark. Trademark is a IPR, not land, building, machinery. Trademark is a IPR. Patent grants protection for inventions. Patent grants for protection for inventions. Patent protection in India is granted for 20 years. Which act governs patent in India? Patent Act 1970. Copyright protects literacy and artistic works. Copyright protects literary and artistic works. Trademark is used to protect brand identity. Trademark validity is initially for 10 years. Trademark validity is initially for 10 years. Industrial design protects appearance of a product. Trade secret protection depends on confidentiality. Trade secret protection depends on confidentiality. GI tag stands for geographical indication. GI tag stands for geographical indication. Example of a geographical indication is Darjeeling tea. Okay, geographical indication GI tag. Darjeeling tea is an example of a GI tag. IPR encourages innovation. Patent application is filed at a patent office. Patent application is filed at patent office. Consumer Protection Act was enacted in 1986. CPA, Consumer Protection Act, was enacted in 1986. A new Consumer Protection Act came into force in 2020. Okay, 2020, and before that, Consumer Protection Act (CPA) comes in 1986. Consumer Protection Act aims to protect consumers. Consumer means a person who buys goods for personal use. Means last stage of a product. Consumer means a person who buy goods for personal use. Defective good refers to good with manufacturing defects. A deficiency of service means fault or inadequacy in a service, which is not a consumer right. Right to exploitation is not a consumer right. A right to safety, right to be informed, right to seek redressal are the consumer rights. Consumer dispute redressal forum exists at three levels. Consumer dispute redressal forum exists at three levels. A district consumer commission handle cases up to 1 crore. District level up to 1 crore. A national consumer commission is located at Delhi. National Consumer Commission NCC. National Consumer Commission is located at Delhi. Consumer complaint can be filed by consumer, legal hire और consumer association. इन तीनों में से कोई भी कंप्लेंट को फाइल कर सकता है. Misleading advertisement is punishable under Consumer Protection Act. Misleading advertisement is punishable under Consumer Protection Act. Product liability means responsibility for defective product. Product liability means responsibility for defective product. E-commerce is regulated under Consumer Protection Act. E-commerce is regulated under Consumer Protection Act. Consumer Protection Act applies to goods and services. Consumer Protection Act applies to goods and services. Right to Information Act was enacted in 2005. राइट टू इन्फॉर्मेशन एक्ट कब आया था? जो कि आया था 2005 में. RTI Act came into force in 2005. सेम क्वेश्चन हुआ है. इनेक्टेड एंड फोर्स दोनों एक ही साथ आया था 2005. RTI Act provides citizens the right to information. Right to information. RTI Act applies to government bodies. Public Information Officer is responsible for providing information. Public Information Officer PIO. Public Information Officer is responsible for providing information. Time limit to provide RTI information is 30 days. Time limit to provide RTI information is 30 days. Information concerning life or liberty must be given within 24 hours. Information concerning life or liberty must be given within 24 hours. RTI application fee is generally ₹10, 10 रुपये फ़ी होती है RTI फाइल करने के लिए. RTI application fee is generally ₹10. RTI Act promotes transparency. Okay, which information is exempted under Right to Information Act? नेशनल सिक्योरिटी इन्फॉर्मेशन, ये इन्फॉर्मेशन आपको नहीं मिलती. पब्लिक इंटरेस्ट डेटा मिल सकता है, गवर्नमेंट एक्सपेंडिचर मिल सकती है, वेलफेयर शेम्स भी मिल सकते हैं. ओके. RTI appeal is filed to Information Commission. RTI appeal is filed to Information Commission. Central Information Commission is located at Delhi. Central Information Commission is located at Delhi. RTI Act empowers citizens to question government. RTI Act empowers citizens to question government. Information Commission can impose penalty on public information officer. Information Commission can impose penalty on public information officer. Maximum penalty on public information officer can be 25,000. IPR imprisonment means unauthorized use. Okay. IPR infringement means unauthorized use. Patent infringement can lead to legal action. Copyright duration generally lasts for lifetime of author plus 60 years. Trademark infringement affects brand owner. IPR laws helps in economic growth. IPR law helps in economic growth. Consumer Protection Act encourages fair trade practices. Consumer forums are quasi-judicial bodies. Okay, not judicial, not administrative. Consumer forums are quasi-judicial bodies. Consumer complaint limitation period is 2 years. Consumer complaint limitation period is 2 years. Consumer Protection Act allows class action. Consumer Protection Act allows class action. RTI Act applies to citizens only. Information denied under RTI must be justified with reason. IPR registration provides legal protection. Patentable invention must be new, useful, or non-obvious, all of the above. Patentable invention must be new, useful, and non-obvious. Consumer Protection Act covers medical services. Yes, Consumer Protection Act covers medical services also. RTI Act improves accountability. RTI Act improves accountability. Copyright registration is optional. Trademark symbol are means registered trademark. GI registration is granted for community or association. Okay, GI registration is granted for community or association. Consumer Protection Act penalizes unfair trade practices. Consumer Protection Act penalizes unfair trade practices. RTI Act does not apply to Supreme Court. Sorry, private individuals. RTI Act does not apply to private individuals. IPR violation affects innovation, economy, and consumer trust. IPR violation affects all of the above like innovation, economy, and consumer trust. Consumer has right to information, choice, and safety. All of the above. Consumer has right to information, choice, and safety. Consumer Protection Act provides compensation for mental agony, physical harm, or financial loss, all of the above. RTI Act replaces Freedom of Information Act. Right to Information Act replaces with a Freedom of Information Act. RTI application can be rejected if information is exempted, fee not paid, applicant is not a citizen. इन तीनों में से भी कोई भी होगा तो आपका RTI का एप्लीकेशन रिजेक्ट किया जा सकता है. पेटेंट इज अ टेरिटोरियल मीनिंग वैलिड इन अ कंट्री ऑफ ग्रांट. एक पर्टिकुलर कंट्री के लिए होगा. टेरिटोरियल मतलब. कंज्यूमर प्रोटेक्शन एक्ट फोकसेस ऑन कंज्यूमर वेलफेयर. कंज्यूमर प्रोटेक्शन एक्ट focuses on consumer welfare. RTI Act enhances transparency in governance. RTI Act enhances transparency in governance. Trademark protect against brand misuse. Copyright imprisonment includes piracy. Consumer dispute settlement is simple and speedy. Consumer dispute settlement is simple and speedy. RTI Act promotes accountability, democracy, and transparency, all of the above. RTI Act promotes all of the above. Patentable subject matter excludes, okay. Mathematical methods are not included in a patents. Machines, chemicals, or pharmaceuticals comes under patents. Consumer Protection Act applies to online shopping. Yes. RTI Act encourages citizen participation in governance. RTI Act encourages citizen participation in governance. Trademark renewal is done every 10 years. 10 साल के बाद ट्रेडमार्क को रिन्यू किया जाता है. कंज्यूमर प्रोटेक्शन एक्ट penalizes false advertisements by fine and imprisonment. RTI Act information must be accurate, complete, or timely. All of the above. RTI Act information must be accurate, complete, and timely. IPR registration authority in India is under Ministry of Commerce. Okay. IPR registration authority in India is under Ministry of Commerce. Consumer Protection Act ensures ethical business practices. Consumer Protection Act ensures ethical business practices. RTI Act applies to NGOs receiving government funds. RTI Act applies to NGOs receiving government funds. Patent is granted after examination and publication. Consumer Protection Act provides civil remedy. Consumer Protection Act provides civil remedy. RTI Act improves governance quality. RTI Act improves governance quality. IPR helps to protect creativity, innovation, and investment. IPR helps to protect all like creativity, innovation, and investment. Consumer forum decisions are binding. Consumer forum decisions are binding. RTI information can be sought in writing, electronic form, Hindi or English, all of the above format. Okay. RTI information can be sought in writing, electronic form, or Hindi English. Trademark protects business identity. Consumer Protection Act empowers consumers. Consumer Protection Act empowers consumers. RTI Act excludes information related to national security. इसके बारे में आपको इंफॉर्मेशन नहीं मिल सकती नेशनल सिक्योरिटी के बारे में. बट पब्लिक इंटरेस्ट, ह्यूमन राइट्स वायोलेशन, करप्शन, इसके बारे में आपको इंफॉर्मेशन मिल सकती है RTI के थ्रू. पेटेंट इम्प्रिजनमेंट रेमेडी इंक्लूड्स इंजंक्शन एंड डैमेजेस. ये दोनों भी हो सकते हैं पेटेंट इम्प्रिजनमेंट के थ्रू. कंज्यूमर प्रोटेक्शन एक्ट प्रोवाइड्स अपील अप टू सुप्रीम कोर्ट. ओके. कंज्यूमर के लिए रिलेटेड जो एक्ट है उसमें कंज्यूमर जो है वो कहाँ तक जा सकता है, सुप्रीम कोर्ट तक जा सकता है. RTI एक्ट पेनल्टी इज इम्पोज टू इंश्योर अकाउंटेबिलिटी. RTI एक्ट पेनल्टी इज इम्पोज टू इंश्योर अकाउंटेबिलिटी. IPR laws discourage piracy. IPR laws discourage piracy. Overall aim of IPR, Consumer Protection Act and RTI Act is public interest and transparency. Okay, these are the 100 questions on IPR, CPA and RTI Act. Let's quick recap. IPR laws discourage piracy. RTI Act penalty is imposed to ensure accountability. Consumer Protection Act provides appeal up to Supreme Court. Patent imprisonment remedy includes injunction and damages. RTI Act excludes information related to national security. Consumer Protection Act empowers consumers. Trademark protects business identity. RTI information can be sought in a writing, electronic form, Hindi or English. And consumer forum decisions are binding. IPR helps protect uh, creativity, innovation, and investment. RTI Act improves governance quality. Consumer Protection Act provides civil remedy. Patent is granted after examination and publication. RTI Act applies to NGOs receiving government funds. RTI Act applies to NGOs receiving government funds. Consumer Protection Act ensures ethical business practices. IPR registration authority in India is under Ministry of Commerce. RTI Act information must be accurate, complete or timely. Consumer Protection Act penalizes false advertisements by fine and imprisonment. Our trademark renewal is done every 10 years. RTI Act encourages citizen participation in governance. So guys, our next topic is nutraceuticals, WHO GMP certification and National Health Programs India. So let's start. Nutraceutical is a term derived from nutrition plus medicine. Nutraceuticals means nutrition plus pharmaceuticals. Pharmaceutical means medicine. So nutrition plus medicine. Nutraceuticals are mainly intended for prevention and health promotion. Nutraceuticals are regulated in India under FSSAI Act. Okay, food safety standard. Okay, functional foods are those which provide additional health benefits. Example of nutraceutical is omega-3 fatty acids. Vaccines, antibiotics, paracetamol are the pharmaceutical medicines. Nutraceuticals differ from drug because they support normal body functions. Okay, not treatment, not therapy, they just support normal body functions. Dietary supplement include vitamins, minerals and amino acids, all of the above. Dietary supplements include all of the above. Probiotics are live beneficial microorganisms. Probiotics are live beneficial microorganisms. Prebiotics are substances that promote growth of a beneficial bacteria are called prebiotics. Herbal nutraceuticals are derived from plant sources. Herbs means plant. Claims made by nutraceuticals should be health supporting, not a therapeutic, disease curing, not misleading, only for health supporting. Nutraceuticals are not allowed to claim cure of a disease because they just only for support, not cure. WHO stands for World Health Organization, WHO option A. WHO GMP stands for World Health Organization Good Manufacturing Practices. WHO GMP guidelines ensure product quality and safety. WHO GMP is applicable to manufacturing units. WHO GMP certification is issued by National Regulatory Authority. WHO GMP certification is issued by National Regulatory Authority. WHO GMP focuses on premises, personal, and documentation, all of the above. Validation is an important part of a WHO GMP. Validation is an important part of WHO GMP. SOP in WHO GMP means Standard Operating Procedure. SOP means Standard operating procedure. WHO GMP ensures consistency in batch to batch quality. Documentation in WHO GMP is important for traceability. Okay. Self inspection is a requirement of WHO GMP. Hygiene in manufacturing is essential to prevent contamination. WHO GMP non-compliance may lead to लाइसेंस सस्पेंशन. ओके, अगर कोई कंपनी WHO के GMP के अकॉर्डिंग काम नहीं कर रही है, ओके, सो उसका लाइसेंस रद्द भी किया जा सकता है, कैंसिल किया जा सकता है, मतलब सस्पेंड, लाइसेंस सस्पेंशन. नेशनल हेल्थ प्रोग्राम्स आर लॉन्च बाय सेंट्रल गवर्नमेंट. ओके, national health programs are launched by central government. A main aim of a national health program is improve public health. A main aim of a national health program is improve public health. National Tuberculosis Elimination Program focuses on TB. National Tuberculosis Elimination Program (NTEP). DOTS is related to uh, TB control. Okay, DOTS is related to TB control. National AIDS Control Program deals with HIV and AIDS. National Immunization Program aims to prevent vaccine preventable diseases. Universal Immunization Program includes childhood vaccines. Universal Immunization Program includes childhood vaccines. National Program for Prevention and Control of Cancer deals with non-communicable diseases. Okay. कंट्रोल ऑफ कैंसर मतलब क्या है? कैंसर टचेस से नहीं होता, कम्युनिकेशन से नहीं होता. ओके, सो नॉन कम्युनिकेशन डिजीजेस. नेशनल प्रोग्राम फॉर प्रिवेंशन एंड कंट्रोल ऑफ कैंसर डील्स विथ नॉन कम्युनिकेबल डिसीजेस. नेशनल वेक्टर बॉर्न डिसीज कंट्रोल प्रोग्राम इंक्लूड्स वेक्टर बॉर्न जो कि होते हैं मलेरिया से. ओके, नेशनल वेक्टर बॉर्न डिसीज कंट्रोल प्रोग्राम इंक्लूड्स मलेरिया. National Health Mission includes rural and urban health missions. Ayushman Bharat scheme aims at a health insurance coverage. Ayushman Bharat scheme aims at a health insurance coverage. Janani Suraksha Yojana focuses on safe motherhood. Janani Suraksha Yojana focuses on safe motherhood. National Nutrition Program aims to reduce malnutrition. National Nutrition Program aims to reduce malnutrition. Nutraceuticals may help in nutritional deficiency management. ओके, किसके लिए यूज़ होता है न्यूट्रास्यूटिकल्स का? न्यूट्रिशनल डेफिशिएंसी मैनेजमेंट के लिए. WHO GMP सर्टिफिकेशन improves brand image, product acceptance and quality assurance. All of the above correct for WHO GMP certification. Brand image, product acceptance and quality assurance, all of the above. National Leprosy Eradication Program aims to eliminate control leprosy. ओके, लेप्रेसी का प्रोग्राम है तो लेप्रेसी को ही एलिमिनेट किया जाएगा, कंट्रोल किया जाएगा. नेशनल लेप्रेसी इरेडिकेशन प्रोग्राम एम्स टू कंट्रोल लेप्रेसी. नेशनल मेंटल हेल्थ प्रोग्राम एड्रेसेस मेंटल डिसऑर्डर्स. न्यूट्रास्यूटिकल लेबलिंग शुड इंक्लूड न्यूट्रिशनल इंफॉर्मेशन, मतलब जो आप खा रहे हो इसमें कितनी न्यूट्रिशनल वैल्यू है वो लेबल में होना चाहिए. WHO GMP अप्लाइज टू फार्मास्यूटिकल्स एंड मेडिकल डिवाइसेस. कॉस्मेटिक्स के लिए नहीं होती है WHO GMP गाइडलाइंस. कॉस्मेटिक्स के लिए ब्यूरो ऑफ इंडियन स्टैंडर्ड्स होते हैं BIS, बट फार्मास्यूटिकल्स एंड मेडिकल डिवाइसेस के लिए WHO GMP अप्लाइज होते हैं. स्टेबिलिटी स्टडीज आर रिक्वायर्ड अंडर WHO GMP. World Health Organization, good manufacturing practices. Next, National Program for Control of Blindness targets visual impairment. किसके लिए होता है ये? National Program for Control of Blindness targets visual impairment. National Health Program are monitored by Health Ministry, ना कि कोर्ट, कंज्यूमर, फार्मासिस्ट, ये सब नहीं. जो कि हेल्थ मिनिस्ट्री होती है वो उसको मॉनिटर करती है. National health programs are monitored by Health Ministry. Nutraceuticals are usually available as tablet, capsule and powders in the form of a tablet, capsule or powders. WHO GMP requires training of all personnel like managers, inspectors, doctors, pharmacists, nurses, everyone's. Okay. WHO GMP requires training of all personnel. National Program for Prevention and Control of Diabetes deals with lifestyle diseases. Okay, lifestyle diseases. Nutraceuticals are classified as food products. Okay, ड्रग्स पॉइजन्स मेडिकल डिवाइस नहीं जो कि एक फूड प्रोडक्ट्स है वो न्यूट्रिशन का काम करेंगे कौन न्यूट्रास्यूटिकल्स WHO GMP ensures safety by controlling manufacturing processes. Okay. National health policy is formulated by Government of India. National health policy is formulated by Government of India. A midday meal program aims to improve nutrition of school children. Midday meal program aims to improve nutrition of school children. Nutraceuticals can be used for chronic disease support. Nutraceuticals can be used for chronic disease support. WHO GMP requires proper housekeeping, equipment maintenance, and calibration, all of the above. WHO GMP requires all of the above components like housekeeping, equipment maintenance, and calibration. National Program for Tobacco Control targets smoking and tobacco use. Nutraceutical adverse effect monitoring is important. न्यूट्रास्यूटिकल आप खा रहे हो बट उसके कुछ एडवर्स इफेक्ट आ रहे हैं या नहीं उसको मॉनिटर करना बहुत ही इंपॉर्टेंट है ओके इलीगल और ऑप्शनल नहीं नॉट रिक्वायर्ड नहीं इंपॉर्टेंट ही है बहुत रिक्वायर्ड है WHO GMP certification helps in international trade. National health programs mainly target entire population like urban population, rural population. Okay, सबके लिए होता है national health programs. Nutraceuticals must comply with FSSI standards. Okay. WHO GMP inspection is conducted by regulatory authority. WHO GMP inspection is conducted by a regulatory authority. A national program for control of deafness addresses hearing impairment. Nutraceuticals are often used as adjunct to diet. WHO GMP documentation must be accurate and updated. Okay. National Health Mission integrates all health programs like TB program, nutrition program, export promotion, everything comes under health mission targets. Okay. National Health Mission integrates all health programs. Nutraceuticals help in immunity support, nutrient supplementation, and wellness, all of the above. Nutraceuticals help in all. WHO GMP focuses on prevention of errors and contamination. WHO GMP focuses on prevention of errors and contamination. National Program for Family Welfare aims at population stabilization. National Program for Family Welfare aims at population stabilization. Nutraceuticals are usually sold over the counter. मतलब उसको उसको सेल करने के लिए प्रिस्क्रिप्शन की ज़रूरत नहीं होती. WHO GMP certification validity depends on compliance. A national program for control of cancer promotes early detection, treatment, and prevention. So all of the above, it's correct answer. National program for control of cancer promotes early detection, treatment, and prevention. Nutraceuticals should be manufactured under FSSI GMP. WHO GMP includes control of raw materials, in process checks, finished products, all of the above. जो सर्टिफिकेशन होता है WHO GMP वो सभी स्टेज के लिए कंट्रोल करता है वो. National health programs are funded by government budget. Nutraceutical market is growing due to aging population, lifestyle diseases, health awareness. इन सब को देखते हुए न्यूट्रास्यूटिकल की डिमांड बढ़ती जा रही है मार्केट्स में. WHO GMP ensures product efficacy, product safety, and product quality. A national program for control of malaria is a part of A. Okay. National Program for Control of Malaria is a part of a NVBDCP control program. Nutraceuticals are not meant to replace balanced diet. Nutraceutical is a supplement diet, support health and improve wellness. WHO GMP compliance is mandatory for manufacturers. WHO GMP compliance is mandatory for manufacturers. National Program for Adolescent Health is called RKSK. Okay. For adolescent health is called RKSK. Nutraceutical safety depends on dosage, quality of raw material, manufacturing process and all of the above. So all factors depends on nutraceuticals. WHO GMP certification helps regulators to ensure compliance. National Health Program emphasizes prevention, promotion and treatment. All of the above correct. National health programs emphasize prevention, promotion and treatment. Nutraceutical claims must be evidence-based. Nutraceutical claims must be evidence-based. WHO GMP applies to API manufacturers and finished product manufacturers. National Program for Iodine Deficiency Disorders deals with goiter. Nutraceuticals may interact with drugs, food, and supplements. All of the above correct. Nutraceuticals may interact with drug, food, and supplements. WHO GMP inspection report is submitted to licensing authority. जो कमेटी होती है, अथॉरिटी होती है, वो इंस्पेक्ट करने के बाद रिपोर्ट किसे देती है? लाइसेंसिंग अथॉरिटी के पास देते हैं. नेशनल प्रोग्राम फॉर एल्डरली हेल्थ फोकसेस ऑन जेरियाट्रिक पॉपुलेशन. एल्डरली मतलब क्या होता है? जेरियाट्रिक बोलते हैं हम उसे. न्यूट्रास्यूटिकल्स improve health mainly by nutritional support. Okay. WHO GMP non-compliance may affect product recall, market authorization और export. मतलब ये तीनों भी चीज़ों पर उनका इफेक्ट होता है अगर वो WHO GMP नॉन कंप्लाइंस होंगे तो, इसलिए एक्सपोर्ट में भी उसका घाटा होगा. नेशनल हेल्थ प्रोग्राम्स आर इवेल्युएटेड बेस्ड ऑन आउटकम्स, कवरेज एंड इम्पैक्ट. इसके बेसिस पर उसको इवेल्युएट किया जाता है नेशनल हेल्थ प्रोग्राम को. कौन कौन से? उसके आउटकम्स, कवरेज एंड इम्पैक्ट. न्यूट्रास्यूटिकल मैन्युफैक्चरिंग मस्ट अवॉइड कंटामिनेशन, adulteration and mislabeling. All of the above correct. Nutraceutical manufacturing must avoid contamination, adulteration and mislabeling. WHO GMP ensures manufacturing is a controlled. Okay. WHO GMP ensures manufacturing is a controlled. National Program for Pulse Polio aims to eradicate polio. Nutraceutical quality is ensured by testing, GMP compliance or proper storage. All of the above is correct. Nutraceutical quality is ensured by testing, GMP compliance, proper storage. WHO GMP certification increases consumer confidence, regulatory trust and market acceptance. इन तीनों चीज़ों पर उसका इफेक्ट होता है अगर हमारा प्रोडक्ट WHO GMP सर्टिफाइड होगा तो. कंज्यूमर को भी कॉन्फिडेंस मिलता है उसको कंज्यूम करने के लिए, रेगुलेटरी भी ट्रस्ट होता है, मार्केट एक्सेप्टेंस भी होता है. नेशनल हेल्थ प्रोग्राम्स आर कोऑर्डिनेटेड बाय मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर. नेशनल हेल्थ प्रोग्राम्स आर कोऑर्डिनेटेड बाय मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर. ओवरऑल एम ऑफ अ न्यूट्रास्यूटिकल रेगुलेशन, WHO GMP and National Health Program is public health and quality of life. So these are the 100 MCQs on WHO GMP, nutraceutical and national health programs. So guys, our next topic is irrational drug combinations, antimicrobial resistance, AMR, a global threat. Okay, so चलिए start करते हैं. Irrational drug combination means combination without scientific justification. Irrational combinations mainly lead to adverse drug reactions. Fixed dose combinations FDC is irrational when it has incompatible pharmacology. Example of irrational combination is two NSAIDs together. Okay, combining two NSAIDs together results in a increased toxicity. Irrational combinations increase risk of a drug interactions, who discourage irrational combinations to promote rational drug use. Polypharmacy means use of multiple drugs. Polypharmacy means use of multiple drugs. Polypharmacy often leads to medication errors. Irrational antibiotic combinations contribute to antimicrobial resistance. Irrational antibiotic combinations contribute to antimicrobial resistance. Antimicrobial resistance is defined as microorganism resistance to a antimicrobial drugs. मतलब उस एंटीबायोटिक का उस माइक्रो पर कोई इफेक्ट नहीं होता, वो उसको रेजिस्ट करता है. Antimicrobial resistance is considered a global threat because it limits treatment options. A major cause of antimicrobial resistance is overuse and misuse of antibiotics. Incomplete antibiotic therapy leads to resistance development. Incomplete antibiotic therapy leads to development. Use of antibiotics for viral infection is irrational. Use of antibiotic is a viral infection is irrational. Common irrational combination in cough syrup includes मल्टीपल सेडेटिव्स. ओके, वहाँ पर ज़रूरत भी नहीं होती, फिर भी आप क्या करोगे, मल्टीपल सेडेटिव्स देके, जो कि एक इरेशनल कॉम्बिनेशन है. इरेशनल एफ डी सी इंक्रीजेस. ओके, इरेशनल फिक्स ड्रग कॉम्बिनेशंस इंक्रीज ट्रीटमेंट कॉस्ट. WHO model list promotes essential medicines. Essential medicines concept supports rational therapy. Antimicrobial resistance mainly affects treatment of bacterial infections because antibiotic ही बनाते हैं उससे. Multi-drug resistance TB is an example of a antimicrobial resistance. Irrational combination of vitamins lead to hypervitaminosis. मतलब विटामिन्स का कॉन्सेंट्रेशन ज़्यादा हो जाएगा बॉडी में, ब्लड्स में, उसको ही हम क्या बोलेंगे, इरेशनल कॉम्बिनेशन ऑफ विटामिन्स. Antimicrobial stewardship aims to optimize antibiotic use. Stewardship programs help to reduce antimicrobial resistance. Self-medication with antibiotic is a major cause of antimicrobial resistance. मतलब कभी भी आपके मन से एंटीबायोटिक नहीं लेना है, माइनर ट्रीटमेंट्स के लिए भी, इन्फेक्शन के लिए. कॉम्बिनेशन ऑफ बैक्टीरियोस्टैटिक एंड बैक्टीरिसाइडल ड्रग्स may cause antagonism. Okay, combination of bacteriostatic and bactericidal drugs may cause antagonism. Example of rational antibiotic combination is rational मतलब जो कि एक यूजफुल है, सल्फामेथोक्सेजोल एंड ट्राइमेथोप्रिम. Antimicrobial resistance increases mortality and morbidity. Over-the-counter sale of antibiotic leads to antimicrobial resistance. मतलब कभी भी एंटीबायोटिक्स को ओवर द काउंटर नहीं देना चाहिए, उसको प्रिस्क्रिप्शन के ही हेल्प से देना चाहिए. WHO स्लोगन फॉर एंटी माइक्रोबियल रेजिस्टेंस अवेयरनेस इज नो एक्शन टुडे नो क्योर टुमारो, जो कि एक स्लोगन है AMR अवेयरनेस का. नो एक्शन टुडे नो क्योर टुमारो. इरेशनल ड्रग कॉम्बिनेशंस आर ऑफन मार्केटेड फॉर कमर्शियल रीजंस. Irrational drug combinations are often marketed for commercial reasons. AMR can spread through humans, animals and environment. ओके, ये सभी फैक्टर्स रिस्पॉन्सिबल होते हैं एंटीमाइक्रोबियल रेजिस्टेंस के स्प्रेड होने के लिए. यूज ऑफ एंटीबायोटिक्स इन एनिमल्स कंट्रीब्यूट्स टू एंटीमाइक्रोबियल रेजिस्टेंस. Irrational combinations reduce treatment effectiveness. Irrational combinations reduce treatment effectiveness. A national action plan on antimicrobial resistance focuses on surveillance and rational use. A national action plan on AMR focuses on surveillance and rational use. Pharmacist's role in preventing antimicrobial resistance includes patient counseling. Combining two antihistamine may cause sedation. Antimicrobial resistance results in longer hospital stay. Rational drug use means using right drug at a right dose. उसको क्या बोलते हैं हम, रैशनल ड्रग्स. जितना चाहिए उतना उसी समय पे ले रहे हैं। इरेशनल कॉम्बिनेशन इंक्रीजेस चांसेस ऑफ एडोस ड्रग रिएक्शंस। Irrational combination increases chances of adverse drug reactions. WHO recommends antibiotics should be used only when necessary. WHO क्या कहता है कि जब चाहिए तभी एंटीबायोटिक्स खाना चाहिए, कभी भी उठ के नहीं खाना है छोटे छोटे इन्फेक्शंस के लिए। एंटीमाइक्रोबियल रेजिस्टेंस थ्रेटन्स modern medicine, surgery safety, and cancer therapy. Irrational cough syrup combinations often contain multiple CNS depressants. Antibiotic resistance genes can be transferred by horizontal gene transfer. Antibiotic resistance genes can be transferred by horizontal gene transfer. AMR surveillance helps in monitoring resistance patterns. AMR surveillance helps in monitoring resistance patterns. Combining two antipyretics may cause hepatotoxicity. Combining two antipyretics may cause hepatotoxicity. Rational fixed dose combinations should have same pharmacokinetics. AMR can reverse benefits of antibiotics and surgery. Okay. Irrational combinations complicate. Irrational combinations complicate diagnosis, therapy, and monitoring. Irrational combinations complicate diagnosis, therapy, and monitoring. WHO promotes aware classification for antibiotics. Aware, okay. WHO promotes aware classification for antibiotics. OCH group antibiotics should be carefully prescribed. OCH group antibiotics should be carefully prescribed. Reserve antibiotics are meant for लास्ट रिसोर्ट यूज़। ओके, रिजर्व उसका यूज़ बाद में करना है। रिजर्व एंटीबायोटिक्स आर मेंट फॉर लास्ट रिसोर्ट यूज़। AMR increases healthcare cost. Antimicrobial resistance increases healthcare cost. Or irrational drug combinations often lack scientific evidence. Irrational drug combinations often lack scientific evidence. Pharmacovigilance helps identify irrational combinations, adverse drug reactions and safety issues. इन तीनों को आइडेंटिफाई करता है हमारा फार्माकोविजिलेंस। ओके। वन हेल्थ अप्रोच वन हेल्थ अप्रोच एड्रेसेस antimicrobial resistance by integrating human, animal and environment. Use of antibiotics in agriculture leads to environmental antimicrobial resistance. Irrational combinations may mask disease symptoms, diagnosis, or adverse effects. WHO considers antimicrobial resistance as a global public health threat. Combination of antibiotics without indication causes resistance. Combination of antibiotics without indication causes resistance. Rational prescribing includes minimal effective drugs, evidence based choice, monitoring. Rational prescribing includes minimal effective drugs, evidence based choice, and monitoring. AMR control requires government action only, healthcare professionals only, public awareness, all of the above. AMR control requires all of the above, government action, healthcare professionals, everything. Irrational drug combinations are banned in India under Drug and Cosmetic Act. Fixed dose combinations should be approved by regulatory authority. AMR reduce effectiveness of antibiotics. Combining steroids with NSAID irrationally increases risk of अल्सर्स। ओके, अब इन दोनों को साथ में यूज़ करोगे तो अल्सर के चांसेस बढ़ जाएंगे। और रैशनल कॉम्बिनेशंस एम टू रिड्यूस पील बर्डन सेफली। और रैशनल कॉम्बिनेशंस एम टू reduce pill burden safely. AMR surveillance in India is coordinated by ICMR, okay, Indian Council of Medical Research, AMR. Irrational combinations often confuse patients, prescribers, or pharmacists. AMR threatens achievement of a Sustainable Development Goals. Antibiotic misuse includes wrong dose, wrong duration, and wrong indication. Okay. Next, irrational drug combinations are discouraged to reduce resistance, improve safety, and improve efficacy. All of the above correct options. Irrational drug combinations are discouraged to reduce resistance, improve safety, and improve efficacy. AMR control requires infection prevention through hand hygiene, sanitation, and vaccination. Rational drug combinations are based on evidence, फार्मेकोलॉजी और क्लिनिकल नीड. इन तीनों के भी बेसिस पर रैशनल ड्रग का कॉम्बिनेशन किया जाता है. AMR अवेयरनेस वीक इज ऑब्जर्व इन नवंबर. जो एंटी माइक्रोबियल रेजिस्टेंस है उसका अवेयरनेस का वीक कौन से मंथ्स में आता है? नवंबर मंथ्स में आता है. इरेशनल कॉम्बिनेशंस में इंक्रीज drug drug interactions, side effects, or cost also. WHO recommends antibiotics should not be shared because resistance risk. Rational antibiotic therapy require culture sensitivity test when possible and indicated nahi always. Okay. Rational antibiotic therapy requires culture sensitivity test when possible and indicated. AMR is accelerated by poor infection control, overcrowding, lack of a sanitation. All of the above correct option. AMR is accelerated by poor infection control, overcrowding, and lack of sanitation. Irrational drug combinations undermine rational pharmacotherapy, public trust, and health outcomes. Irrational drug combinations undermine all of the above. WHO promotes rational drug use to improve patient care. AMR threatens success of organ transplantation, chemotherapy, and surgery. AMR threatens success of all of the above, like organ transplantation, chemotherapy, and surgery. Rational combinations are often scientifically validated. Rational combinations are often scientifically validated. AMR can lead to untreatable इन्फेक्शंस, इंक्रीज डेथ्स, इकोनॉमिक बर्डन, ये सभी हो सकते हैं AMR की वजह से. इरेशनल ड्रग कॉम्बिनेशन शुड बी डिस्करेज. Irrational drug combinations should be discouraged. WHO essential medicines list avoids irrational fixed drug combinations. AMR awareness among public helps in a rational use, compliance, or reduce misuse. All of the above correct option. AMR awareness among people helps in कि रैशनल ड्रग का यूज़ करना चाहिए, कंप्लायंस, रिड्यूस मिसयूज़ होना चाहिए. इरेशनल कॉम्बिनेशंस इंक्रीज बर्डन ऑन हेल्थ केयर सिस्टम, पेशेंट्स, सोसाइटी. ऑल ऑफ द अबव सबके ऊपर बर्डन आता है इरेशनल कॉम्बिनेशन ड्रग का यूज़ करने के बाद. एंटीबायोटिक रेजिस्टेंस कैन स्प्रेड वाया फूड चेन, वाटर, कॉन्टैक्ट. इन सभी चीज़ों से एंटीबायोटिक का रेजिस्टेंस होता है. Rational prescribing is a responsibility of all healthcare professionals like doctor, pharmacist, nurse, everyone's. Okay. Rational prescribing is a responsibility of all healthcare professionals. AMR surveillance data helps in guideline formulation, policy making, treatment decision. इन सब के लिए यूज़ होता है AMR surveillance का. Okay. Irrational combinations are often challenged by रेगुलेटरी अथॉरिटीज़, WHO एंड हेल्थ प्रोफेशनल्स. इन सब के लिए चैलेंजेबल काम है इरेशनल कॉम्बिनेशंस का मिसयूज़ को रोकने के लिए. AMR कंट्रोल रिक्वायर्स ग्लोबल कोऑपरेशन. एंटीमाइक्रोबियल रेजिस्टेंस कंट्रोल रिक्वायर्स ग्लोबल कोऑपरेशन. रैशनल ड्रग कॉम्बिनेशंस improve safety, efficacy, and compliance. All of the above correct. Rational drug combinations improve safety, efficacy, and compliance. AMR is accelerated by lack of awareness, regulation, and surveillance. अगर इन तीनों चीज़ों के लैकिंग की वजह से क्या होता है, AMR हो जाता है. अगर किसी को अवेयरनेस नहीं है, रेगुलेशन नहीं है, सर्विलेंस नहीं है, मॉनिटरिंग नहीं है, तो पेशेंट ऐसे ही खाएंगे उसको. सो एंटीमाइक्रोबियल रेजिस्टेंस बढ़ जाएगा. इरेशनल फिक्स डोज कॉम्बिनेशंस fixed drug combinations often lack dose flexibility, individualization, safety margin. All of the above correct. Irrational fixed drug combinations often lack dose flexibility, individualization, or a safety margin. WHO calls antimicrobial resistance a threat to global health security, economy, and development. All of the above correct. WHO calls AMR a threat to global health security, economy, and development. Rational drug use helps in better outcomes, reduce resistance एंड लोअर कॉस्ट. इन तीनों भी चीज़ों को हेल्प्स हो सकती है अगर हम रैशनल ड्रग का यूज़ करेंगे तो. इरेशनल ड्रग कॉम्बिनेशंस शुड बी रिपोर्टेड टू रेगुलेटरी अथॉरिटीज़. अगर कोई इरेशनल ड्रग कॉम्बिनेशन यूज़ कर रहा है, प्रिस्क्राइब कर रहा है, ओके, उसका अब्यूज़ कर रहा है, मिसयूज़ कर रहा है, तो आपको क्या करना है, किसे रिपोर्टेड करना चाहिए? मैन्युफैक्चरर को नहीं, कंज्यूमर को नहीं, कोर्ट में नहीं, तो डायरेक्टली जो रेगुलेटरी अथॉरिटीज़ होती है, बॉडीज़ होती है, CDSCO हो गई, WHO हो गई, आपके स्टेट की कोई अथॉरिटी हो गई, उनको रिपोर्ट करना चाहिए. So, overall aim of addressing irrational combinations and antimicrobial resistance is public health protection. Okay, so move to the next topic. So guys, in this video we see Indian Pharmacopoeia Commission (IPC) or Adverse Drug Reactions (ADR). So let's start. IPC stands for Indian Pharmacopoeia Commissions. Okay, बहुत बच्चे इंडियन फार्मास्यूटिकल काउंसिल भी कर देंगे, और जो कि एक फार्माकोपियन कमीशन होता है IP. ओके, इंडियन फार्माकोपिया कमीशन. सो आंसर बी करेक्ट. इंडियन फार्माकोपिया कमीशन was established in 2005. IPC comes in year 2005. IPC functions under Ministry of Health and Family Welfare. Headquarters of Indian Pharmacopoeia Commission is located at गाज़ियाबाद. IPC वहाँ पर भी हमारे क्या है, पेटेंट ऑफिस भी है गाज़ियाबाद में. Headquarters of IPC, Indian Pharmacopoeia Commission, is located at Ghaziabad. Primary function of IPC is to publish Indian Pharmacopoeia. Indian Pharmacopoeia provides official drug standards. Indian Pharmacopoeia is legally recognized under Drug and Cosmetic Acts. Latest editions of Indian Pharmacopoeia are published by IPC. IP को कौन पब्लिश करता है? इंडियन फार्माकोपियल कमीशन, IPC बोलते हैं उसे. IPC also functions as National Coordination Center for PVPI. Okay, IPC also functions as National Coordination Center for PVPI. PVPI stands for Pharmacovigilance Program of India. PV मतलब फार्मेकोविजिलेंस, PI मतलब प्रोग्राम ऑफ इंडिया. फार्मास्यूटिकल नहीं, पब्लिक नहीं, फार्मेसी नहीं, फार्मेकोविजिलेंस. ओके. ADR stands for Adverse Drug Reaction. ADR is defined as harmful and unintended response to a drug. ADRs occur at toxic doses only, normal therapeutic doses, subtherapeutic doses. ADR is occur mainly normal therapeutic doses also. Okay. Pharmacovigilance mainly deals with drug safety. Pharmacovigilance mainly deals with drug safety. IPC coordinates pharmacovigilance in India through PVPI, Pharmacovigilance Program of India. National Coordination Center NCC for PVPI is located at, कहाँ पर है ये सेंटर? नेशनल कोऑर्डिनेशन सेंटर, वो भी गाज़ियाबाद में ही है. इंडियन फार्माकोपियल कमीशन गाज़ियाबाद. ADR reporting in India is voluntary for healthcare professionals. ADR reporting in India is voluntary for healthcare professionals. Healthcare professionals who can report ADR include doctors, pharmacists, nurses, all of the above. So anyone can report ADR. ADR reporting form used in India is सस्पेक्टेड ADR रिपोर्टिंग फॉर्म. कौन सा फॉर्म होता है वो? सस्पेक्टेड ADR रिपोर्टिंग फॉर्म होता है. ADR मॉनिटरिंग सेंटर AMC is usually located in hospitals and medical colleges. ADR monitoring center AMC is usually located at hospitals and medical colleges. IPC also publishes National Formulary of India. IPC also publishes National Formulary of India. National Formulary of India provides prescribing information. National Formulary of India provides prescribing information. ADR are classified into 6 types, type A to F. ओके, ADR के कितने टाइप्स होते हैं? 4 टाइप, मतलब 6 टाइप्स होते हैं. ओके, टाइप्स A to B F. टाइप्स A ADR आर डोज रिलेटेड एंड प्रेडिक्टेबल. मतलब टाइप ए में जो ADR होता है हमें पता होता है कि अगर हम इसका ड्रग का डोज बढ़ा देंगे तो हमें ए हो सकता है. ओके, जो कि प्रेडिक्टेबल होता है, डोज रिलेटेड. टाइप बी ADR आर बिचारे एंड अनप्रेडिक्टेबल. बी से याद रखना, बिचारे एंड अनप्रेडिक्टेबल. मोस्ट कॉमन ADR बिलोंग टू टाइप ए. सॉरी, टाइप ए ही होता है डोज रिलेटेड. मोस्ट कॉमन ADRs बिलोंग टू टाइप ए. टाइप सी ADR आर रिलेटेड टू लॉन्ग टर्म यूज. क्रोनिक बोलते हैं उसे, सी से क्रोनिक याद रखना. टाइप सी ADR आर रिलेटेड टू लॉन्ग टर्म यूज. टाइप डी ADR आर डिलेड रिएक्शंस. सो डी से क्या याद रखना? डिलेड रिएक्शंस. टाइप डी ADR आर डोज रिलेटेड, सॉरी, डिलेड रिएक्शंस. और टाइप ई ADR आर एसोसिएटेड विथ एंड ऑफ अ यूज और विड्रॉल. अगर आप किसी ड्रग का ड्यूरेशन कम ख़त्म हो गई है, उसके बाद आपने उसको छोड़ दिया है, विड्रॉल कर दिया है. ओके, पूरी ट्रीटमेंट होने से पहले ही उसको विड्रॉ कर दिया, मतलब आपने डोज लेना बंद कर दिया, तो आपको जो ADR होगा उसे हम क्या बोलते हैं? टाइप ई ADR. टाइप एफ ADR इंडिकेट फास्ट फेल्योर ऑफ अ थेरेपी. टाइप एफ ADRs indicate failure of a therapy. Serious ADR includes hospitalization. Serious ADR includes hospitalization. IPC helps in improving drug safety by ADR data analysis, regulatory recommendations, and signal detection. IPC helps in improving drug safety by all of the above. So, signal detection means identifying new safety information. Signal detection means identifying new safety information. Casualty assessment of ADR determines relationship between drug and a reaction. Casualty assessment of ADR determines relationship between drug and a reaction. WHO UMC scale is used for casualty assessment. WHO UMC scale is used for casualty assessment. Severity of ADR is classified as mild, moderate, and severe. Preventable ADR occurs due to medication errors. Preventable ADRs occur due to medication errors. IPC collaborates internationally with WHO. Indian Pharmacopoeia Commission collaborates internationally with WHO. Uppasala Monitoring Center UMC is located in, where it is located? It is located in Sweden. याद रखना, Uppasala Monitoring Center UMC is located in Sweden. India contributes ADR data to WHO through IPC. India contributes ADR data to WHO through IPC. ADR reporting helps in drug recall, label changes, and risk minimization. ADR reporting helps in drug recall, label changes, risk minimization. Unexpected ADR means reaction not mentioned in. Unexpected ADR means a reaction not mentioned in label. Pharmacist role in ADR monitoring includes identifying ADR, reporting ADR, counseling patients. Okay, all of the above are the roles of a pharmacist role in ADR monitoring, like ADR को identify करना, उसको report करना और counseling करना patients को about ADR. IPC also publishes इंडियन फार्माकोपिया एडेंडम. ओके, ये कौन पब्लिश करता है? IPC पब्लिश करता है, इंडियन फार्माकोपिया कमीशन. ADR रिपोर्टिंग शुड बी डन फॉर ऑल सस्पेक्टेड रिएक्शंस. ADR रिपोर्टिंग शुड बी डन फॉर ऑल सस्पेक्टेड रिएक्शंस. ADR data confidentiality is maintained. Post marketing surveillance mainly detects rare ADRs. Post marketing surveillance mainly detects rare adverse drug reactions. Clinical trials may fail to detect ADR because of small sample size, short duration and control conditions. इन कंडीशन की वजह से क्या होता है, कभी कभी हम ADR को डिटेक्ट नहीं कर पाते. शॉर्ट ड्यूरेशन हो गई, सैम्पल की साइज़ कम हो गई. IPC contributes to public health by ensuring drug standards, monitoring drug safety, publishing official books. Okay, all of the above correct options. ADR reporting form can be submitted online by email or by post. आप किसी भी तरह से ADR रिपोर्टिंग का फॉर्म सबमिट कर सकते हो. कॉमन ऑर्गन अफेक्टेड बाय एडवर्स ड्रग रिएक्शन इज स्किन. मेनली क्या होता है, एलर्जी हो जाती है एडवर्स ड्रग रिएक्शन की वजह से. सो मेनली कौन सा ऑर्गन अफेक्टेड होता है ADR से, जो कि होता है स्किन. एलर्जिक ADR आर यूजुअली प्रेडिक्टेबल, डोज डिपेंडेंट. ओके, डोज इंडिपेंडेंट होते हैं. एलर्जिक ADR आर यूजुअली डोज इंडिपेंडेंट. IPC works to harmonize standards with British Pharmacopoeia, United States Pharmacopoeia, इंटरनेशनल फार्माकोपिया, ऑल ऑफ द अबव. जो हमारी इंडियन फार्माकोपियल कमीशन है वो सबके साथ काम करती है. ADR monitoring helps in identifying drug interactions, contraindications and risk factors. ADR monitoring helps in identifying drug interactions, contraindications or risk factors. Spontaneous reporting system suffers from underreporting and bias, not over-reporting. Okay. Spontaneous reporting system suffers from underreporting or bias. IPC is an autonomous organization under Ministry of Health, Family and Welfare. ADR reporting is important for both new and old drugs. Vaccine safety monitoring is called AEFI surveillance. Okay. फार्माकोविजिलेंस किसे कहा जाता है, अगर आप मेडिसिन होगी, ड्रग होगा, उसकी सेफ्टी कर रहे हो तो उसको फार्माकोविजिलेंस बोलते हैं. मटेरियल विजिलेंस किसको बोलते हैं, मेडिकल डिवाइस की जो सेफ्टी मॉनिटरिंग होती है उसको बोलते हैं मटेरियल विजिलेंस. और वैक्सीन की जो सेफ्टी मॉनिटरिंग होती है उसे क्या बोलते हैं, AEFI सर्विलेंस. याद रखना. IPC ऑल्सो सपोर्ट्स मटेरियल विजिलेंस, हीमो विजिलेंस और फार्माकोविजिलेंस. सबको कौन सपोर्ट करता है, इंडियन फार्माकोपियल कमीशंस. ADR burden is higher in elderly patients. Polypharmacy increases the risk of adverse drug reactions. IPC contributes to rational drug use by publishing standards, monitoring safety, and educating professionals. ADR due to drug withdrawal is E. Okay, drug withdrawal is. ADR assessment includes evaluation of time relationship, de-challenge and re-challenge, alternative causes. All of the above option. ADR assessment includes evaluation of time relationship, de-challenge and re-challenge. IPC supports evidence-based medicine through IP standards, ADR data, formularies, all of the above. Fatal ADR must be reported immediately. Okay. IPC plays a key role in drug safety regulation. IPC play a key role in drug safety regulation. ADR monitoring improves patient safety, public confidence, regulatory decisions. Lack of awareness is a major cause of under-reporting ADRs. IPC helps update drug monographs based on ADR data. IPC helps update drug monographs based on stability data. Serious ADR include life-threatening reactions, birth defects और death. कुछ भी हो सकता है. Serious ADR includes. ADR monitoring center reports to IPC. IPC is responsible for revision of IP every 5 years. ADR can be prevented by rational prescribing, patient education, and monitoring therapy. ADRs can be prevented by all of the above. IPC supports training in pharmacovigilance, quality control, and standardization. Unexpected serious ADR may lead to label warning, restricted use, and drug withdrawal. IPC also coordinates मटेरियल विजिलेंस प्रोग्राम इन इंडिया एंड हीमो विजिलेंस प्रोग्राम इन इंडिया. इन दोनों के साथ कोऑर्डिनेट करता है हमारा IPC. ADR रिपोर्टिंग इम्प्रूव सेफ्टी ऑफ इंडिविजुअल पेशेंट, पॉपुलेशन, हेल्थ केयर सिस्टम, सब में क्या होता है, ये यूजफुल होता है। आईपीसी इज नॉट रिस्पॉन्सिबल फॉर ड्रग प्राइस कंट्रोल। आईपीसी ड्रग की प्राइस कंट्रोल नहीं करता, बट ड्रग का स्टैंडर्ड, फार्माकोविजिलेंस और नेशनल फॉर्मुलरी, ये सब पॉइंट्स में उसका इन्वॉल्वमेंट होता है। एडीआर डॉक्यूमेंटेशन शुड इंक्लूड ड्रग डिटेल्स, रिएक्शन डिटेल्स एंड पोशन डिटेल्स। सभी इंफॉर्मेशन होती है हमारी एडीआर के डॉक्यूमेंटेशन में। आईपीसी कंट्रीब्यूट्स टू ग्लोबल ड्रग सेफ्टी थ्रू WHO collaboration, data sharing, and standard harmonization. ADR risk is higher in pregnancy, renal impairment, hepatic impairment. इन तीनों भी कंडीशन में ADR की रिस्क हायर होती है। IPC helps ensure quality medicines by setting standards, monitoring safety, and regulatory support. ADR reporting is a professional responsibility of all healthcare professionals. ADR reporting is a professional responsibility of all healthcare professionals. IPC was formerly known as इंडियन फार्माकोपिया कमेटी। पहले उसे क्या कहा जाता था, इंडियन फार्माकोपियल कमीशन, बट अभी क्या कहा जाता है, इंडियन फार्माकोपिया कमेटी। ADR related to drug interaction is usually drug in type A. IPC supports safety of drugs, vaccine, and medical devices. ADR awareness helps in early detection, risk minimization, and safer therapy. All of the above correct. ADR awareness helps in early detection, risk minimization, and safer therapy. IPC publishes official standards applicable to manufacturers, regulators, and quality control labs. ADR reporting improves trust in all of the above, like healthcare system, medicines, regulatory authorities, all of the above. IPC plays advisory role to all of the above, mainly government. Okay. IPC plays advisory role to government. ADR due to carcinogenicity is classified as type D, means drug related. ADR delayed. Okay. ADR due to carcinogenicity is classified as a type D. IPC helps in safe use of medicines by updating standards, safety monitoring, professional training. ADR data analysis helps in policy formulation, regulatory decisions, and public health planning. ADR data analysis helps in policy formulation, regulatory decisions, and public health planning. IPC is a statutory body under government notification. ADR reporting form should be filed when reaction is suspected. IPC supports evidence-based regulation by collecting ADR data, publishing IP, and collaborating internationally. ADR reporting ultimately leads to safer medicines, reduced harm, better regulation, all of the above. ADR reporting ultimately leads to safer medicines, reduced harm, better regulation, all of the above. IPC ensures medicines meet quality standards. And last question, overall aim of IPC and ADR monitoring is patient safety and public health. So guys, our next topic is chromatography, in which we see HPLC, GLC, HPTLC and LCMS. Okay, उसके साथ और कौन से टॉपिक्स है, hyphenated analytical techniques, limit test and radio immunoassay. So let's start. In HPLC, the most commonly used detector is UV visible detector. Okay. In HPLC, the most commonly used detector is UV visible detector. The mobile phase used in a normal phase HPLC is non-polar. The mobile phase used in a normal phase HPLC is a non-polar. In reverse phase HPLC, the stationary phase is non-polar. C18 column is made up of silica bonded with octadecyl groups. Okay. C18 column is made of silica bonded with octadecyl groups. Pump used in HPLC should provide constant high pressure flow. Typical pressure range of a HPLC is 15 to 400 बार. प्रेशर किससे डिनोट किया जाता है, बार से. सो कितना प्रेशर होना चाहिए मेनली HPLC में, 50 से 400 के बीच में. GLC stands for gas liquid chromatography. In GLC, the mobile phase is gas, okay, and stationary phase is a liquid. Common carrier gas used in a GLC is nitrogen. Detector most widely used in a GLC is flame ionization detector. Detector most widely used in a GLC is flame ionization detector. Flame ionization detector responds mainly to organic compounds. GLC is unsuitable for compounds that are thermolabile. ओके मतलब टेम्परेचर से जो कंपाउंड्स डिग्रेड हो जाते हैं वो उसके लिए GLC अनसुटेबल है. HPTLC stands for high performance thin layer chromatography. Okay, option A correct. High performance thin layer chromatography. Major advantage of HPTLC over TLC. TLC मतलब क्या? Thin layer chromatography. So higher resolution होता है HPTLC में. Stationary phase in HPTLC plate is usually silica gel. Application of sample in HPTLC is done by automated applicator. Application of sample in HPTLC is done by automated applicator. Visualization of spots in HPTLC is done using UV chamber. LCMS is an example of a hyphenated analytical technique. Okay, LCMS is an example of a hyphenated analytical technique. LCMS combines लिक्विड क्रोमेटोग्राफी एंड मास स्पेक्ट्रोमेट्री. उसका लॉन्ग फॉर्म में क्या है? एलसी मतलब लिक्विड क्रोमेटोग्राफी एंड एएमएस मीन्स मास स्पेक्ट्रोमेट्री. Ionization technique commonly used in LCMS is electrospray ionization. Ionization technique commonly used in LCMS is electrospray ionization. LCMS is particularly useful for analysis of thermolabile compounds. LCMS is particularly useful for analysis of thermolabile compounds. GCMS is mainly used for volatile organic compounds. Gas chromatography, mass spectrometry is used for volatile organic compounds. Hyphenated techniques mainly improve sensitivity and selectivity. In GCMS, separation of components occurs in GC column. Limit tests are designed to control impurities. Limit tests are designed to control impurities. Limit test for chloride is based on a formation of white precipitate, chloride, white AgCl. Limit test for chloride is based on a formation of a white precipitate. Reagent used in a chloride limit test is silver nitrate, AgNO3. Limit test for sulfate uses barium chloride. Okay. Limit test for sulfate uses barium chloride. Turbidity in sulfate limit test is due to formation of a barium sulfate. Limit test for iron is based on a formation of a blue colored complex. Limit test for iron is based on a formation of a blue colored complex. Reagent used in iron limit test is thioglycolic acid. Reagent used in iron limit test is thioglycolic acid. Limit test for heavy metal is expressed in terms of a lead. Limit test for heavy metals is expressed in terms of a lead. Principle of heavy metal limit test is based on sulfide precipitation. Okay. Principle of heavy metal limit test is based on sulfide precipitation. Arsenic limit test is based on Gateshead method. Arsenic Gateshead method. Radioimmunoassay is based on antigen antibody reaction. Label used in a radioimmunoassay is radioisotopes. Common radioisotope used in RIA is iodine 125. Common radioisotope used in a RIA is iodine 125. RIA is mainly used for estimation of hormones. RIA is mainly used for estimation of hormones. RIA is highly sensitive because it uses radioactive labels. कौन सा लेबल्स होता है? आयोडीन 125. ओके. A major disadvantage of RIA is radiation hazard. In HPLC, retention time depends mainly on interaction between analyte and stationary phase. Gradient illusion in HPLC means change in mobile phase composition with time. Gradient illusion in HPLC means change in mobile phase composition with time. Isocratic illusion refers to constant mobile phase composition. PDA detector PDA detector in HPLC provides multiple wavelength spectra. Column efficiency in HPLC is expressed as number of theoretical plates. Okay, column efficiency in HPLC is expressed as number of theoretical plates. Gas chromatographic columns are commonly made of glass or fused silica. GC columns are commonly made of glass or fused silica. Capillary gas chromatographic columns differ high efficiency. Capillary GC columns offer high efficiency. HPTLC allows analysis of multiple samples simultaneously. HPTLC allow analysis of multiple samples simultaneously. RF value is used in HPTLC. ओके, रिटेंशन फैक्टर बोलते हैं उसे, मेनली यूज़ की जाती है HPTLC में. RF value is defined as distance travel by solute to distance travel by solvent. ओके, उसको बोलते हैं रिटेंशन फैक्टर, solute अपन solvent. LCMS provides structural information mainly through mass spectra. LCMS provides structural information mainly through mass spectra. Hyphenated techniques mainly reduce ambiguity and analysis time. Hyphenated techniques mainly reduce analysis time and ambiguity. Arsenic limit test is known as gate Z test. Arsenic gate Z test. Yellow stain in arsenic test is due to formation of silver arsenide. Okay. Yellow stain in arsenic test is due to formation of silver arsenide. RIA is a type of competitive binding assay. RIA is a type of a competitive binding assay. In RIA, label and unlabeled antigens compete for antibody binding sites. Typical sample injection volume in HPLC is 10 to 100 microliter. Typical sample injection volume in HPLC is 10 to 100 microliter. Guard column in HPLC is used to protect the analytical column. Guard column in HPLC is used to protect the analytical column. Temperature programming in gas chromatography helps in separation of compounds with wide boiling range. Limit tests are officially described in pharmacopoeia. HPTLC densitometer measures absorbance of spots. HPTLC densitometer measures absorbance of spot. LCMS is widely applied in pharmaceutical analysis, clinical analysis, or forensic analysis. All of the above, correct? LCMS is widely applied in pharmacopoeia, pharmaceutical analysis, clinical analysis, or forensic analysis. In gas chromatography, the sample must be volatile. Resolution in chromatography indicates peak separation. Resolution in chromatography indicates peak separation. Limit tests are considered semi-quantitative test. Okay. Sensitivity of RIA is usually in the range of a picogram. Sensitivity of RIA is usually in the range of a picogram. Major advantage of HPLC over TLC is higher accuracy and precision. In LCMS, ions are separated based on a mass to charge ratio like M by Z. Okay. In LCMS, ions are separated based on a mass to charge ratio. Common mass analyzer used in a liquid chromatography and mass spectroscopy. Each time of a flight. Mass analyzer, time of flight. Development chamber in HPTLC is used for development chamber in HPTLC is used for chromatogram development. Activation of HPTLC plate is done by heating. Activation of HPTLC plates is done by heating. Split injection in gas chromatography is prepared when sample concentration is high. Split injection in gas chromatography is prepared when sample concentration is high. Splitless injection in gas chromatography is used for dilute samples. Okay. Essential components of RIA include antigen, antibody, and radio label. In limit test, test solution is compared with standard solution. HPLC mobile phase should be free from a particulate matter. Degassing of a mobile phase in HPLC prevents बबल फॉर्मेशन. डिगेसिंग क्यों करते हैं मोबाइल फेज में? बबल फॉर्मेशन को रोकने के लिए. इंक्रीज इन जीसी कॉलम टेम्परेचर रिजल्ट्स इन डिक्रीज रिटेंशन टाइम. Increase in GC column temperature results in decreased retention time. Better reproducibility of PHP-TLC is due to automated sample application. LC-MS interface is required mainly to remove solvent and ionize analyte. Hyphenated technique provides complementary information. Blue color in ion limit test is due to formation of ferrous thioglycolate complex. Zinc used in an arsenic limit test act as a reducing agent. Zinc used in arsenic limit test acts as a reducing agent. Standard curve in RIA is plotted between concentration and radioactivity. Standard curve in RIA is plotted between concentration and radioactivity. Now, ideally HPLC detector should have high sensitivity and stability. Stationary phase in gas chromatography is liquid coated on a solid support. A typical particulate size of a HPTLC stationary phase is 5 to 10 micrometer. A typical particle size of a HPTLC stationary phase is 5 to 10 micrometer. LCMS is not suitable for analysis of permanent gases. Limit test mainly ensure control of toxic impurities. RIA requires separation of a free and bound antigen. RIA requires separation of free and bound antigen. Selection of wavelength in HPLC depends on chromophore of analyte. Gas chromatography detector is placed after column. GC detector is placed after column. HPTLC fingerprinting is mainly used for herbal drug standardization. HPTLC fingerprinting is mainly used for herbal drug standardization. Sensitivity of LCMS increases with efficient ionization. Sensitivity of LCMS increases with efficient ionization. Hyphenated techniques reduce false results due to dual separation and detection. Hyphenated techniques reduce false results due to dual separation and detection. Visual comparison in limit test is used for chloride, sulfate, and iron. Strict regulations are required in RIA because of radiation safety. कौन सा रेडियो लेवल यूज़ करते हैं रिया में? आयोडीन 125. ओके. स्ट्रिक्ट रेगुलेशंस आर रिक्वायर्ड इन रिया बिकॉज ऑफ रेडिएशन सेफ्टी. Increase in column temperature of in HPLC affects retention time, resolution and back pressure. इन सब में अफेक्ट होता है अगर आप कॉलम का टेम्परेचर बढ़ा देते हो HPLC में. तो गैस क्रोमेटोग्राफी इज़ अनसुटेबल फॉर एनालिसिस ऑफ प्रोटीन्स. बट मेनली गैस क्रोमेटोग्राफी किसके लिए यूज़ की जाती है? फैटी एसिड ईस्टर्स, ऑर्गेनिक सॉल्वेंट्स, हाइड्रोकार्बन्स. बट प्रोटीन्स के लिए जो कि अनसुटेबल होती है gas chromatography. LCMS results are commonly presented as chromatogram with mass spectra. Liquid chromatography, mass spectrometry results are commonly presented as chromatogram with mass spectra. हाय दोस्तों, स्वागत है आपका अपने यूट्यूब चैनल पर. सो दोस्तों, इस वीडियो में हम देखने जा रहे हैं महाराष्ट्र ड्रग इंस्पेक्टर के बारे में. सो इस एग्ज़ाम में जो सिलेबस दिया है उन्होंने ऑफिशियली, मैंने इस वीडियो में सारे टॉपिक्स कवर कर दिए हैं, मतलब सारे टॉपिक्स हम कवर करेंगे 10 आवर्स में। ओके, तो ये वीडियो होगा 10 आवर्स के लिए, लॉन्ग ड्यूरेशन का। इस वीडियो में सभी टॉपिक्स कवर होंगे, उनके कुछ इंपॉर्टेंट प्रीवियस ईयर, उसके बेसिस पर कुछ MCQs फॉर प्रैक्टिस के लिए। ओके, तो अगर आप ये वीडियो कंप्लीट देख लेते हैं तो आपको जितना भी सिलेबस कॉपी में जो पॉइंट्स मिलेंगे, जो सिलेबस दिया है उन्होंने, वो सभी पॉइंट्स इस वीडियो में कवर होंगे। तो आई विल रिक्वेस्ट यू कि प्लीज़ इस वीडियो को पूरा देखिए। ओके, तो आपके सारे पॉइंट्स कुछ ना बेसिक कवर हो जाएंगे। तो चलिए स्टार्ट करते हैं। टॉपिक नंबर फर्स्ट, ब्लड एंड ब्लड बैंक। तो इसमें मैं क्या करूँगा, सिर्फ क्वेश्चन एंड आंसर बताऊँगा। सो दोस्तों, मैंने इस वीडियो को पूरे टोटल इस वीडियो में मैंने टोटल 3700 MCQs कवर करूँगा। ओके, मतलब अप्रोक्सीमेटली 4000 के रिलेटेड होंगे। सो तो चलिए स्टार्ट करते हैं। इसमें सिर्फ मैं क्वेश्चन और उसका आंसर बताऊँगा बिकॉज हमारे पास टाइम कम है। तो चलिए, whole human blood used for transfusion is obtained from healthy human donor. According to IP, whole human blood is collected using approved anticoagulant solution. The normal pH of a whole human blood is 7.35 to 7.45. Average volume of a blood in adult human is 5 to 6 liter. Shelf life of whole human blood with CPDA first is 35 days. Plasma constituents approximately 55% ऑफ अ ब्लड वॉल्यूम। जो हमारे ब्लड वॉल्यूम होता है उसमें प्लाज्मा कितना होता है, 55%। मेजर प्रोटीन प्रेजेंट इन प्लाज्मा इज अल्ब्यूमिन। मेजर प्रोटीन प्रेजेंट इन प्लाज्मा इज अल्ब्यूमिन। रेड ब्लड सेल्स आर ऑल्सो कॉल्ड एरेथ्रोसाइट्स। लेकोसाइट्स किसे बोलते हैं हम, WBC को, और थ्रोम्बोसाइट्स को क्या बोलते हैं, प्लेटलेट्स। मेन फंक्शन ऑफ RBC इज ऑक्सीजन ट्रांसपोर्ट with the help of hemoglobin. Lifespan of RBC is 120 days. Normal hemoglobin level in adult male is 13 to 18 grams per deciliter. Normal hemoglobin level in adult male is 13 to 18 gram per deciliter. White blood cells are mainly responsible for defense mechanism. Okay, उसको हम बोलते हैं ल्यूकोसाइट। प्लेटलेट्स आर इसेंशियल फॉर ब्लड कोएगुलेशन, उसको हम क्या बोलेंगे, प्लेटलेट्स को थ्रोम्बोसाइट्स। नॉर्मल प्लेटलेट काउंट इज 1,15,000 to 4,00,000 mm पर क्यूब। ओके, पर MM3, इतना नॉर्मल प्लेट काउंट होता है, प्लेटलेट्स काउंट। प्लाज्मा विदाउट क्लॉटिंग फैक्टर इज कॉल्ड सीरम। प्लाज्मा विदाउट क्लॉटिंग फैक्टर इज कॉल्ड सीरम। ब्लड कोएगुलेशन इज ऑल्सो नोन एज hemostasis. Which clotting factor is a fibrinogen factor first? Fibrinogen for factor first. Conversion of fibrinogen to fibrin is done by thrombin. Conversion of fibrinogen to fibrin is done by a thrombin. Vitamin K is essential for synthesis of prothrombin. Okay, prothrombin क्या काम करेगा, क्लॉटिंग का काम करेगा। विटामिन के कोएगुलेशन का काम करेगा। कैल्शियम आयन इन कोएगुलेशन आर नोन एज चैनल फैक्टर 4। कैल्शियम आयंस, उसको हम बोलेंगे कैल्शियम फैक्टर, लाइक फैक्टर 4। नेचुरली ऑकरिंग एंटीकोएगुलेंट इन ब्लड इज हेपेरिन। नेचुरल ऑकरिंग एंटीकोएगुलेंट इन ब्लड इज अ हेपेरिन। एंटीकोएगुलेंट मतलब कोएगुलेशन को डिक्रीज करेगा। EDTA प्रिवेंट्स कोएगुलेशन बाय चिलेटिंग कैल्शियम। जो EDTA है वो क्या है, चिलेटिंग एजेंट है, हेक्साडेंटेट होता है। ABO blood group system was discovered by Carl Landsteiner. Universal donor blood group is O negative. Universal donor blood group is O negative. Universal recipient blood group is AB positive. RH factor was discovered by rhesus monkey. RH incompatibility mainly affects newborn baby. RH incompatibility mainly affects newborn baby. Separation of blood components is done by centrifugation. Packed RBC are stored at a 2 to 6 degrees Celsius cold temperature. Shelf life of packed RBC is 35 to 42 days. Shelf life of packed RBC is 35 to 42 days. Platelet concentration are stored at 20 to 20 degrees Celsius with agitation. Platelet concentrates are stored at 20 to 24 degrees Celsius with agitation. Shelf life of platelet is 5 days. Shelf life of platelets is a 5 days. Fresh frozen plasma is stored at -30 डिग्री सेल्सियस और बिलो. उसको हम क्या, उस टेम्परेचर को क्या बोलेंगे? क्रायो प्रोटेक्टर टेम्परेचर. फ्रेश फ्रोजन प्लाज्मा इज स्टोर्ड एट -30 डिग्री सेल्सियस और बिलो. क्रायो प्रेसिपिटेट इज रिच इन फैक्टर 8. जो क्रायो प्रेसिपिटेट सॉल्यूशन होता है उसमें सबसे ज़्यादा क्या होता है? फैक्टर 8. उसको हम बोलते हैं एंटी हीमोफिलिक फैक्टर ए. ब्लड बैंक लाइसेंस इज इशू बाय CDSO. जो ब्लड बैंक होते हैं उसके लाइसेंस को कौन इशू करता है? CDSO, सेंट्रल ड्रग स्टैंडर्ड कंट्रोल ऑर्गेनाइजेशन. मिनिमम एज फॉर ब्लड डोनेशन इज 18 ईयर्स. मैक्सिमम एज फॉर ब्लड डोनेशन इज 65 ईयर्स. मिनिमम हीमोग्लोबिन रिक्वायर्ड फॉर डोनर इज 12.5 ग्राम पर डेसीलीटर. Minimum hemoglobin required for donor is 12.5 gram per deciliter. Volume of blood collected from donor is 350 to 450 ml. Mandatory test for donated blood include मलेरिया, HIV एंड हेपेटाइटिस बी. ये तीनों भी टेस्ट मैंडेटरी होते हैं अगर आपको ब्लड डोनेट करना होगा तो. प्रोथ्रोम्बिन इज कन्वर्टेड इनटू थ्रोम्बिन बाय थ्रोम्बोप्लास्टिन. Prothrombin is converted to thrombin by thromboplastin. Anticoagulant commonly used in a blood bank is CPDA first. Anticoagulant commonly used in a blood bank is a CPDA first. Function of fibrin in clotting is to form clot meshwork. Deficiency of vitamin K causes bleeding disorders. Extrinsic pathway of a coagulation is initiated by factor 7. Extrinsic pathway of coagulation is initiated by factor 7. Agglutination occurs when incompatible blood group mix. Agglutination occurs when incompatible blood groups mix. Antibodies present in blood group A are anti-B. Okay. Antibodies present in blood group A are anti-B. Blood group O contains no antigen. Blood group O contains no antigen. Rh positive blood contains D antigen. Rh positive blood contains D antigen. Hemolytic disease of a newborn is due to Rh incompatibility. Hemolytic disease of newborn is due to Rh incompatibility. Component used in a hemophilia A is factor 8 concentrate. Albumin is mainly used to treat shock and burns. Plasma proteins help in immunity, clotting, and transport. All of the above correct answer. Plasma proteins help in immunity, clotting, and transport. Buffy coat contains WBC and platelets. Buffy coat contains WBC and platelets. Fresh frozen plasma should be used within 1 year. Fresh frozen plasma used within 1 year. Whole blood should be stored at 2 to 6 degrees Celsius. Whole blood contains all blood components, not separate. Normal erythrocyte sedimentation rate in adult male is 0 to 15 mm per hour. ESR increases in inflammation. Erythrocyte sedimentation rate increases in inflammation. Hematocrit value indicates RBC volume percentage. Hematocrit value indicates RBC volume percentage. Blood donation interval for male is 3 months. आप 3 महीने के बाद ब्लड डोनेट कर सकते हो. Blood donation interval for female is 4 months. Minimum body weight for blood donor is 45 kg. Blood bags are commonly made up of a PVC, polyvinyl chloride. Blood bags are commonly made of PVC. Blood bank records must be preserved for 5 years. Blood bank records must be preserved for 5 years. Screening test not mandatory in blood bank is टाइफाइड, बट जो बाकी के 3 हैं वो आपको करनी चाहिए. मैंडेटरी होती है HIV, हेपेटाइटिस बी एंड सिफिलिस.
टेस्ट फॉर सिपिलिस यूज इन अ ब्लड बैंक इज VDRL। ओके, सिपिलिस के लिए कौन सी टेस्ट की जाती है? VDRL। HIV टेस्टिंग इन ब्लड बैंक इज डन बाय ELISA। HIV testing in blood bank is done by ELISA। यूनिवर्सल प्लाज्मा डोनर इज AB। ओके, यूनिवर्सल प्लाज्मा डोनर बोला है उन्होंने, ब्लड डोनर नहीं, प्लाज्मा, जो कि होता है AB। ओके, और एक्सेप्टर कौन सा होता है? यूनिवर्सल ब्लड एक्सेप्टर, जो कि होता है AB पॉजिटिव। और यूनिवर्सल ब्लड डोनर कौन होता है? O निगेटिव। सो यूनिवर्सल प्लाज्मा डोनर AB होता है। ल्यूकोसाइट्स आर फॉर्म इन बोन मैरो। Leukocytes are formed in a bone marrow। RBCs are destroyed mainly in spleen। उसको ही हम बोलते हैं RBC का स्टोर हाउस, वेस्टेज हाउस। ओके, RBCs are destroyed mainly in spleen। Anemia is caused by deficiency of a hemoglobin। Anemia is caused by deficiency of hemoglobin। Polycythemia means high RBC count, उसको बोलते हैं पॉलीसाइथेमिया। ब्लड बैंक्स कम्स अंडर ड्रग एंड कॉस्मेटिक एक्ट्स। A license form for blood bank is Form 28C। और जो फॉर्म 20 और 21 है वो ड्रग के सेल और मैन्युफैक्चर के लिए होते हैं, बट ब्लड बैंक के लिए कौन सा होता है? 28C। टेम्परेचर अलार्म इन ब्लड बैंक रेफ्रिजरेटर इज रिक्वायर्ड फॉर टेम्परेचर मॉनिटरिंग। प्लाज्मा वॉल्यूम एक्सपांडर इज डेक्स्ट्रॉन, जो कि प्लाज्मा का वॉल्यूम बढ़ाएगा। प्लाज्मा वॉल्यूम एक्सपांडर इज डेक्स्ट्रॉन। Next, ESR is an indicator of inflammation। Blood grouping is based on agglutination reaction। Blood grouping is based on agglutination। Platelet deficiency leads to bleeding tendency, because platelets का काम क्या होता है? कोएगुलेशन करना, बट ऑलरेडी अगर उसकी डेफिशिएंसी हो जाए तो क्या होगा? ब्लीडिंग के रिलेटेड डिसऑर्डर्स होंगे, टेंडेंसी, ब्लीडिंग टेंडेंसी। ब्लड ग्रुप एंटीजेंस आर प्रेजेंट ऑन RBC, रेड ब्लड सेल्स। एंटीजेंस कहाँ पर प्रेजेंट होंगे? रेड ब्लड सेल्स पर प्रेजेंट होंगे। ब्लड ग्रुप एंटीजेंस आर प्रेजेंट ऑन रेड ब्लड सेल्स। सीरम लैक्स फाइब्रिनोजन। जो हमारा ब्लड होता है, प्लाज्मा होता है, अगर प्लाज्मा में से आप फाइब्रिनोजन जो क्लॉटिंग फैक्टर है उसको रिमूव करते हो तो उसको क्या बोलते हैं? सीरम। सो सीरम लैक्स फाइब्रिनोजन। नॉर्मल WBC काउंट 4000 to 11000। नॉर्मल WBC काउंट इज 4000 to 11000। मैक्सिमम स्टोरेज ऑफ पैक RBC इज 42 डेज। 32 to 42 डेज तक आप RBC को स्टोर कर सकते हो। प्लेटलेट कॉन्सेंट्रेट इज यूज इन थ्रोम्बोसाइटोपेनिया। SOP इन ब्लड बैंक मीन्स स्टैंडर्ड ऑपरेटिंग प्रोसीजर्स। ब्लड बैग्स आर स्टेरिलाइज बाय गैमा रेडिएशन। जो ब्लड बैग्स होते हैं उसको आप किससे स्टेरिलाइज करते हैं? गैमा रेडिएशन के थ्रू स्टेरिलाइज करते हैं। क्रायो प्रेसिपिटेट इज ऑब्टेन फ्रॉम फ्रेश फ्रोजन प्लाज्मा। क्रायो प्रेसिपिटेट इज ऑब्टेन फ्रॉम फ्रेश फ्रोजन प्लाज्मा। डोनर कंसेंट इज मैंडेटरी। ओके, डोनर कंसेंट इज अ मैंडेटरी। नॉर्मल कलर ऑफ प्लाज्मा इज स्ट्रॉ येलो। नॉर्मल कलर ऑफ प्लाज्मा इज स्ट्रॉ येलो। हीमोग्लोबिन कंटेंस आयरन। मेनली HB क्या कंटेंट होता है? आयरन। उसकी वजह से उसका कलर कैसे होता है? रेड होता है। क्यों? बिकॉज प्रेजेंस ऑफ आयरन। हम उसको हीम भी बोलते हैं। हीमोग्लोबिन कंटेंस आयरन। ब्लड विस्कोसिटी डिपेंड्स मेनली ऑन RBC काउंट। RBC काउंट ही डिसाइड करते हैं कि ब्लड की विस्कोसिटी कैसी होगी। RBC ज़्यादा होगा तो विस्कोसिटी ज़्यादा होगी, RBC काउंट कम होगा तो विस्कोसिटी भी कम होगी। सोडियम सिट्रेट एक्ट एज एंटीकोएगुलेंट बाय चिलेटिंग कैल्शियम। सोडियम सिट्रेट एक्ट्स एज एंटीकोएगुलेंट बाय चिलेटिंग कैल्शियम। ब्लड बैंक इंस्पेक्शन इज डन बाय ड्रग इंस्पेक्टर। ब्लड बैंक को कौन इंस्पेक्ट करता है? ड्रग इंस्पेक्टर इंस्पेक्शन करता है। क्रॉस मैचिंग प्रिवेंट्स ट्रांसफ्यूजन रिएक्शन। क्रॉस मैचिंग प्रिवेंट्स ट्रांसफ्यूजन रिएक्शन। प्लेटलेट्स आर फॉर्म फ्रॉम मेगा कैरोसाइट्स। प्लेटलेट्स कहाँ से फॉर्मेशन होता है? प्लेटलेट्स का मेगा कैरोसाइट से। लिम्फोसाइट से WBC बनते हैं, इरिथ्रोसाइट से, इरिथ्रोब्लास्ट से RBC। ओके, स्टैंडर्ड नीडल साइज फॉर ब्लड डोनेशन इज 16 G। गेज, G मतलब गेज होता है। ओके, स्टैंडर्ड नीडल साइज फॉर ब्लड डोनेशन इज 16 गेज। जितना नंबर ज़्यादा उतनी नीडल की साइज छोटी होती है। फर्स्ट ब्लड बैंक इन इंडिया वॉज इस्टेब्लिश इन कोलकाता। फर्स्ट ब्लड बैंक इन इंडिया वॉज इस्टेब्लिश इन कोलकाता। प्लाज्मा प्रोटीन्स आर सिंथेसाइज मेनली इन लीवर। प्लाज्मा प्रोटीन्स मेनली कहाँ पर सिंथेसाइज किए जाते हैं? लीवर में। ओके, याद रखना किडनी नहीं लगाना। किडनी में इरेथ्रोपोइटिन का फॉर्मेशन होता है, बट उन्होंने क्या पूछा है? प्लाज्मा प्रोटीन्स पूछा है। ओके, लीवर। मोस्ट कॉमन कॉज ऑफ ट्रांसफ्यूजन रिएक्शन इज एंटीजन एंटीबॉडी रिएक्शन। ओके, मेनली ट्रांसफ्यूजन में कौन सी रिएक्शन होती है? एंटीजन एंटीबॉडी रिएक्शन होती है। सो इसी तरह से हमारा टॉपिक फर्स्ट ब्लड बैंक कंप्लीट हुआ। तो मूव टू द नेक्स्ट टॉपिक। So guys, now we starting next pathophysiology topics. Yesterday, AIDS. AIDS is caused by HIV, like human immunovirus, hypersensitivity type 1 to type 4, hepatitis, and hepatitis B surface antigen. So let's start. STD stands for sexually transmitted disorders, diseases, not disorder, diseases. Okay, STD stands for sexually transmitted diseases. Okay, don't confuse between disorder and diseases. Hepatitis is inflammation of liver. Type 1 hypersensitivity is mediated by E, immunoglobulin E, 1E. AIDS is caused by HIV. Option C is correct for that. Hepatitis A is transmitted by fecal oral route. Okay, hepatitis A is transmitted by fecal oral route. Normal CD4 count is 500 to 1500 cells per mm cube. Hypersensitivity reactions are abnormal immune responses. Hypersensitivity reactions are abnormal immune responses. Syphilis is caused by Treponema pallidum. Syphilis is caused by Treponema pallidum. HBs AG stands for hepatitis B surface antigen. Option B correct. HIV primarily infects CD4 plus T lymphocytes. Uh, Type 4 hypersensitivity is also called a delayed hypersensitivity reaction. Type 4 delayed. Gonorrhea is caused by virus, bacteria. Okay. Gonorrhea is caused by a bacteria. Presence of HBsAg indicates current infection. ELISA test is used to detection of HIV antibodies. ELISA test is used for detection of HIV antibodies. Anaphylaxis is an example of a type 1 hypersensitivity. Okay, anaphylaxis is an example of a type 1 hypersensitivity. Hepatitis C virus is transmitted mainly through blood. Hepatitis A transmitted through fecal oral route. Hepatitis C virus is transmitted mainly through blood. A window period in HIV refers to time between infection and antibody detection. Serum sickness is an example of a type 3 hypersensitivity reaction. Serum sickness is an example of a type 3 hypersensitivity reaction. Herpes genitals is caused by herpes simplex virus 2. Herpes genitalis is caused by a herpes simplex virus 2. Hepatitis B virus is a DNA virus. Okay. Hepatitis B virus is a DNA virus. Type 2 hypersensitivity is mediated by IgG and IgM. IgG and IgM. Type 2 hypersensitivity is mediated by IgG and IgM. Painless genital ulcer is seen in painless syphilis. Painless genital ulcer is seen in syphilis. AIDS is diagnosed when CD4 count falls below 200. Okay, mainly what is a range of a CD4 count is a 500 to 1500 per mm. Okay, but if go beyond 200, then we say that AIDS is occurred. Hepatitis E is especially severe in a pregnant woman. Hepatitis E is especially severe in women. TB skin test is an example of a type 4. Okay, TB skin test is an example of a type 4, and serum sickness is a type 3. HIV is not transmitted by mosquito bite, but HIV is transmitted by blood, sexual contact, or breast milk, but not through mosquito bite. Anti-HBs indicate immunity. Okay, anti-HB indicates immunity. Type 3 hypersensitivity is caused by immune complex deposition. Okay, immune complex deposition. IgE mediated is a type 1. Cell mediated is a type 4. HPV infection is associated with cervical cancer. HPV infection is associated with cervical cancer. Next, hepatitis B vaccine is prepared using recombinant hepatitis B surface antigen. Hepatitis B vaccine is prepared using recombinant hepatitis B surface antigen. Chlamydia infection is caused by bacteria. Chlamydia infection is caused by bacteria. Type 1 hypersensitivity is also called immediate. Okay. Cytotoxic is a type 2, uh, type 3 immune complex, and type 4 delayed. Hepatitis D virus requires presence of hepatitis B. Okay. HPV. Hepatitis D virus requires presence of a HPV. Confirmatory test for HIV is ELISA, Western blot. Confirmatory test for HIV is Western blot. Liver enzyme most elevated in hepatitis E is ALT. Liver enzyme most elevated in hepatitis is ALT. Type 4 hypersensitivity is mediated by T lymphocytes. सेल mediated hypersensitivity हम उसे बोलते हैं टाइप 4 को, डिलेड भी बोलते हैं. ओके. Type 4 hypersensitivity is mediated by T lymphocytes. Most common opportunistic infection in AIDS is tuberculosis. Most common opportunistic infection in AIDS is a tuberculosis. Chronic hepatitis is most commonly caused by HCV. Chronic Chronic hepatitis is most commonly caused by HCV. Histamine release occurs in type 1 hypersensitivity because allergy. ALT is also known as a SGPT. ALT is also known as a SGPT. Serum glutamate pyruvate transaminase. Okay, ALT. AIDS mainly affects which system? Nervous, immune system. Okay. AIDS mainly affects immune system. Contact dermatitis is an example of a type 4. Uh, Contact dermatitis or a tuberculin test also a type 4 example. Jaundice occurs due to increased bilirubin. Jaundice occurs due to increased bilirubin. HIV enzyme converting RNA to DNA is reverse transcriptase. Carrier state is common in hepatitis B and C. Carrier state is common in hepatitis B and C. Most common symptom of hepatitis is jaundice, means inflammation of a liver. Type 4 hypersensitivity example is hemolytic anemia, and type 1 asthma, type 3 serum sickness, type 4 TB. ओके, चारों के भी एग्जाम्पल उन्होंने सीरियली दिए हैं. टाइप 1 अस्थमा, टाइप 2 hemolytic anemia, type 3 serum sickness, and type 4 tuberculin test. Hepatitis virus causing fulminant hepatitis in pregnancy is HEV. Pregnancy HEV. HIV spreads rapidly due to high mutation rate, long asymptomatic phase, multiple transmission routes, all of the above. Pale stools in hepatitis are due to pale stool in hepatitis are due to absence of a bile in intestine. A universal screening marker for hepatitis B infection is hepatitis surface antigen HBsAg. Universal screening marker for hepatitis B infection HBsAg. Hypersensitivity is an exaggerated response to antigen. Hepatitis C has no vaccine because rapid mutation, multiple genotypes, poor immune response. So that's why there is no vaccine. Rapid mutation, multiple genotypes, and poor immune response. Painful genital ulcer is seen in herbs and herbs and painless syphilis. Anti-HBC IgM indicates anti-HBC IgM indicates acute hepatitis B virus infection. Okay, acute. Kaposi sarcoma is associated with AIDS. Kaposi sarcoma is associated with AIDS. Hepatitis A does not cause chronic hepatitis. Hepatitis A does not cause chronic hepatitis. Type 3 hypersensitivity example is a serum sickness. Hepatitis infection affects mainly liver function. HIV enters host cell by binding to CD4 receptor. Hepatitis E AG positively indicates high infectivity. HBe AG positivity indicates high infectivity. Type 1 hypersensitivity example is asthma. Hepatitis virus transmitted through blood products is hepatitis B virus and hepatitis C virus, means BC. Okay, both are transmitted through blood. Immune complexes deposit mainly in type 3. Okay, because type 3 is a immunogenic hypersensitivity reaction. HIV genome is single stranded RNA. Okay, ssRNA. HIV genome is single stranded RNA. Hepatitis B incubation period is 1 to 6 months. Hepatitis B incubation period is 1 to 6 months. Type 4 hypersensitivity example TB skin test. Type 4 hypersensitivity example is a TB skin test. Asthma type 1, serum sickness type 3, anaphylaxis type 1 also. Anti-HIV antibodies are detected by ELISA. Chronic hepatitis may progress to cirrhosis and liver cancer. Hepatitis A prevention mainly includes vaccination and sanitation. Hepatitis A prevention mainly includes vaccination and sanitation. Hypersensitivity type 2 involves destruction of target cells. Hypersensitivity type 2 involves destruction of target cells. STD most commonly transmitted worldwide क्लैमाइडिया. सबसे ज़्यादा वर्ल्ड में कौन सा एसटीडी डिसीज़ हुआ है जो कि है क्लैमाइडिया. एसटीडी मोस्ट कॉमनली ट्रांसमिटेड वर्ल्ड वाइड इज क्लैमाइडिया. Hepatitis B surface antigen negative and anti-HB positive indicate immunity, means absence of infection. HIV protease enzyme is important for maturation. HIV protease enzyme is important for maturation. Hypersensitivity reactions are classified into 4 types. Hepatitis virus causing liver cancer is B and C. BC. Primary chancre is seen in syphilis. Primary chancre is seen in syphilis. HIV belongs to family Retroviridae. Delayed hypersensitivity reaction appears after 1 to 2 hours, 1 to 2 days, like 24 to 48 hours. Hepatitis A vaccine is killed vaccine. Okay, hepatitis A vaccine is a killed vaccine. Immune response responsible for TB skin test is cell mediated. Immune response responsible for TB skin test is cell mediated. HIV most commonly enters through blood and mucosa. Hepatitis C commonly leads to chronic infection. Mast cell degranulation occurs in type 1 hypersensitivity. A window period is important because test may be false negative. STD caused by virus. Herpes simplex virus. Hepatitis B marker of infectivity is a hepatitis E AG. Okay. Infectivity E. Infectivity से क्या याद रखना है आपको E. Immune complex mediated damage occurs in type 3. HIV cause immunodeficiency by destroying CD4 T cells. Hepatitis D, also called delta hepatitis. Hypersensitivity type 2 involves cytotoxic antibodies. Hepatitis virus transmitted by fecal oral route is hepatitis A virus and E virus transmitted through fecal oral route. HIV confirmatory test is a Western blot. Chronic hepatitis B may lead to cirrhosis, hepatocellular carcinoma, and liver failure. Chronic hepatitis B may lead to all of the above disorders like cirrhosis, hepatocellular carcinoma, and liver failure. Type 1 hypersensitivity involves release of histamine. Okay. STD prevention includes safe sex practices, screening regularly, and education about STD. So these three methods for preventing STD. Okay, helpful for prevention of a STD. Hepatitis B surface antibody appears after recovery or vaccination. Hepatitis B surface antibody appears after recovery or vaccination. AIDS is characterized by immunodeficiency. AIDS is characterized by immunodeficiency. Hepatitis C is best diagnosed by PCR for HCV RNA. Okay, PCR means polymerase chain reaction for HCV RNA. Hypersensitivity reactions are a part of a innate immunity. Sorry, adaptive immunity. Hypersensitivity reactions are a part of a adaptive immunity. So these are the questions on AIDS, STD disorders or diseases. Okay, move to the next point. So guys, our next topic is coagulation and hematinics, antihypertensives, congestive heart failure, angina, antiarrhythmics, and diuretics. So let's start. Heparin acts as an anticoagulant by activating antithrombin. Third, a drug of choice for acute congestive heart failure is furosemide. Iron deficiency anemia is treated with a ferrous sulfate. A mechanism of action of a thiazide diuretics is inhibition of sodium chloride importer. Okay, thiazide, sodium chloride importer. Warfarin produces anticoagulation by antagonizing vitamin K. Warfarin produces anticoagulation by antagonizing vitamin K. A first line drug for essential hypertension is thiazide diuretic. Digoxin increases cardiac output by increasing myocardial contractility. Antiplatelet drug commonly used in ischemic heart disease is aspirin. Furosemide acts mainly at clofophenolate. Vitamin K is essential for synthesis of factor 2, 7, 9 and 10. Beta blockers reduce blood pressure by decreasing heart rate and renin. A drug of choice for chronic stable angina is nitroglycerin, chronic nitroglycerin. Class 1 antiarrhythmic drug acts by blocking sodium channels, class 2 beta receptors, class 3 potassium channels, and class 4 calcium channels. So, class 1 is a sodium channel. Ferrous sulfate is best absorbed in acidic pH. Ferrous sulfate is best absorbed in a acidic pH. Which drug reduces preload and afterload in CHF? ACE inhibitors reduces preload and afterload in CHF. A mechanism of nitrates in angina is vasodilation via nitric oxide. Aldosterone antagonists include spironolactone and eplerenone. A major adverse effect of heparin is bleeding, बिकॉज एंटीकोएगुलेंट वर्क है उसका. Antihypertensive safe in a pregnancy is methyl dopa. Digoxin toxicity causes arrhythmia. Oral anticoagulant commonly monitored by INR is warfarin. Okay, common oral anticoagulant commonly monitored by INR warfarin. Calcium channel blockers useful in angina are all of the above like verapamil, diltiazem, and amlodipine. Thiazide diuretics reduce blood pressure mainly by decreasing peripheral resistance. Antiarrhythmic drug of choice for ventricular arrhythmia is lidocaine. Arrhythmic drug of choice for ventricular arrhythmia is a lidocaine. Iron therapy adverse effect includes constipation, diarrhea, or black stools. Okay, all are the iron therapy adverse effects. CHF is characterized by decreased cardiac output. CHF is characterized by decreased cardiac output. Loop diuretics inhibit reabsorption of sodium, potassium, and chloride. Clopidogrel mechanism of action ADP receptor blockage. ACE inhibitors cause cough due to bradykinin accumulation. ACE inhibitors cause cough due to bradykinin accumulation. Drug of choice in atrial fibrillation is digoxin and ventricular lidocaine. Hematinics include all of the above like iron, folic acid, and vitamin B12. All are the example of a hematinics. Potassium sparing diuretic is a spironolactone. Okay. Nitrates mainly reduce preload. Nitrates mainly reduce preload. Propranolol is a selective, non-selective beta blocker. Propranolol is a non-selective beta blocker. Vitamin B12 deficiency causes megaloblastic anemia. And thrombolytic drugs are a streptokinase. Thrombolytic streptokinase. Anti-anginal drug reduce pain by improving oxygen balance. CHF drug that increases survival is a ACE inhibitors. Class 3 antiarrhythmic acts by blocking potassium channels. A major side effect of a spironolactone is a gynecomastia. Iron absorption is decreased by antacids. Iron absorption is decreased by antacids. Beta blockers are contraindicated in asthma. Mannitol is classified as an osmotic diuretic. Anticoagulant use during dialysis is heparin. Nitrate tolerance can be prevented by drug holiday. A mechanism of digoxin toxicity includes hypokalemia. डिगॉक्सिन टॉक्सिसिटी हाइपोकैलेमिया पोटेशियम कम हो जाता है बॉडी में. डायूरेटिक्स यूजफुल इन हाइपरटेंशन इज अ थायराइड. Class 2 antiarrhythmics are beta blockers. Erythropoietin is used in anemia due to renal failure. Most common adverse effect of nitrate is a headache. Angina occurs due to reduced oxygen supply. Diuretics increase urine output by decreasing tubular reabsorption. A drug used to reverse heparin action is a protamine sulfate. Protamine sulfate is the antidote for heparin toxicity. Antiarrhythmic drug useful in a supraventricular tachycardia is a adenosine. Hematinics act by stimulating RBC production. ACE inhibitors decrease blood pressure by decreasing aldosterone. CHF leads to edema due to sodium and water retention. CHF leads to edema due to sodium and water retention. Anti-anginal drugs include nitrates, beta blockers, calcium channel blockers. All are the anti-anginal drugs. Thiazide diuretics cause hypokalemia, same like digoxin. Warfarin crosses placenta and cause teratogenicity. Warfarin crosses placenta and causes teratogenicity. CHF classification NYHA depends on exercise tolerance. CHF classification NYHA depends on exercise tolerance. Antiarrhythmic drug with beta blocking property is propranolol. Antiarrhythmic drug with beta blocking property is propranolol. Iron therapy should be continued for 3 to 6 months. Iron therapy should be continued for 3 to 6 months. Nitrates are contraindicated with sildenafil because both are vasodilators. Drug reducing mortality in CHF is ACE inhibitors. Mechanism of action of a beta blockers in angina is a decreased heart rate and contractility. Mechanism of action of beta blockers in angina is decreased heart rate and contractility. Thrombolytic drug dissolve clots by Thrombolytic drug dissolve clots by activating plasminogen. Class 4 antiarrhythmic blocks calcium channels. Potassium sparing diuretic acts at collecting duct. Okay, and furosemide act out a loop of Henle. Digoxin therapeutic window is a narrow. Antihypertensive causing reflex tachycardia is a hydralazine. Hydralazine is an antihypertensive drug and causing reflex tachycardia. CHF drug contraindicated in acute myocardial infarction is digoxin. Digoxin is contraindicated in a acute myocardial infarction. Iron overdose is treated with deferoxamine. Antiarrhythmic drug prolonging QT interval is amiodarone. Amiodarone is an antiarrhythmic drug prolonging QT interval. Diuretic causing ototoxicity is a furosemide. Diuretic causing ototoxicity is a furosemide. Drug of choice for hypertensive emergency is sodium nitroprusside. Drug of choice for hypertensive emergency is a sodium nitroprusside. CH edema due to left heart failure. Congestive heart failure causes pulmonary edema due to left heart failure. Hematinics improve hemoglobin by increasing RBC synthesis. Diuretic used in a cerebral edema is a mannitol.